quite honestly, I'm not going to speak to 117 right now, but I'm not hearing any major complaints. I think say they don't kind of iron out because I think they give alternate numbers. Say if you call 117, I don't get the number then I have, but I know that alternative numbers were given out. So if you keep calling 117, you don't get a reaction, then you can call anyone by the number. And unfortunately, I don't think those numbers are free. So if somebody don't get credit, invest better now for continue for call 117. But another hear too many complaints about delays. I think say everything. No, I think the one that will be to do the prank calls. Then maybe I think the threat of imprisonment and whatever don't go down well. And I suppose if you do a prank after a while, you just say it against because you get for stop. I mean, it's not interesting, it's not funny. You tell where you go to call for serious thing, then when are you the call? If they don't answer you, it becomes a problem.
Seem like 1-3 it depends now with all the question and technical one. They even we get for with 117 and all the things that we generally supposed for to do. But we side the calls and they come up plenty. I mean, we 117 days. That
No,
you
no,
know
that no, that one I do not have an analysis. Like I say, we are taking over at the time when na lockdown. So we focus now for get the sensitization out, get the reports back in and whatever. So for sit down for do all that, and I think the national spokesperson and will be the best person for give all that information because I actually right today I haven't been to the EOC at all for morning a client town a day because we try for sort out some the teams there for go out and whatever. So in terms of a general picture of what is happening, I really not go. I think on our best bet now forget Mr. Jamiu. Get Mr. Jamiu na
we'll get you back. I mean, we don't say you don't get.
No, definitely. If I get
different
more
radio program, then go on for talk to you later on.
yes, no, that is yes, yeah. Yesterday they called me, but I was trying to like get things moving. So
But
I
John,
think
before yesterday, John, we doc Francis so and they talk about fake news.
Yes.
And I know say that na concern to plenty of we.
Yeah.
But so far, how you see the media enrolling in this fight, the traditional media?
I think the traditional media is doing very well, quite honestly. Because a lot of information is going out. If you listen to the radio, I think anybody who listens to the radio and say, you know nothing but this, then you know really they listen. I think anybody who they listen not get enough information. The aspect of fake news, for me, probably one of the most frightening things that can happen. Because the fake news now, one, the fact that you don't even know that is started, that's the most difficult part. Because if na slap person, they can't slap you, know, say this person slap me, I go hold am. But when anything and they start, by the time you there, number one, you don't know how far it don't go. Because by the time it gets to you, where you see it don't probably go all over the world. Then number two, you don't even know side start, so you don't even know what to do about it. The corona, I think the fake news, even the way they come at the highest level, international level, in terms of whether it actually exists, whether it not exists, whether it not 5G, whether not and then of course the various levels and different types of possible cures and remedies and this and that. So there's a whole lot out there, and it's really is scary. I think say I can say some of the things that they say basically about ginger and lamb and honey. That's in a way we all be known for steam yourself. This now me no say what small. Me gonna need a boil tibu. She puts me over the cover moose blankets as a big small fresh cool. So that I know. So that then they talk and now the people in Fonduam, it's not a big deal. But sometimes some of these things can be dangerous if the person don't know how to handle them, especially when it comes to medication. You begin to talk about chloroquine now, you begin to talk about this tablet, that tablet. I think say that they own it's scary because somebody go and when person don't drink medicine, something happen to her. I know you're not able to talk say this I don't do. Yeah. If I go steam yourself, do this, do that, and then they own it's a local remedy. If you not do you good stuff, you not go do you harm. So but when it comes to tablets and other things, I think people need to be careful. People really need to be careful. And I think saying we on duty as the response team for give out as much information as possible, so that people can always verify against what they say, whatever else they hear. And then the fact that there's a spokesperson, I think they need to do regular updates. Then they help the situation for at least we have a lot of information out there. But well, for me, fake news is a scary phenomenon for the two reasons I highlighted. That you don't know side they come out, so you don't even know would have to deal with, and you don't know how far it's gone. Yeah.
And from the updates and reports that really come from AOC and the government, if I not say Western area urban still the record high number of cases. It's like Western area urban are the epicenter now for the virus. I mean, we any plans for we get to 14 days or lockdown?
I would say yes, there are plans, but whether those plans will be executed or not, in fact, the plans are not complete. But whether they'll be executed or not, that's another thing. We need for completer and see whether it's something that can be done. The cases are high in Western area, but also members say out of the 7 million people in this country, 1.2 they are. so it's a corresponding number. If you get 1.2 million people in one out of the 16 districts for a population of 7 million, then obviously the higher numbers, and Naya will get the highest numbers of slums. Naya will get, so it's not. I don't want to say alarming, but it is not something that is out of place, because if there's a higher number of people in there, and Naya we get the entry points from the Naya the airports day, definitely a lot of the overseas travel way, at least we consider Sinadandi one of the major ways of which with the virus they come through.
But they say one case of corona is one case too many.
Yes, definitely.
The amount of contact we So if we talk about 119 now, that's
it's high.
That's really high.
It's high because if you even times down day by 10, because some people are also saying that that's for every one case that you know.
That's 119.
Yes, it's really high. It's really high. But after the 3 days lockdown again, we get to go into maybe more long-term measures for social distancing and other activities that would sort of calm the spread down a little bit. Okay. I think, say, now that we don't realize, say, we really have the disease and we have it in country, I think we need to take maybe more permanent measures to ensure, because we all don't start now.
Permanent measures,
so some already don't start, like spacing people out more in the markets, trying to decongest certain areas, the doff courts inside and they all, because we all now.
How will that be done?
We know. We still have to get into the details of those.
Okay.
But we all don't know now the buckets and the washing of hands. Then I think say most people and they do that, the wearing of the masks. But I think say the one side way we define difficult are the distancing, because then they own schools and all lock, so then they don't keep the beginning at house. But how sustainable can that be? So all of those things I think we need to start looking at. But as I say, we're just coming in. The guy for take over me district done first, and then we'll see with between the city council and the EOC with the thing that we're able to implement.
All right, that now Miata French in the district coordinator for the emergency response. Of course, if you don't follow it in the app in the county. Now popular name and voice when it comes to elections, but now it help as well with coordinating within the app in the county as we all put forces together and minds for able to deal with COVID-19. We want to take some of our comments and we get Aminata Finda Masakoi for help with that.
All right, so I have plenty to thank to you, John. The first person they say, I pray say this go be the last lockdown for the corona sick. Now the country, and that God will help we for get rid of this sick. This they come up from KYs, now Susan's Bay community. This other one they say, I enjoy the discussion with Dr. Lako. They say we get people now my compound when really they deny say this sick here so day. And I believe say this discussion don't they help people for believe say not so team for play with. This they come up from SOA. This other person, they say, for we help for slow down the spread of this sick, security personnel then for ensure, say, the ambulance then where they work across the country, then for search them, sober one, so that they no go, they pack people inside, they pretend like for, say, na corona victim them. They say, this na Salone, and we know what money can do. We need for take this case here, so on this fight very serious. This will come out from Dan Kamara. Another one they say the nurses them, doctors them, members them, the government, journalists, IRN and all Sierra Leone them. He say we need for team up and fight this deadly sickness. And no say Salone na one. This they come from Asan Banke Nagbe. Another one they say Madam French, he say thank you for your work. He say Duya, waiting at the latest on case 90. This na big concern where we get because this man go just dey shape the sick for one place to another and nobody not tell we what's am yet. This na from a concerned citizen. Another one they say we really need for tell the government thank you. Then they try because if they not be done, they do things them from trade. This sick for don't take over the country. Now from Amadou na Makeni. And this other one they say we dey beg governments for let them press EDSA for giving lights na Mabore community because they, from last week we dey in darkness. How you go there inside us? Lights not there. Do ya papa government una help we? This other one they say do ya una tell the police say youth man them na Bombay streets. They seriously disturb with peace na the area. Una help we because we need for they na us and concentrate on waiting they happen na the country. Another one they say I wonder why people no they take waiting governments they say. After God na government this they come out from Ibrahim na Abadin. We go only stop this sick if we come together. The security need for enforce the law, especially na the checkpoints them, and for no others them forgive pass. Some man just they pass and not get nothing for do not treat. This they come out from Amadou na Makeni. This other one they say Western area coordinator. Dia tell we wetin are the source of the transmission as at now because we can confuse. We don't know other get the sick from other no get them. And wetin make una no go disclose the person where don't run away with this sick. Some say the community people then go sabi the person and go easy for arrest the person. Now all this I get for now.
Wow. Thank you very much, Amin Atafina Masakwe, for that. Case 90, Nanka under the area again. So, waiting to happen, the person they ask, honorable for Fenam, Usaide, honorable for Trisam, and somebody else they ask, say, why make you not disclose the identity? Because that way they plenty people go sabiam and then go talk to them in Sian on side or they are on side.
I don't get an update on what happened with case 90, but I promise I'll come back and give an update when I have it. I don't take and long. I'll go back and go because now it's a health and a security issue. So I think it's another way with the streets. But I'll come back and give an update on that because I really not get.
So now that now health and security, we know the security aspect and announce the name of the person.
Well, that is not my decision to make.
But would that be a decision you would love to make as the coordinator or the rest?
If I've been in here for talk about my personal decisions, I will talk about them. But I'm not.
I mean, in your capacity as a coordinator, not so. I mean, as in your personal capacity.
I know. But I work in a team, and I might.
So you wait for the team for make that decision. But
yes,
this is something that will come.
I know. We look at various angles, but as I say, I'm not updated on what is happening currently. I take the issue of Bombay streets.
Yeah.
When myself passed the Ganges now, I saw a lot of movement. But as I say, most of what I see, now people there with buckets and 5 gallon, they try to get water. So I don't know, maybe other people they use that, just like I say, they use that as an excuse for do other thing them. Source of transmission.
Yeah.
We don't talk. It's difficult and it's difficult to accept. It's frightening. Because I think that is the difference between the Ebola who know and this one. Because Ebola is difficult for, let's say, this person gets it, you don't know. But somebody gets Ebola, the visible signs are there where all man they see. This one now, you can have it and you don't have symptoms. So the source of transmission, they say, is droplets. And if the droplets get into your respiratory systems and then you catch it. But how these droplets they get are the frightening part because you can there you don't know you don't know you pick it up and you take it away. You know they assume say anybody not get them because they look healthy. So that nine are the thing they make we all get for be very, very cautious, because I might look okay, I might sound okay, but at the same time I'm still not okay. And
Strong message they pass on. So no walk around with assumptions. Say everybody around you is fine.
no, I think you work
Make
out the
sure
assumption that everybody's not fine.
Exactly.
And then you'll be fine.
And then you'll be fine. Thank you very much. Thank you very much. We don't get good time with Auntie Miata with the information we don't pass on so far.
Yes.
For EPWI, with within the Western area, they do Western area urban. They do for able for bring the virus under control. Now you talk about what the water situation as well. Where you come, you say you see people in Bombay Street. The possible in our water them military forget. Information wise, within the district they do for make people we know say the problem not going to be solved in 3 days under lockdown.
Yeah.
But a lot of coordination they go on for ensure distribution.
Yes,
And then different
yes.
So
We actually get a long meeting with all the various people who have been here for support, and one of the key areas was the water supply. And so we not hear people in complaining say they not get water.
Okay.
And I think say they really they try for like fill up whatever whether or not they containers and tanks they within the streets and open taps periodically, so people then can fill up them containers and go back home.
Okay.
So we don't get no major water complaint yet, because I mean this is not the two. I think say yesterday a lot of people let me get water we didn't keep today now. Some supplier has been made, therefore all man don't come on our streets or sometimes popping up in some side, and then we'll see what we are hoping that up until tomorrow water resources Guma Valley Salwako go able for at least continue for our system, make sure say people can get water, because there was also an appeal that the security they also even the streams that really close by, people they want to go access them, and then they make they also just make sure say they observe social distancing, but at least let them give them the leeway for able to do that. So but we also that appeal so yeah, let people not misuse them, because when the security then vex now, then it becomes something else. So yeah, in as much as we did try for make let them soften a little bit and allow people in small movements for that essential thing, but let people not misuse them.
All right, name now Mayata French. Continue further with the program. The district coordinator for the emergency operations now the country. Well, continue to send you a message to 077-981-981. One more time, 077-981. Or if you watch me live on Facebook, drop your comments in at the Radio Democracy Facebook page, and we go take you comments. Now forget this now / Iron Corona updates program where they come to you as part of your own contribution to the lockdown, for make sure so you not get enough information, correct one them as well, and know waiting for do around 10 there or so. Tiana.
And this program they come to you from different radio stations them all over the country. Well, we don't get another studio guest who don't join we. In a Sine Kamara, in the head of the burial team, manager for mortuary services, for Ministry of Health and Sanitation, and same way so in the publisher of Health newspaper. Mr. Kamara, welcome to the program.
Yes.
So you can start for telling what you work involved.
Well, me and the head of the burial team for the Ministry of Health and Sanitation and the manager, we come on board not for fully burial team, only the general public are shocked, because there is a woman in the social media, because we know say Salone man quick then going to social media for begin life for people them. This team here, the Ministry of Health and Sanitation, together with the Emergency Operations Center and with the intervention of the coordinator, the way they do appoint, they make sure say we come on board for assist people and for collect the loved one the way they die in our house. Where this standby burial team now free of charge. Nobody not going to pay 1,000 for collecting body in our house. And we role is that we coordinate with the 117 for giving all the alerts them. And I want to talk to the general public, say this is not a national fight. This is not all the time for blaming A or B. This is not the time we all come together and make sure so we're able to combat this thing for stop na Salone, because they put food behind, and we put food behind, we all go know the economic impact we go create. So now make I want to show the general public say now the line of 117 very choke up, so people don't get forget the patient and beer. And like for instance, the waiting happen concerning an issue na Waterloo in Liverpool Street, like me born Liverpool Street within Central part here. So as soon as I get the information, I decide for take my vehicle and call Liverpool Street for cross check. When I cross check, we find out in Waterloo. And I think them don't call 117, but because of the line choke, myself get for decide for call the manager on board, and manager discuss and get for get the information later, then send them to we. After they talk to you now, so we don't response, now Waterloo don't collect that body. Me as the head of burial team for the Ministry of Health and Sanitation, before this lockdown, because for the first 3 days lockdown, we collect 72 corpses. Based on that, we also for put more measures and more preparedness in place for make sure so we assist people and for collect the loved ones and our hosts. So what me do as the head of burial team, I decide for get a 16 where I put 2 now Waterloo for make sure so they assist people and because they call as far as Tombo, as far as my 38 for collect the loved ones because some man are Christian. And can one keep in body for count and a mortuary. Then I put 2 team dead western area. I put 2 team within the municipality here for assist people and because we get destitute already there as well. And the destitute deaths are on the increase because most of them are homeless, people on the other side for live. As you can see where they give food to them in the street. Most of them are so they can die. As soon as they die, then colleague they all go grab, then go, then commodate. Now we then can call at the end for collect them. So now I make at the talk to the general public say this is not a national fight. Everybody for patient and be calm. Now, only one great challenge is again at the provinces. But thank God, as the head of burial team and manager for National Mortuary Services, during the past 3 days lockdown, we don't coordinate with staff there with mortuary attendants. They all get now 6 mortuary because not all about to get mortuary attendants there because of the mortuary facilities. So I may put a standby in Kenema, Bo, Podloko, Moyamba, Lunge, and Cambia, the workers, they attend and say them for their preparedness because we're going to lockdown. And this lockdown, for make sure so we assist people them. But the problem within the provinces, then mortuary, then they don't get ambulance for assist people them. But the hospital at the end get for assistant, the medical superintendent there. So anytime they get death case within these 3 days lockdown, they can provide them for the mortuary workman and collect them at the provinces. But inside Western areas, I can tell you, my sister, yesterday to today, we don't collect over 30 corpses in various community. And we will find out, now picking them more they die. And this is not the time as a nation for Moscow for ask yourself, why them prepare they die? So government will put more preparedness and more measures in place. Why them prepare they die? Because most of them are houses they will collect them. And I want to tell the general public say this.
So how many ambulances now they use during this time?
Well, as I can talk to you so now, we get 6 teams. We're able to talk to the hospital, then help with ambulances plus the one that will get during the normal days for collect destitute. Because normal time for the past 15 years, I made they collect destitute in the streets for keep them as pop and a mortuary. If people are not can make take them for burial. So any month I can beg 30 to 40 people there now in a mass grave. So the ambulance they will get to put 2 now at as I can tell you, we put 2 now long there, we put 2 central parts now. The one they will put within central and the one they will go na bad go and then Lolo ambulance and for assist people them. So that's now one of the main job for assist. And we say kudos to the Minister of Health, the Permanent Secretary, the Coordinator of Response, and Dr. Vandi, and the coordinator of them. And even Mr. Jamil, I will say kudos to them because now man, one thing he recommend people that really perform very well. You know, so I say kudos to them for reasons for make sure say they support this team and give it all the logistics for make sure so support the people and collect their loved one. And this, I want to tell the general public, this is not a political fight or neither any other fight. This is a national fight. Right now, this thing don't disturb all. People are for go from one point to another now, they know. So this is not for politicize this fight. This fight will all for put hands together. We'll make sure say we'll give you only to support. Like as for me within the first 3 days, what I do? Now me mobilize my own guys them when I volunteers. When they go in another government payroll, they don't do it with me for over 15 years. I mobilize them the first 3 days lockdown. Even some of authority no know the impact we get for create. Now after everything on done, we then find out say over 72 corpses. And that 3 days lockdown, we not get 3 days lockdown. We that say we own lockdown, they extend it to 6 days because waiting do. Some of them corpses are how they collect, how they count in mortuary. People then can kind numbers for can collect them. Pass will get for play some amount of professionalism. Like the past 3 days lockdown, we go to the number 4 days, we collect 72 corpses. We'll find out say people that don't book well with talking about social distance. I get for call intervention of the police. The police then can provide security where they move the people in now some distance. And I even call the intervention of the mayor. And now one of the biggest challenges and the world they undergo as the burial team. The other challenges that will go to my sister, people that cost the burial team so much. Like the number 3 case over in Kisi Road. How Ebola no and Corona no real. The government don't pay now for kill people them. When I don't come bury, they'll go for kill now. Pass at the end, I may get for give them some amount of social wait itself. I say, but this we na burial team. If the government don't confirm, we not to we they confirm. We then not mortuary for support people then for make sure say this thing not spread. So the people don't get for understand, say, we not to lab or laboratory they work on either surveillance team or this. So we rather una self go on your own support. If they say this is a positive case, una get for be calm, una get for be patient, una allow the government bearer. Then the other challenge we they face, my sister, is that now this cemetery business. Now make a call upon the National Civil Registration Authority. This is the time they self for come on board now the Emergency Operation Center. They go the kind of then 3 days lockdown there, so then self for come on board. After the 3 days lockdown, they self go can show them some amount of professionalism. The people that go can mutual in numbers and go they try to give them burial permit quick one for going to the various cemetery then and involve the Freetown City Council. Because some of them people are in a Muslim, they don't want to keep their body for long. We know our traditions. Hey, granny me don't say we die, now for beggar one time. No, granny me don't say we die, then for go beggar and so side. So now make they involve all sectors for make sure say they come on board. So then go able to don't stress now the Connaught Hospital mortuary.
So how can handle then the body during this 3 days lockdown?
Well, we work together with 117. Now 117 they give we all alerts. If they find out say this case where they call for it meets the case management, what they go do? Then go make sure say they tell the family members to let them patient and inform the contact tracing. But if the case not meets the case definition, then they say, well, this now na code. If na Muslim, at times people are not in kind of mortuary. 117 can give them code, then go na births and deaths and then arrange for the cemetery. But if na Christian, if they want out on a mortuary, 117 can give them code, then can at the hospital, then can at the hospital. If na normal days, we can send them a bank, then go do them payments and collect the ambulance and go collect the dead body. But within the normal then crisis time, they are in a lockdown or coffee order. If you 117 call, nobody no go pay for single cent. And at the tell the general public say, any team we go for collecting body within these 3 days, we ask you for money. Call me when at the manager of mortuary or head of burial team on 076 762287 and I corruption, because the emergency operation center with the Ministry of Health and Sanitation don't provide 360 liters for we now within Western area for assist and collect people then from my 38 now come inside for collect all them body then they. So now I make we self day for make sure so we support government, we support everybody because this is a national fight.
One of the challenges mentioned of now do I get for do with cemetery. What's exactly what's an experience with regards to cemetery?
Well,
cemetery they don't full up. No, they forget access.
No, the cemetery not full up. The cemetery not full up. Now the involvement of different sectors. Like for example, so there are protocols for the cemetery, because without the protocol, person go kill person overnight and go beggar. Use the advantage, but for go bury somebody, you get for go through. You get for get death certificate. If not get death certificate, you go to the births and death and obtain a certificate of cause of death. From there, you forward and go to city council. City council and then get a cemetery. If you go city council, you go pay for your grave 25,000. From there, then give you all the process. But during their lockdown, they would involve them for letting themselves come within the mortuary sector. So people are not going to move too far. But for all they together now, at least now communication. This is an advanced world we deal with now. If we don't involve the Freetown City Council, then self day. The bat and that self day. So as soon as they don't form the bat and that sector, then cancel the city council. The person within a city council could just call, if na Kintom, they go call the Kintom cemetery. Now for provide 2 cemetery. If na Sakila Road, now for provide 2 burial space. If na Kisi Road, you don't see how the coordination is there. Or to say any other battle, now the requirements. And now, after that 3 days lockdown, people are frustrated. Now, for example, now we don't go take body today na Tombo. You expect if you're a Muslim, then people then go, can waste the money for can't take them body. And they don't go want no delay. And we need for satisfy them. So now I make myself the play of professionalism and make sure say I involve all sector. And I so self go for do. I don't call Mr. Parker yesterday. We don't dialogue yesterday. Then self don't go ahead say as soon as this thing they done, then self they prepare if not 3 or 4 grave, now different cemetery for make sure say we reduce the number of people that really can mortuary for crowd because we are observing social distance.
Okay, now come to Madam French. You know the Western Area Urban Coordinator for COVID-19, and Mr. Kamara don't talk about the plenty challenges that they face, the issue of cemetery, the one for do with vehicle, and of course the 117 response.
Yeah, I think Mr. B don't talk about the clogging of 117 and the fact that with the key, the kind said don't give numbers. So say if you get, if anybody get issued and get issued 117, let them call. Because everybody they call 117. 117 they deal with the entire continent of return number, so anybody from any side they call. So sometimes the lines get clogged up, then of course you get the one that they do the prank call, so then send not the app. But like I say, it's now all work in progress. As the sick they expand. We hope say not go expand too much. And so we said they try for expand for meet up and challenge along the way. One of the things that we talk and where I want for touch on and appeal to them, comrade them is that the picking the way they die. Because I think say waiting not happen, the comrade not afraid for going to hospital now. So we find out say most of the under 5 care with the picking and get for suppose forget they know they get them. So they know they carry the picking and go for McLeod, then they carry them go hospital because man they afraid say if you go picking body one small and go tell and say you get corona then. So me want to appeal to the comrade and say do ya. Now at the end of this we will get the statistics from Cine, we will talk about that, and we will do a special sensitization on that. They say, yeah, if you pick in for get markets, carry and go get the markets. Because if you not, we will not realize the importance of markets. If we say no more the markets and for them go give the card.
But is it, Madam French, is it mandatory now that we picking on a hospital if na markets they go for or something go in body warm small then for test time? Is it mandatory?
No, it is not. Now? It's not. I mean, if you go, you complain certain thing then maybe then go look at the case and decide whether they for test you or not. But I think the people are just afraid. One, because they're afraid. Okay, we all know 50% of picking they all say they knows they run.
Yeah.
Anybody who don't meant picking no than this. So if the non-toxic one of the thing then na cold, it's cold like symptoms, then that combra gets picking gets small cold. You go to look and say, no go. In the meantime, you don't miss a measles maclate. You don't miss all the other things that we supposed to forget way for prevent from other things that will go kill. So with the appeal say do you the combra, let them carry them picking and go. This is also the time for going away in hospital. If the picking get cold, if not cold they get, I think say the nurse then they all know that and they say most of the time picking will get a smaller nose and get not necessarily mean to say now they will take you and carry you go na an isolation or a treatment center. I think say now that's the cause the problem we find out say picking and they die. So we'll continue for appeal and maybe put that as part of sensitization when they go to the communities and say yeah. In fact it did it already. The teams that we go out to tell them say let them not avoid hospital because of corona. Any other complaint where you get you can still go and then go treat you for that.
So during these 3 days lockdown,
if now emergency you can't come out, you get for call 117 and then they go can pick you and carry you go. But other than that, you free for go. But during these 3 days, no. But after the 3 days, would have been done due for maclate. Make them go take their maclate and let it begin and not die because of this. Because it look like for say a one cancer like the other thing them now they want for kill people and pass the corona safe way now with the try for address. So that's one thing. Of course, the issue of burial and waiting that I should say by now. I'm seeing an experience man. You know way.
He mentioned about the confrontation with the cost with the experience as well.
Oh, well, the animosity day because of I think some people still get not too good memories of Ebola. But we want it's not as contagious as Ebola than now one, even though the way it passed might make it frightening because as I say, you have to assume say everybody know all right, so let you go all right. But it's not as contagious, so therefore, people are not for be that frightened about it because as I say, 80% of people will get until they don't don't even know if anything be do them. Whereas for Ebola, most people when they get you they know. You feel them.
He only break you down in 3 days.
In fact, and then they make now as
but
opposed
at the
to
same time, when the burial team they go take the body, enough for the in that kind of tense mood.
Yes, instead for relax more and realize say na burying the people and get in as much as you see and say now you walk, but you job na somebody in passion. So let's say for know how then they approach people and give them the assurance they then go get access because another line the problem because people have just get a feeling they say just like for Ebola the only two way that it happen they will can and carry the person go then can quarantine una then go bury. But now that is not the case because the transmission not like Ebola where as them they tell we don't send they say that when the person not die and that and the sick one for come out. This is not the case with corona. So even if now corona the person die off, now COVID die off, then go still come and take and go. If that is established that is what the person they might go and bear, but then will still come back to now, even though now go they probably in quarantine because if I don't get one person inside the house will die, that means we all for go through quarantine. But I think say that there's a more humane way of going about it.
Yeah.
And I think people need to just calm down and obviously it not be like a Ebola where everybody they go through the same whether you die of that or not. Because at the time that was what was required because people let me hide. But now I think say they carry the corpse and go, and then for them one that we don't want for the mortuary complete the process for them. They get their corpses back and they do it in the way they want. So I think they say that there was a time when, as I say, I tell a few people, say, as they appoint me somebody, first person complain, I never tell them this, but the first person complain with the Lena Sine. but of course I mean try for calm things down and whatever. I say, oh that my way in a mortuary Sine. I say, Lord, calm down. I will find out what's in the information and get back to now, which I did. You know, if I know that, but I did, and I think say INSEF now you don't manage for understand exactly what should be happening, and it just need for say because not all saying I ain't go did it. Sometimes the team the way they go there says they not get that human face for say okay well all the people are not bearing and get they as far as they're concerned now and they work they can do so a little bit of empathy.
Well, get any challenge?
No, well, I just want to add to what Madam Meata the talk, and some of the challenges that actually they face because we don't get an experience doing the Ebola. Like everybody know the role I play doing the Ebola in terms of talking to people, in terms of sensitize them. Where I may get me biggest respect in a salon. When one of the biggest challenges they get with family members, not to say they try for share out, you get government requirements how many people in for attend cemetery per burial. But now we know say one thing about death is inevitable. That passion where somebody die. It past 500 people will go out attending burying. So tell if now somebody way good now, my sister, nobody know one left for that burying day. It's a bit Salome, I'll get one tradition. If I not go this man burying a bad name, they don't pay school fee for me picking. So within that intervention, the way they talk to people, they now say, this we need for observe social distancing. We need for do this, we need for do this. People at times can frown. At times people can want to take the body, like most likely, because I'm talking about positive case. They can want to take the body for past 4 houses them, which is totally wrong. If outside the person die, if they don't pray, at least from that place then I forgot at the cemetery, but some people want to take the body, say if they don't be lost now okay, and they don't be list for past and difference. I win at the biggest problem and they will be encounter. Which of course we not go do that. And other complaints the way they get is that one thing about when somebody die, if you don't know what to kill them, the only person we go satisfy for sure this person died from this sick is a medical doctor. If you clinically that person not seen by a medical doctor, the only person back we go ascertain the true cause of death now the pathologist we go do postmortem. So if it's somebody come we die, brought in death, we'll get them. Doctor then go specify that language which I mean. Brought in death. Though death certificates not there. As head of burial team and manager for National Mortuary Services, Mr. Enogo Kanomo say can't take this body for go wanted. At least let there be a coordination, a consultation with authority that are concerned. One thing about Sierra Leone, we'll get to call denial syndrome. Somebody go talk say Sine do this today. But if Sine do nothing today, what problem can I go deny Sine to him? So now he make if we dey release corpses, because the other problem, 117 call for collect this corpse come. So then say for can't come for care and go na other facility, we no get problem. We no go see person corpse. But also you call the 117, we don't know what may happen there. What's gonna be the next plan? So I get for tell say when I get for inform back 117 and tell them.
So for you, the issue you can get now process. Now process. Somebody want for can take body, but nobody now sign the lease and say I'm gonna mortuary and mortuary can release unto owner or 117 or officials there around no call you and say this is the instructions in there. We ask that this body be released.
Exactly.
Now the issue down the
yes, sir. From the day when they call me.
And most times if you get it, you only go on it. It's enough, say nothing.
Yes, but then call me now EOC and then give me all the SOP for burial. Okay. So now as my boss they talk now, everything they go on smoothly. Okay. Because we don't get a simple understanding. Okay. Because one thing about life is coordination. If that cleaner, where the cleaner, that corner, if a camper fight, involve them, ask them, hey Mr. Cleaner, how this cleaning they go? What you involve? What are the challenges them? You get a first class information. The person where they go na the field. At times, first when they go to the field, you ask them, he go give you an information where no match with the people the way they do the job. So like me now, what I expect from the authorities them, gladly for Madam Miata, I was shocked. Day before yesterday, Fuad now go meet me. He says, Madam Miata wants to be you. I go inside the old boy, I no go near the mame, I go catch in a corner, and I forward can inside back. So I really appreciate, say some of them people that they recommend we. But me, na man we stand on me what? Me na man we stand on protocol. Like doing the Ebola, everybody says they die. What make everybody safe since they die. There was a poor SOP where they developed during the Ebola 2014 to 2015 as alone. And I go confirm and to you say I beg the first confirmed case. And inside that 3 months, I beg all them body then they. The problem is that during the Ebola, they may decide say for take all corpses to different to Waterloo Cemetery where some people don't know the place of. Because some man getting granny when are 90 years, some man getting granny when are 100 years of age. So they say it's not Ebola related. So at that time, all body in Waterloo, people don't know me please about when up to now as I talk to you so, past during this coronavirus, so don't stop for exhume people in body. But people they come for exhume them body. For Canberra and other facility, we not to me Ebola related. But now, with this corona kind side, we see the intervention of the government. We see the intervention of various sectors that when they come on board. Now we develop an SOP. Even the confirmed case, I don't beg 8 confirmed cases as I talk to you so. I beg 2 na the provinces. And the 7 na Toria Begam, 1 at Kisi Road, 1 at Kintom, 1 at Ascension.
Okay, so we they sound say Aber is put in quotes is scary. You have a team where they work on that.
A
Right?
team is
It's
16.
not you going out there,
Yes.
not digging the graves.
No, the grave diggers are there.
Exactly. So you have a team.
Team
Exactly.
of workers.
All right, clear.
Where they assist me because one man cannot do. Me one going to go to 20 diamond. Pass them quarantine me to man.
I mean, also have to ask in terms of protective gear for members of the burial team, and more people they show interest for be part of the burial team.
Hey, my sister, the call what they receive, they say this na money making. They say that past Ebola where them they pay 500,000. So now making calm them down. Say this time government not give me the mandate, and the workers they will get together with the volunteer. The way them they assist me for collecting them proper then at it for 15 years. Where any disaster will come, any sickness will come, they can assist me back. Now many they work together. So as I talk to you, so now in terms of logistics, I they give the Ministry of Health and the EOC A1 because these people get gloves should be sufficient, we get body bag to be sufficient, we get all protective gear to be sufficient, even the field self will get insufficient.
So
now make a call
so
your
I
attention.
just say the reason they make you say it's sufficient now because the deaths they not happen as they happen during Ebola. That's why you're saying it's sufficient because if the deaths they happen like I been happen days you get 10, 15, 20, 100 people and they die. How then you go understand.
When I am
what
that,
I really
I am
just
that
say.
go thank you because the death of coronavirus is very minimal.
Okay.
Like at waiting until me at the top, the major cause of death now,
Okay.
we are glad we self say they take into consideration. People they shy for going to hospital. They take answers then go to hospital so that they go test us and test them for quarantine them. And general public I don't know sure say when you go to hospital, they no go quarantine you so. There are process where you go through, where you go see medical doctor, you go see nurses. Do you not afraid for going to hospital? Rather than you don't house you die, that's not going to tell well for you. Because the more you don't house, you get more sickness and the more you get pain. But if you call the health workers then for make sure say they see to you, at least then go ahead for save your life. Even yourself then come them, do you not take your picking eye down? Take your picking can't go to hospital as usual. Because what to make the picking they die, and the comrade they cause this problem, they don't want to take them picking go to the hospitals them. This is not the major problem. But within these 3 days lockdown, facility not the back for lady comrade and take them picking them back for going to hospital. So now I make a call upon the names for make sure say themselves very proactive in this time round, for make sure say the assistant comrade and for carry them picking them back in the hospital. But the problem lies to the comrade and the problem that now I make a call upon all Sierra Leone and for make sure say this is a national fight, not put politics there. Now for make sure say you support the president. Look the one bright example, president isolating himself because of him God. Why can't you Sierra Leonean join together for make sure say we build up Salone? This is not the major problem. Now make me say if I talk to some of your authorities them, like what anti-miata do, you no go sit in a corner, they can't tell you blue and white, you take her. Call the post within at the field for the Italy give first class information. When you get first class information for the post where they do the job, it able help you for plan in future. And when you plan in future, you go expect successful something. Like what anti-miata do. But some man there at the corner now, because of your own personal gains, they intimidate, they talk about somebody. Like during the first 3 days lockdown, now Mr. say it's my initiative and involve myself. I involve myself. The only person who assist me at the permanent section at the Ministry of Health and Sanitation, when I buy fuel for me together with the Minister of Health. But together now round, the post where Mother Bio appoints, when I pack a content, itself understand the dynamics. Itself know the problems so with the way all they undergo and Solomon Jamu and Antimiata, then series is out and provide fear. And now I see how the job they go quietly and peacefully. Okay. The only problem I say, the people don't blame 117, the line choke. The line choke. 117 they call am for diamond. 117 they call am for sick man. 117 they call am for ambulance. 117 they call am for pregnant woman. And they do a recommendation. Or to say I they tell the waiting for do. Because we are talking about advanced world. This is technology world. 117 is a big department. If they divide the department into 4 apartments, specific line then the way they go call if now for pregnant woman, you know, say now if for call directly. If any boss we call, we not a relevant caller, the NATCOM go able to track them down. If specific center the back for dead body, not dead body they call.
But if you don't give the recommendations, they also before now.
Yes, I don't do them. I even put on my reports. I mean, don't do them for the past 3 days lockdown. I don't explain to them. Even the manager, man, they communicate as I talk to you. So now, what do we do now? For long, not get problem to the public. We call find out say the line they choke. Man, they communicate personally. As you can see, my phone. There are a lot of alerts the way they come for me from WhatsApp. Now, so they exchange the messages them.
So now one of the feedback then the way you get when you put forward the recommendation.
Yes, yes. But now the coordination is very cordial and alerts they come to time. But we find out the network back at times can delay. So now make the call upon the public for exercise patient. This people are not going to do one really lean for allow you get it body in hours for 2 to 3 hours to 5 hours. We self in human beings. Network they when our technology it can fault it. So now make them self for reasons and keep the patient and patient 3117 answer and call.
I make for understanding that the publisher of the health newspaper. I mean, how do you use this paper and the day-to-day activity of Sine, or you provide public information on the current sequel of the effect COVID-19?
Well, during the Ebola 2014, I mean, I'm the first responder, and I may beg the first case, and the past government not me take the thing to seriousness. With the then minister Namiata Kabo at that time, at the Ministry of Health and Sanitation, because me the beg destitutes, as I can tell you, for the past 15 years. And most of the measures then during that time, then I may make them put them in place. And time can then find out say Sinen as somebody with straight. Me, I need the burn, I need the take. But for in terms of satisfying the public, for the government, it's my priority. And nobody now Salone no go pull me down. We make ready for support any government we can.
So newspaper now you talk
about that the drive council.
Or na information.
Well, now that the drive council now. Now that the drive council. What to make open the newspaper? Now doing the Ebola. We know me not get correct channel. Now me get no correct channel of communication. So immediately after Ebola now open this newspaper, I say we not get right platform in disseminating health information. One who lack about health education, sex health education, different health education program will not get an Salone. So me decide for open newspaper for portray, for tell government say these are some of the challenges and the health facilities that they're facing. Okay. These are some of the challenges and people in the remote village they face without getting better health facility, without not getting ambulance, all them things. And this newspaper now for the public and the government for call their attention say we need for develop the health sector. Look other Africa country them. Then get advanced machine then why Salone? Look at how we call on begin member for procure ventilators. In another country, then get all those sophisticated machines. So now one of the missions is this way make I get the health newspaper for support government. Who say no. We go come make them inform.
But even in the sophistication, the advanced country then they get the medicine they wouldn't get, the equipment they wouldn't get. Corona no get respect.
No, I'm not talking about
for
corona.
sophistication.
I'm not talking about corona.
No, I'm just saying that within the context where they talk and think they what they talk about now. So, which you wait till they do so now. Respect not for sophistication.
No. Corona is too hard. So now for put hard measures in place as voting President Beyonce.
Okay. All right, we'll come back to you. Want to take some comments and few things that we don't get, but. One for quickly updates on within the region as well. Look like the Mano River Union. So we get Liberia, Guinea, Sierra Leone, and Cote d'Ivoire, and the amount of cases where we don't get so far. Now the country them combined. Now, as of the 3rd of May, when I be 7:30 yesterday, with this information be released. Obviously. We own information about the updates today come out around 11 o'clock. And then the other one, whether they don't come out or not, we can confirm that. But so far in Sierra Leone, as at yesterday, the numbers don't change now. In Sierra Leone, we get over 160 cases. Let me go to that and bring you the other countries first before we get Sierra Leone, so we can give you exactly what's in Sierra Leone. Liberia get 158 confirmed cases. Guinea get 1,650. Cote d'Ivoire 1,398. Active cases na Sierra Leone 1,129. That's according to within the John Hopkins University Gitu report. In Sierra Leone, the active confirmed cases, the numbers are up as far as within we get concerned. But let's move on to Liberia, Guinea, and Cote d'Ivoire. Liberia get 82 confirmed cases. Guinea 1,206 confirmed cases, and Ivory Coast 728 confirmed cases. Recovered. The one away from Sierra Leone recovered at 37. From Liberia, 58. From Guinea, 437. Ivory Coast, 654. Deaths in Sierra Leone, 9. In Liberia, 18. Guinea, 7. And in Ivory Coast, 17. Alright, so that narrating, basically, we don't get so far. We want to take a quick music break. We'll come right back to Una and take some comments before we get Sine. We're not the head of the burial team, and Meata French way they heads the Western Area District Coordination for Left Wing at the studio. But quickly, we will come back after this break.
And all the other area them, they. Me now na Pikin Mahmoud Kamara. And una way sabi me can call me nice guy. I want make we all know say Corona day and it a kill. Make we reduce body contact. Make we wash we hand them fast. Make we stop for touch with face for now. And make we avoid place outside people boku. If at all you dey go na crowd place like market, make sure you use face mask. Make we take the advice where the government and the well-bodied people they give it.
But not touch and catch nose. Corona the kill fast so try no. So wash you and daily boy yabo at least 20 minutes if you not lazy. This thing don't kill you from China to Italy. Economy they drop down heavy. No believe nobody. I'll lecture you daddy, sanitize your whole body cause corona is deadly. Social distance, public gathering. No make like you not busy cause this now warning. Line news 117 at 5 mil. So tap all the shake that nigga with a brain, no cough or sneeze. Now crowd put you max or not touch or wash them man say precaution. This now message from Mr. Nice. Corona is healed, so take advice.
Now we for effort up the sea. Hey mama, but on up take precaution now. Corona is healed and most people they die every day. Hey, sister up take precaution now. Hey.
If they say wash you and no ask if they cook now for make corona, no go catch you by hook. Life now one all and set like a book because corona no they play and for killing no they test so take the precaution. Where the doctor then they say keep a social distance, no hug, no handshake. Wash your hand with soap and sanitizer for keeping life safe. You want cough or sneeze, use pocket sand or your elbow. Prevention is better than cure. Health is wealth, but what's na Ebola? Now na corona. Papa God help me because this is don't wanna. Mosque, school, church all locked because of corona. Hey Papa do ya na you intervention we need for the suffer. Because you not proper for see me people and they die. Papa legs say we know sabi God.
Now we for effort up the sea. Hey mama, but on up take precaution now. Corona is healed and most people they die every day. Hey, sister up take precaution now. Hey.
Listen to these wise words. Follow the bylaws. Be careful of this virus. I mean coronavirus. It kill people every day, so never make too much confidence. It don't kill so many across the continent. Plenty still live under oxygen, so for more resistance, no we keep a social distance. Wash your hand regular, don't forget to sanitizer. Never play with your eye and your nose, avoid neighborhoods. I feel panic, why everybody's epidemic. It starts in China, Europe and America, now in Africa, yeah.
Now we for effort up the sea. Mama, but on up take precaution now. Corona is healed and most people they die every day. Hey, sister up take precaution now. Hey.
Justin Jonesy on the beat.
People una kabo, me na Kindo Amani, comedian na salon. One sick don can our country it dey right now what they call COVID-19. Where they come out by the corona tumbu, and I want make we all the look we safe, like how we dey look we fambulem na house. In case some of we feel some of them sign there. Una listen no, me lovely people them, una listen fine. One, na dry cough. When me say, when you cough dry one, the bolo no dey come out. And you dey cough pass mark one, pass the normal time where you blunt cough. The other one na high fever, where you dey get pass mark one body. Something they touch your chest, touch your back. If you feel the temperature, they go past IBD. You dey feel cold, you dey tremble, or even the tire pass mark one. Pass how you normal tiredness day. Some people them can even get wound inside their throat, what they call sore throat. You nose they run pass mark snot water. You nose they block. You aid the heart. You dey feel pain or you dey run belly. Me sister, me brother, if you feel some of them thing there, just sit down and you all suffer. Call 117. Then go answer to you quick one and tell you waiting at the next thing what you for do. Not go nowhere. Not allow person safe for come to you. Just sit down and you host and call the emergency line 117. Do ya? Make we all tin up tranga one like 43. Make we not allow like this sick scatter in our country. Make we stay safe so we go save life for we tomorrow bye.
This message they come to you from BBC Media Action and UK aid from the UK government to the IGA project Gidi Kopo.
All right, welcome back to Sludge Iron Corona updates so they come to you on different radio stations in the country. And Mina John Conte, I did at the studio with Tiana Alpha. We know they talk to you, but waiting on the app in this is not the program where they bring you all the information you need for know and what you supposed for do around the 3 days lockdown where government announced say we get for they under for ensure say we deal with the spread of coronavirus. Well, on the line now we want to go now put local and talk to the district coordinator for the emergency response day in name now Moses Kamara. Moses, good afternoon, welcome to the live on Sludge Corona update.
Yeah, thank you for having me.
What's on the happy in your district with 7 cases so far? What you not only do for curb the spread and for reduce the curve?
Well, first of all, thank you so much. I want to make it very clear that all the cases in Port Loko district are what we call imported cases. Nevertheless, we are handling these cases very well. Of course, I took up duty here on the 27th of April. We contacted the city council, district council, all the stakeholders, inter-religious council, the local authorities, the medical team, the security personnel, ARSLAF, ONS. The response was excellent. We've been getting a meeting now, the command center, and at the DHMT in Port Loko.
Now, 7 cases. Waiting don't be the contact one or how much people on other reach in terms of the one that are in our primary and secondary contact there.
Yes, I need to tell you when I say we don't do a very thorough and excellent contact tracing. In fact, right now in the quarantine home, we have 14 travelers. And the 14 travelers, hopefully, will be not take swab on Sunday. If the results come out negative, we will release them all from the quarantine home in Port Loko town. And we have a treatment center in Lunge, where we get about 17 inmates. Then cases, they will get one when an isolated case. That means not a COVID, but within at the treatment center, then they observe them for other things. But because you don't get COVID, they're not put on directly with the infected people. That is what we are doing presently. And in terms of the primary and secondary contact, we had a case about a few days ago where somebody come out, he passed na the sea, he came inside Namasoila town. He did it precisely in a contest street. We do excellent contact tracing. We get about few people right now where they put on observation, and the person in question we don't open back the lodge when at the holding center for them to observe them. We don't do the swab, inception results not come yet. For let it be positive or negative. If negative, we will still pull them out. So far, so good in Potloko district. Inside Potloko town, as I'm talking to you, we depend on mobilization. Every place is calm. People are complying very excellently.
The 7 people waiting at their condition, then stable.
The 7 people in condition, then stable. The 7 people in condition, then stable. And according to the medical doctor, hopefully, within if any other thing not occur, we they announce some releases them. I know they call the amount because until we do that to the medical team, we not they disclose anything.
So okay, so how I must tell I can only test them for confirm before now they get released done. I mean, we're not released none yet, right? But I must tell them another one test, and I must tell them for one before now finally confirm say the person now negative, and we can release them.
Then we don't release people and before me they come, but from the 27th who I come, we have not released anybody yet.
Yeah, so that's what I'm asking. I must tell when I go for run the test for confirm the people and say they're negative before now they release them.
Well, normally would they run the test after when they don't pass the first test, then then the treatment they not say they not get the symptoms again, would they run the test. Even when it's negative, one of the major reward institute sometimes which is pleasant for them. I say make them give another 28 to 48 hours for make we run another test before ever would they execute the release. Because we don't want for make mistake go there, we release them, we go into the public and we get an alert back, it will be disastrous. So far, Potloko, COVID not enter the populace. This is a very good news.
You they say that on another community spread, the one that we now imported cases, they all in a treatment center, and so far unable for deal with the disease already.
Yes, this is what we are doing, and in fact, we don't preemptively prepare in case of any eventual say case. We don't get Lokomasama. We get about 16 beds. When I like a CCC, a community care center. That is in case anybody can with a CC, he is symptomatic, but if they complain or whatever, now they would go put them before they care and go. If the swab prove positive, they care and go to Louis.
All right. What if there is a case reported, like you say for now, another community spread? But what if there is a case reported, we know from within the quarantine homes they own get or quarantine center every day? What thing go be on a plan? What thing go be on a protocol for halt right there and then?
Well, now the protocol I explained so we have like upward moving trend. We are starting from Potloko town. Potloko town now they do the quarantine. Then if we see say the case, they give some symptoms because some people then they get symptoms, but really they say they are really infected. This is how this virus they work. So what we are doing, instead of we put them direct na treatment center, that is why we are preparing Lokomasama. It's like a midway. Now they would put them first. It's like like foresee if the case they come positive, or negative. If it come positive, then we move towards the treatment center in Lunge. Well, if it come negative, we swap them twice and we discharge. This is what we are doing. We have also had the good luck forget we partners them, Care, Health for Coalition, Red Cross. We have visited another center at the Potloko College where they don't offer for condition for we 48 seater, 48 beds. Then they do the toilets for we and everything within the coming weeks, just for boost up with preparedness in case of eventuality.
Moses, thank you very much for joining we now this large Aaron Corona update program.
It's a pleasure for me. Thank you so much.
Thank you. That now Moses Kamara, the district coordinator for Potloko district, we're going to talk to we and give you an update about what they do so far for able for curb the spread in the district. Once we clearly mentioned that there are imported cases, and so far they not report any infection or new case now. The community safe now Potloko, those ones were all from different places, but then they within the treatment center. I mentioned that they're stable as well, and it sounded optimistic that they're going to announce, the release of some of them, and they just know, but give the number, but until then confirm that the test then come back negative again. Well, we want to take some comments. What you not only say, you not only listen to we, and the question they want to get, the concerns we want to have for is, as I feel that massacre don't join me again and you go get with the comments.
All right, thank you again, John. The first one, they say if somebody recover from COVID-19 and get contact with somebody, we get them. It will get the sick again. This, they come out from Amadou Namakini. Another one, they say we need unity for end the sick. And this not the best term for division. We need for let we say from Santos Namakini. Another one, they say good afternoon, IRN, the lockdown good. But we na Shenge Kagora chiefdom, we get problem with price control. Everything don't go up. That's the come up from Fode Conte. Another one, they say thanks very much to the panelists them for what they dedicate to general public. They say a glady because they land Bokutin but the sick. This is from Usman Mansari. This they say a glady for a say for collect the body na free. Do ya una giving number for call if they ask for money? Because Bokutem then they waiting and they talk, not so that they happen. This is from some concerned citizen. This other person they say, Auntie Miata, how you feel say this sick go down with the way and manner how Salomon they behave? We not believe nothing and we can put politics for all things. This other one they say the 117 problem go able solve if they give the code by district level or provincial level. Because the one side can pass mark with the kind information where they can say. This other one they say plenty thanks to IRN for the correct information where we had the pass across the country. But we want to know the difference between signs and symptoms for corona. And Timiata as coordinator, what thing you go point out as challenges so far? That's not from another concerned citizen. This other one they say, Sine, we still get people where they get funeral service in a church or mosque. This they say, Salomon they play with trouble and with life. We need for fala, waiting government and well body people they say. The last one I go take for now, they say, Auntie Miata, una thank you for the work. But do ya? Then side they treat people then. Una they follow up because we see one video where they show about how the place not they clean and the people then choke one side. Una tell we the truth and una need for look inside. You know go treat person and you go to other sick. That's now all waiting comments. And before I go, we want to give out the updates, the status updates for today. Before we come, the salon status updates. They say today the total cases of the confirmed positive cases then are 178. The total number of people that we don't die so far na 9. Active new cases then where we don't get na 12. Active cases where na isolation centers them na 132. Cumulative recoveries, that means say all the one that we don't well from the sick na 37. Number we currently in a quarantine and the one where they don't quarantine now 1,385. Number discharged from quarantine, that means say they one will be not in a quarantine, but they're not getting sick, they don't left them. Now 1,721. That's not all waiting we get for now.
All right, thank you very much, Aminata Finda Masakoi, for that information. They will continue for David. We want to take some of our comments that we on our own sending and get a response to them. Matimiata, we want to start still with you. Somebody talk about the treatment center them. If we're not able to monitor them and see what's in there happening there.
Yeah.
And another person asked about the challenges we so far you don't see and how far able to deal with them. You want to take that one and the first?
Yes, I think say I will start with the question about the centers. I think one of the challenges we'll get now monitoring. Because as I say, when it started, I mean, small scale, it was being handled at national level, but as we get more treatment centers, more quarantine homes and quarantine places, we need to expand the team for to get effective monitoring for sure. Say, we provide the right conditions for people there for doing a quarantine and for be treated. So that is one of the challenges that we have first off. So the fact that we see the video, then they, I think say also they emphasize that point. They say we really need for control and monitor a little bit more and ensure say the cleaning way for happen on time. Whatever the people forget and get them and then get them on time, because if you bring food can for me 11 o'clock or 12 o'clock, you say na breakfast, then you don't fall short of what you supposed to do for me. So all of them things, we get the complaints there, we try for look into them and ensure say we strengthen the monitoring so that we know where they get then gaps. Then we also see just in the same video about the cleaning of some of them treatment centers, and we need for ensure say that they happen and they happen on time. I think say a special kind of training need for happen for them people that wait for the take care of them place and because they need to understand say we provide an environment where when people then go inside, they don't want for the continue for the infect themselves. So so but it's work in progress. The other big challenge we'll get now the psychosocial aspect, because we don't get too many trained people and we find out say because of the nature of the sick, the tendency for every person denies I not get a day, and the trauma from Ebola also day, because even when the person accepts say yes I get immediately what they think of now waiting they happen to person who been get Ebola we know. So now two things they are bug with the denial and the fact that okay even when I accept I panic, and therefore you go find out ways and go say oh then tell this person but you know they agree for go with he say you know go come you know go they not for go admit I never can go so you know they agree for go. Not that because you not believe, because sometimes they actually they believe, but then get that fear they say now death sentence. And I think say part of the problem now waiting the international media be don't portray, because they know they give like how be not good figure. So if you watch when this thing just starts, Italy, Spain, they never they talk about that recover. They only tell you say, oh now this new case and I never don't die. So always in people that they see now people that they see can they die. They know they ever tell with that party they say the recovery. So I think so we own methodology where they try for tell people and say okay in as much as people then they sick, but we get people that really well. So I think say that they will help for calm down, because what see the international media we don't they give we miss ourselves at some point. I mean wait for this sick people are not really well. Now they demand so I think say this method where they adopt for they say okay well people are non discharge. Some man be they quarantine, but not so they already quarantine sick. We don't let them go. I think say that they help a little bit for, but that psychosocial aspect that we need for work on that. And of course, we're not the time for talk this social distancing. Africa man will not able to understand that they now. Say no can hear me. Not so because I don't like you. In fact, because I like you, I don't like you can hear me. So I think say that is a big problem. And quite honestly, sometimes it is just not possible. The place tight. We they admire them public institutions like them banks and whatever, then they try to maintain inside. But the one that they left now they wait, then you know crowd down. it is okay. Una team up, so we know they allow now for going inside except 5 or 10. But then we didn't do 7. They know they realize say the reason we made they allow una all for going inside because they don't kick out. So una not kick out na do. So that day I think say it will take time before we able to understand say this is a very very important pass. And the mask again, if you tell somebody say wear mask, we get from know how for take care. Otherwise, you infect yourself because if you don't block them. All waiting for cancer, you don't carry the mask, but then you don't handle the mask properly where they pull them, then it becomes a problem. So all that thing and then are some of the challenges we'll get we need for continue for do public education for let people able for prevent themselves from not getting the virus. Then they ask for reinfection. Unfortunately, again, that is a question that nobody know able to answer it. For say we person don't get them. You know, we get again, like I will know for like things like measles, chicken pox, and things, so we don't get a one time. But that question, even the West able to answer it, we still wait for see if the research and whatever they do, then go for come up with an answer by the same way the virus they don't know sometime soon. But again, that don't mean for see people and for be careless. So I don't get I don't well. So it means I don't get again. So you just left yourself. On the issue of price control, I think that's something where a lot of discussion. When a big number will get for big the people there. Because you can't now at this point decide for the increased price because you think say something the way you only add to people in stress. And it's not good for you because sometimes the way you the price, sometimes you don't go sell and you go for go and go back. Especially now with coffee day. If you keep the market to the pin price, say even say you not sell, you can't go buy money you don't pull. So these are now small appeal that we'll get for continue for make.
Okay. I
don't know if I get any.
Yeah, somebody be asked how the sick go on. Interesting question he be asked, but
the sick go on if we all do it, we're supposed to do. That is not to answer in question. I don't think it's an answer in question, and I think it's a national effort. We all get for make the sacrifice. You will get pura, you know, say you know for choke people and they you will get Okada or bike. You encourage as much as possible. You self they use the sanitizer, the passenger they let them go to wash their hand. You within a neighborhood where they say lockdown. If you even forget more than your neighbor, there you help them and say hashtag not forget your neighbor. So at least the lockdown no go to. I think we all get for make the effort. This is not to anti-matter in question. Anti-matter not get the answer. Now everybody in question. Anybody able for doing a small thing for make. Let it sick done. But I'm not going for give the answer there.
Sine, somebody asked again for the number we ever call if anyone from the burial team then the member then we go they take money from them or they request money for collecting the body.
Yes, I mean don't do announcements since yesterday to the general public. Any person so far within a different community where the standby burial team for car assist for cow the body required for take 1,700. Make sure say you call me at the head of burial team on 076 76 2287 076 76 2287. All the body the way the burial team for collect within these 3 days get for be free of charge for collect and kind mortuary. So dear our general public assure that now get for support we. Human beings, you know, say we're not perfect, but people then still go and take the advantage because of people that they cry, pull water at the eye. So anybody you see, he collect money to person, make sure someone call me. I go make sure say a discipline, and even the police are going involved and become like criminal activities because the authorities that will concern the Ministry of Health and the Emergency Operations Center don't provide fear, and after the lockdown, then get for getting a small incentive for motivate them. At least that for satisfy them alone. Even as I talk to you, so we buy 1 bag rice. Yesterday we cook cassava leaf. Today na beans we cook, so that for satisfy them. So anybody will ask una for money, una make sure say una report to me on 076 76 2287. And the other text that they say, if you then still the church body in a mosque or church, I think this is not a question you go for ask yourself. Because this question, they don't talk about this over a month now. Where you get you burying, if na Connaught Hospital you demand it, you count only 15 people with a distance. For car you pray, you 30 minutes, you go back now, you go around. If you na funeral alone the body in a Colombia, Davis na didn't go service and but no mortuary cannot go take your body for say for go church am. As soon as I can see now one of the challenges there so they face some people can say past and carry this body go to church. And waiting government don't say all funeral service or all church service or mosque prayer for stop with immediate effect. And we they observe that na mortuary. Since the president announced that we are observing all the protocols. So they are not taking the advantages for go pray a person. Even Jesus Christ have not be prayer in a church. So people have for understand say this not the time, this not emergency time, and everybody for understand say we ready for combat system. When I keep the patient, after all thing done, we go begin pro people there. Be my family.
All right, thank you very much, Sine. Well, Antimiata, time to each now for you left. We want to ask, after day 3, waiting on how they expect to go to happen, information we go to come in, the amount of contacts they want to expect from it. Waiting go to happen after day 3.
Well, as I say, one of the main things there for these 3 days that follow do contact tracing, because it's not always easy when people and they up and about for able for trace people we sometimes the person we they may not test positive, they don't do line listing, then for call all the name there, the one that way you don't get contact with. If everybody they are all around, it's not easy. So we are using the next 3 days for do that day. And they do some amount of random community testing, especially in that side and way maybe we don't get 3-4 cases. So we appeal to people, they let them not refuse. If they say they want to test you, with the big say yeah, make your agreement, then test you. Now because we just want to know how far this disease don't spread, so go begin for take more precautions for stop the spread and for take care of the one that we sick. So basically, this thing and then do ya we sit on our house and this not so party because I think say this day don't die down now with people and they ask for the lockdown, like out and they ask for the Christmas and the New Year. But I think say this now a time for we all stay home and observe what they happen. Stay home in case they need for can contact you. Stay home and stay safe because when you come out, you don't know. As I say, my own policy is assume say everybody else, including myself, so we're not okay, and then we will all be okay. But if we begin make exceptions, say, oh no, this I not see and so I look alright, you never can tell. The person sometimes strong enough. It can get it's like this virus, it's like the one that we drink. Or we they drink land or pull myself day. You get the people away, as they drink 1 pint, you know say this equilibrium don't change. So man, he consider drink 1 cartoon, but they still work as straight, it talk sense, so that's so the virus day. So man go get go ever no say anything to him, he go pass you all right. So man, if you touch and small no more, you don't begin tremble, you don't get fever. So now we take and so say, not so because we all the pass with it, and not me say
everybody immune system.
Yeah, sometimes the person don't check, but he don't drink, but he not drunk. So now so we for take and say, it can be say the person okay, they work as straight, but so he don't drink.
Interesting. I like the way Aunt me after they pass the information. It go now you hear the stick there. It sounds it's soft, but you know say
But I think so basically that is it.
Exactly,
that is it.
Exactly. Tiana.
And I think the information really they go down well for Antimiata and Sine. Somebody can send a text message where the person say the 117 line can choke whether they will get different line per district. Maybe for like cable for call.
Well, thank God the coordinator there 1990 at least single able pass on the information. Me as for me, because we within at the field at times who can get first class information. So now I don't do my recommendation instead already. At least instead by the idea because 117 is a big department like we are big, so we then go divide into 4 categories. We are in like now we get 117, you go say get 118, 119 and then 110. At least now they go able help for salvage the situation. So now I talk to the general public say let them keep the patient, let them keep the calm because the system choke and the internet facility back can disturb them. So let them be here because this is a national fight, it's not to politics. So now they talk to them. Though again for 1 second union they back really take advantage for killing company. They take phone, you call 117. We're ready for trap at this time. Because it happened during the Ebola, then it happened during this past 3 days lockdown. Now God reached and killed the man overnight. The second day of the lockdown, then go bury him, but God so lucky in 1 foot so.
Now through the police so I can get information.
Now the community at times, because we people then can pass, the one in 1 foot saying show. So then they dictate say, oh, then bury somebody here. So then get for inform we, based on my experience what I get for refer them at the emergency operation center. We then get for meet the police, they write a request for exhumation, we'll get for exhume the body. Even during the Ebola self, it happened DJ Clef, we then cleaner. So when I make the 117 back, what I do, based on my experience for the body business, I go meet them, I explain it and say, whether they take certain information, they get for ask who to call POD, that's not the place of death. Then waiting actually inspire the cause of death because we get an issue with medical legal cases that are cases of investigation where involve post-mortem. Now, for example, if you must bang somebody, you don't go give the people and code directly for burial. police get for examine that body, the way the pathology get for car examine and get that certificate. So in case now, Pekin, digging poison at us, you don't know if na person game, you know go give them code for go bear and they get for do postmortem para. Somebody hanging self na us. You know, go take phone, you call 117 and 117 give you code for go back and then get for do postmortem. So those are scientific terminology what they use in postmortem. So the 117 and self don't fail because I go explain to them because I know me get some of their experience and the way they even appreciate me because this now like what they talk in a collective responsibility because some of the information they don't get them. But now that they track people and down, we involved in accidents, we involved in another cases them. So where would they left as the burial team? Would they go together with the police because they get for snap the scene of crime?
Okay.
Because some evidence not tamper. So I make you need this job. You need people that will get experience.
So I can get any form of training for members of the burial team.
Yes, me and the pathologists will organize them. Okay. Will they organize them on a daily basis? As I can tell you, normal days. Now me this way they gather them people with the die in the street as proper. For any month, they beg 30 to 40 people in a one mass grave in Tom. For the past 15 years. When I mean self, they use my own personal resources. They only provide for me a single ambulance where they assist people on that. Even with this corona cancer now they use. Anytime when they say disaster now they use. So I make what they call upon the general public for reasons. And they talk to the government back. Ebola don't pass. No, not try for decentralized mortuary services. And we not go only able for this only mortuary facility na Freetown. We need for decentralized mortuary services now. Because some of the instances where they happen, we need for at least the help people there. Like we don't get this corner to refurbish and fine. We go to Kenema, we make Kenema young fine. We go to McKinney, we make McKinney fine.
But
we go to
we don't go through the Ebola 2014. I mean, you don't make all the recommendations.
I mean, don't make a sister. Salary go talk to your time, pass the boss. But this time around, God don't go with president so called talk and do. And I hope say if don't get any challenge there, maybe don't discuss. And with matter of time, now make the call upon them back because you know say the government overloaded. So they appeal to them, say this time the time around now, at least let them develop the mortuary facility. And make they call upon the Minister of Health and the government for sure say we decentralize mortuary services. So anytime when you say something happen, we're not going to say we go take that body in Abo because person not go die in Abo. They can't keep an Connaught hospital for camp preserver, which is totally wrong. We need for decentralizer for help the people in Salone. You are the call upon Sierra Leone and they all put them together for make sure so we combat this thing. No blame 117, no blame burial team. When I get the patient, with matter of time we will collect on our body them. But if they ask for money, when I call me, they are family.
All right, thank you very much, Sine, for your time, and we also want to say thank you very much, Auntie Miata, for your time and the information we don't get on /RN Corona Update program. We go for this break. We'll come right back. After the break, we go on the final bit of information we get for another this segment. Mina John Conte
and Mina Tiana Alpha.
Mina una pikin Mahmoud Kamara. And una way sabi me can call me nice guy. I want make we all know say Corona day and it a kill. Make we reduce body contact. Make we wash we and them fast. Make we stop for touch with face for now. And make we avoid place outside people boku. If at all you dey go na crowd place like market, make sure you use face mask. Make we take the advice where the government and the well-bodied people they give it.
But not touch and catch nose. Corona the kill fast so try no. So wash you and daily boyabo at least 20 minutes if you not lazy. This thing don't kill you from China to Italy. Economy they drop down heavy. No believe nobody. I'll lecture you daddy, sanitize your whole body cause corona is deadly. Social distance, public gathering. No make like you not busy cause this now warning. Lie news 117 at 5 mil. So tap all the shake that nigga with a brain, no cough or sneeze. Now crowd put you max or not touch or wash them man say precaution. This now message from Mr. Nice. Corona is ill, so take advice.
Now we for effort up the sea. Hey mama, but don't have to take precaution now. Corona is ill and most people they die every day. Hey, sister not to take precaution now. Hey.
If they say what you and no ask if they cook now for make corona, no go catch you by hook. Life now one all and set like a book because corona no they play and for killing no they say so take the precaution. Where the doctor then they say keep a social distance, no hug, no handshake. What you hand with soap and sanitizer for keeping life safe. You want cough or sneeze, use pocket sand or your elbow. Prevention is better than cure. Health is wealth, but first na Ebola, now na corona. Papa God help me because this is don't wanna. Mosque, school, church all locked because of corona. Hey Papa do ya na you intervention we need for the suffer. Because it's not proper for see me people and they die. Papa legs say we know sabi God.
Now we for effort up the sea. Hey mama, mama, but enough for take precaution now. Corona is real, and most people they die every day. Hey, sister, enough for take precaution now. Hey, 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 hey.
Listen to these wise ones. Follow the bylaws. Be careful of this virus. I mean coronavirus. It kill people every day. So never make too much confidence. It don't kill so many across the continent. Plenty still live under oxygen. So for more resistance, no we keep a social distance. Wash your hand regular. Don't forget to sanitizer. Never play with your eye and your nose. Avoid neighborhoods. I feel panic. Why everybody's epidemic? It starts in China, Europe and America, down to Africa. Yeah.
Now we for effort up the sea. Hey mama, but enough for take precaution now. Corona is real, and most people they die every day. Hey, sister, enough for take precaution now. Hey, 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 hey.
Jesse Jonesy on the beat.
Ona adu, ona kushe. Me na Honorable Aliyu Ibrahim Kabaya. We una all sabi as Honorable Koyo. This message we at the center now about the deadly disease where they affect with today. Now we country and all over the world where they call coronavirus.
Coronavirus, that's equal kilo. Coronavirus, not good for me and you. Coronavirus, that's equal kilo. Coronavirus, not good for me and you. It no kind by tribe, it no kind by religion, it no kind by party. Whether they red or green, coronavirus, that's equal kilo. Coronavirus, not good for me and you. So let we fet let this thing no more now we. So tell you party, corona now we enemy. It don't take over the world, yeah. It don't even stress we all, yeah. But if you do it in well for the people, then say make we do. It go fine for you, it go fine for me. Corona go. What's you on fast?
All right, welcome back to Sludge Iron Corona Update. So they come to you live on the community radio station where they near you. So you did not the country. Well, we come to you live from Radio Democracy right here in Freetown, and John Conte. I don't know the studio with Tiana Alpha. Well, we want to talk to the head of police media now, Superintendent Brian Kamara, for telling you what's happening so far. They two updates, the 1 day 2 updates. Welcome to Sludge Iron Corona Updates Media One.
Thank you very much, brother.
Police, what's happening so far when the lockdown start? Order, incidents that we, don't be reported as far as control concerned. What's happening so far? Different from the previous lockdown we've been get?
Well, not much difference, but we learn lessons from the last one. And so we make sure we not repeat some of the things that will happen. Like the area of the checkpoint is a challenge in the sense that the last one, we only get to do it. This one, somebody will physically and show you.
Okay.
But this one now we use now e-pass. And so initially we may get some issues because the phones away they and for the one we now the main checkpoint them. Okay. So but we can create. Okay, you get too many other checkpoints them around for this lockdown. Somebody maybe they do an officer we get the phone for check for the e-pass. So in the morning we get some little bit of up and down. But I don't know if they wait for rectify as quickly as possible, consultations and all the rest of it. And then they all get their phones there now. So if you come for check na phone, we will check na phone. If not the physical one again, hard copy, then we still check them for.
So the officer we are going to meet now junction or now the checkpoint. No need for take me phone na me hand. Just need for announce the number.
Except maybe so the phone will not. Say they not get charged. Say then they, pass on the phone in battery go down. But all the side of it then give them one and they no need for take your phone and they go check now their own phone we then get and rectify. But we are that one day impossible. They still take the check from your own phone for justify say yes indeed you get pass. The one other thing we try for improve on, like the last time we will start the lockdown and be They rope checkpoint them they use. Rope. You know, and that one did not look sightly. You look at me, they look like if I not decent. And so we try to improve on that one. Even though we improve on them during that same lockdown. But this time I will not start for using anything like rope. We say let me start straight off with crash barriers.
Okay.
So if they move around, you will see now blue and crash
so
barriers.
We get Mark P going because I mean we drive through some point away.
Yeah, the military has been
the military and they but then I hope then get
the Mark P been on there even before now. The Mark P when we declare Mark P for 6 months from last year, I mean from the end February. But whilst we depend on this COVID-19 came, and so the Mark P just continue. But Mark P be on there and then still they continue. We work with the military, we work with the police, the military and the police, and they work together for make sure they provide security for the people of this land. And one thing again, one officer go bring come out now the fact that now Bo, something happened na Bo. One fellow we end up for arrest where they pretend for be soldier man, you know, fully dressed to like soldier. They provide security in one place, you know. But after interrogation, can't find out to police soldier man, and so that person is now under investigation. And even on Fobe, the regional commander we did the winner, it was Samadia. He do very well as well. He gets some rumor there about some click boys them instead of Fobe, you know, they sabi themselves. And so what he do as commander, we very proactive. He call them to a meeting, the one they would call 5-0. You know, we person not do something, you know, they arrest them. But if you hear something, it should be the person for call them, and that's exactly you do. And so you call them and ask them, and can find out say then deny, say they're not getting any intention for disrupt the 3 days lockdown, or even for disrupt the peace of this country. And so they even pledge themselves for even work with the police. And then from there we are moving forward. You know, the local police in partnership board and do very well. And they get a young man they call Mr. Melvin. When the Secretary General for this LPBB now, Warsaw Division, when the region itself, he's doing very well for that kind of area there, and that Clanton area, the Info area. They do very well. He was part of the team. He was part of the team with the AIG, where they able to talk to them 2 fellows, then 2 guys, and they were the big one then. And then give the assurance say they are ready to work with the police, and they're not ready for doing anything where will create any kind of mayhem, or they not get any plan with sinister, you know, to the well-being of the state. So that's very good.
So you say if person not do something, you not go arrest them, but
yeah,
the police,
you know, just
but the police are aware say them belong to cliques, and
yeah,
I mean by meeting with them, it means you know recognize.
Yes, you go aware say it belong to clique, but you also we can go to court. You also get for can go to court for an offense we commit. Understand? People can associate. Understand? Now way you a situation you care something go the way we not right. Now the problem they come out. And so since we not see them, then they create problem, and then they are the community not hide, so we call them and talk to them. So that one was fine.
Okay.
You know, yeah.
So how about the other area that we not get, you know, cliques and maybe gangs, but generally within compliance, don't tell like going around Western area or but any country generally can because this not to just a lockdown for Western area.
Honestly, compliance level very high. I think the one big difficulty we face now the same old face last time. We get for the water.
Okay.
And water na need, you know, they say water na life. The first time we get that first lockdown, we get a little bit of problem because we probably not get clear instruction or clear directive as to what to go get for do. We don't really expect the situation. Then all of a sudden people can come out, see if we can get water. So they say, this is a lockdown. Why should they come out? And so the commanders the way they since they don't be able to get clearly whether for allow or not for allow, you know, some then the way actually the situation don't be look fine. But at the end of the day, we get clear directives. Say no, I mean somebody has to be magnanimous. You know, human being, place yourself at the situation. We say some man you get water today, the other day back there forget. So what do we have to do in the instant case now for make sure say we provide some kind of respite by making sure alala not commodity, fet not commodity, then they try to maintain the social distance or physical distance as the case may be.
How often are they patrol on net for ensure say thieves do not break into people's homes? I mean, on a get report of any robbery around whether na
during this lockdown, this 3 days lockdown, we not get any report of robbery. In fact, we will not even get reports themselves. Otherwise, I even the struggle. It's for report on because.
All right. Well,
I'm phone open, so
la
reports
with
are
one.
not
I don't know if you have seen this video of this. We don't know anything transpire before the video appear, but there was this one person where, police been the beat apparently for being out on the street. Even where they beg in the video, he still got beaten, and the strong belt of the OSD officer when they hit him over and over repeatedly, even when
it's just not for this lockdown or the last lockdown you talk about.
Well, I mean, I don't know if you've seen it. It's not the last lockdown. It's now the video will circulate around this one. So you haven't seen.
I haven't seen it.
So the question now, you say the police not gonna arrest person for doing nothing, but would the police beat somebody with the walker around if the person no, whether possibly in mind, in mental state correct, or now somebody way correct, but they out on the street. Police go beat them for walking out on the street or go
police
get arrested.
That make we always say when policeman cross the line, what they do, they take them through beyond disciplinary processes because we get set processes where somebody for follow, whether you be police or you be soldier. If something wrong, if you see somebody commit an offense, I mean, just take them through the proper process. If you arrest them, go ahead and arrest them. Take them to the station and conduct an investigation. If you need to take them to court, take them to court. But we actually will not look at capital punishment or maybe bit. We know that not to be area. But we happen and it come to be noticed. We always do the right thing. I know see they can't make that reference. So the last lockdown we had those problems. One or two of them, we don't want to even overshadow all the good things that we do. But that notwithstanding, we also make sure say the one to be involved, we take them to tribunal and then we do the right thing.
All right, before you do left, you get short time. Before you do left, security one of the provide quarantine homes, treatment center. What's it like? Because case 90. According to report, is on the run. First, he run away in a quarantine home, then a hospital. He don't chill again. He don't run away back.
Yeah, case 90. I don't know. He get the habit for like run away. But this last run away. Actually, he not do with we again. He not do with the police. He not do with the military. He do with what about them. Because now somebody we already he don't go through the court and the court don't send an remand. And we don't do remand now, you not do with police again, you not do with the military again, but we did now with the correctional service. And now then custody be still there where I understand say he run away again. Now that's my understanding. So I think we will all help them. Them now, we all on the search and they look for make sure say
at this point we talk to Madam Yata French just want to say case 90 clearly say both health and security concern now. At this point, Salone police go see okay. He's on the run possibly been there in a correctional center, and because na positive case, the threats exist for like pass on to other people.
Of course, we know that.
Would Salone police want for announce a name and declare that he's wanted for fleeing, not to just one term but 2 term?
Well, I think him be there and then for me to announce, but if you don't announce him, we say no go announce him. So when I get the health people, they can't announce the name because you know custody again. But an officer go do it.
All right. Well, Superintendent Ibrahim Kamara, thank you very much for your time. The incidents and all look plenty, so like you say, not much there for report on them, but of course plenty meetings and they we need for head of 2-1 now. So we say thank you very much for your camera/iron updates today. We hope say by tomorrow we'll get plenty report then for before when you come again at the studio.
Hopefully one for let the report on plenty. Because plenty they take away from the job they do.
All right, thank you very much, Superintendent Ibrahim Kamara, head of police media. Plenty of people can call on Media One. Thank you for your time. Well, continue for the week. Continue for sending your comments. We get the third team we go take over for lead you right through to the evening. But continue for sending your comments. I apologize if you watch on Facebook and see how they try for adjust my face mask. It's not that I want for the one, but obviously as we continue for talk, movement they take place, the mask could drop a little bit. So you need to understand that if you're sitting there and they talk, the mask not they move. We they talk regularly, So the mask get for the movie, they take different shape. We have to fix it, okay? For plenty reasons, make we not get comments as well from Muna. They say, well, why not they touch the face mask? Why not they wear a mask? You know, so we have to do that, all right? But they take this quick break, and we'll come right back after the break. We'll bring on some more information, and your own segment round up for today.
Radio network where we they call IRN. The baton we country salon for make we get level playground. Now IRN don't enough for make you know about your country. They give voice to youth man them. They give voice to woman them. All political party them. Right across the country. You go na the east, IRN, and you go na the west, IRN, you go na the north, IRN, and you go na the south, IRN. Say yes to tolerance, we all get we rights. IRN say no to violence, no mix perfect like a blabber. But we all work together with one word, cause now so we go up from it salon. Brother, sister, mama, papa, una yo. Brother, sister, mama, papa, una yo. Economy and well-body business, quality education, decentralization, with agriculture and infrastructure, energy and power, with social welfare, for human rights, anything but development.
Fellow Sierra-Leoneans, Corona is here, and we for come together and fight this deadly virus. With the help of God and Papa government, we go overcome.
People then they die, now other country, yeah. Too much stress and pain, we call on the Almighty, yeah. People let they die. Now the country, too much stress and pain. Now we dey call on the Almighty.
We dey call on God in grace. Call on God in grace. We dey call on God in grace. For can save Mama Salone. We dey call on God in grace. Call on God in grace. We dey call on God in grace. For can save Mama Salone.
Let we stop the shake and the bind. Let we do the precautions. Let me do with the medical people them say. We on a mama salon, now we get for pray. Rabana, Antina, Fidonia, Hallelujah, Corona. We divide them by fire. Rabana, Antina, Fidonia, hey. People then they die. Now other country they are. Too much stress and pain. We call on the Almighty. Yeah. People then they die. Now the country. Too much stress and pain. Now we they call on the Almighty.
We dey call on God in grace. Call on God in grace. We dey call on God in grace. God can save Mama Salone. We dey call on God in grace. Call on God in grace. We dey call on God in grace. God can save Mama Salone. Salomu mamongo. Mingweju adweju tatwe kolo. Kolo kolo. Mingweji high binai. So be real line. Be nyay line. Be J line. Be keke line. Be uncle line. Be auntie line. Be mother line. Be mama line yo. Ikwateu. Egie yawa. Ikwadobweu. Egie yawa. Ikwalatiu. Egie yawa. Bless up the lemu ne marutima. Tuluwago. 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 Put a sign in the my.
People then they die. Now other country they are. Too much stress and pain. We call on the Almighty. Yeah. People then they die. Now the country. Too much stress and pain. Now we they call on the Almighty.
We dey call on God in grace. Call on God in grace. We dey call on God in grace. God can save Mama Salone. We dey call on God in grace. Call on God in grace. We dey call on God in grace. God can save Mama Salone. Coronavirus, now a deadly disease.
This now a special Sludge and Iron Corona updates where they come to you from different radio stations them all over the country. We now get online Amidu Fona in at the communications lead in Bombali district. Good afternoon, Mr. Fona, and welcome to the program.
Yeah, good afternoon, and thank you very much for having me.
Yes, Bombali district don't record 7 cases now. You can tell me more about that?
Yeah, indeed, like you say, we don't record the 7 case. And now, case we come out inside one of we quarantine homes them. We very much pleased that, yes, if we get case, unfortunately do. Now, from the quarantine home, they are actually a case we not linked with the previous case we for them be a bad thing. We in the expect, say, because of the level of contact, obviously, you certainly go get situations like this. So we're not surprised, though, that we get a case like that.
So what's in I don't do now in terms of the contact persons, them, the one that we could come in contact with this?
Like I say, inside quarantine home, then people are in quarantine already. The high risk contact, we isolate them from the general so that by their level of contact, so we place them in isolation. And then already they within the radar, the contact tracing team always there around them, the social mobilization team and the psychosocial pillar. And we, unfortunately for them, by policy, when una in quarantine, don't then get a positive case, una go for start the quarantine all over. That is the case for them now. Then they go back. But we continue for we education, so that particular family in particular. So ensure they observe the social distancing because much as then they on the radar, we similarly so no one for they get more positive cases coming from them.
Condition or status of this person?
The
condition, it ain't stable condition, it ain't critical condition.
Well, as the others, in condition remains stable. Fortunately, then they prove positive, and at the same time, from the physical look of things, we observation, they appear very strong. And then they're at the hospital now. We get 7 the 2-day free tongue, then 5 of them they Kenya with the treat now we isolation unit. And so far we not get anything adverse where the medical people they report about them and they respond to treatment and they're very, very stable.
So how you go describe the security situation, especially now the quarantine homes?
Well, we you know, it gets psychological effect where it presents to the one that within at the quarantine home. And the more reason we make we get the social pillar where they cancel them so they understand say yes, this is not something we go over and what have you. So at the moment, they all, even though some elements of fear there around them, but we say they give them all of the support, the stakeholders in Kenya, they give them all of the support for make them understand say yes, this is something we they will go over and very soon by the grace of God.
So how the food issue, the food supply to them, people in the way they're under quarantine currently?
Yeah, government they don't contract somebody where they supply food to them. We not get any negative reports on that one yet. The person they do extremely well at the moment and they give them food. Well, it not go be the kind of food where they eat it where they host them. But it's appreciable though. They not get any negative comments as it is. Water business, we're able to deal with them at the moment. And electricity as well, we're able to deal with them. So they're relatively calm and they do very well in the quarantine after they speak to you.
So how now they engage communities during this 3 days lockdown?
With social mobilization pillar, they all turn about the streets of McKinney and the environment, and as well as the district as a whole. We will continue to engage the community. Of course, you know, say this is a time for reflection, a time where people and they think about where we are coming from inside the sick, inside we do right now, and inside we will get for go. And to a very large extent, by the level of compliance we get, the sit at home regulations and what have you, it still shows say we people them appreciate the fact that this is a positive step we all take for make we able to deal with COVID-19. So the community they know they pose anything threat so far to the response, and we appreciate the work done by the security. This time around, not really anything adverse from report in the conduct of the security people. Then we are more like on top of the situation after the situation.
Okay, John.
All right. Okay. Well, what's in the happen with the one the way generally on a get in terms of whatever center and they be it na quarantine or na the treatment center. What's in the happen with them?
The one within a treatment center, they already there under the care of the medical people then. The one within a quarantine home, yes, case management, surveillance, they go around them for them support. We monitor them intensively for ensure those who present signs we will get them off from the rest. And in particular for ensure there is observation of physical distance, use of masks, and very limited or no contact as even when in a quarantine. So like I say, we follow up on them. Fortunately for we now just 8 locations we get the quarantine at the district. Get 8 locations we get more personnel to give them all of the support they require.
What about the one that within our treatment center? What's in they happen to them? Are they stable and they respond in a way? Person need for worry about in terms of their condition what's in they happen to them?
Yeah, fortunately for you, they come out from a very experienced background. We don't get treatment center of that sort before, and they're very, very stable. We people that get confident, and the fact they want you go positive, then take you on a treatment center. We very largely believe then we'll go through the exercise and come back. So we now this will not be issues of people running away from quarantine, people being careful, say we don't care we're going to treatment center and they go die. It's so much confidence in the health professionals, and then don't keep up the sleeve even as they talk so far. And then they do very well. The one they already they're very stable. Not a place where you visit, but a short safe now place is a good opportunity to visit. You will stay and very comfortable, even that environment to them.
All right. Thank you very much for your time on our end this afternoon. We go endeavor to get more information from Mona as we go.
Yeah, thank you very much.
Thank you very much. That will be the coordinator for Bombali. Well,
Communications
lead for
Bombali
Bombali
District.
District.
Yeah. And the good thing that people know they went away from quarantine home, that part's the
which is good.
District, which is good. And at least then they monitor the situation and see how things they go. On Sludge IRN update, where they come to you from different radio stations all over the country.
Right, continue to send you comments. We get additional teams that will come, but continue to send you comments to 077-981-981. One more time, 077-981-981. Send you comments as you continue for day. And also as you continue for stay home, continue for observe the thing then way you for do for make sure say you're not getting in contact with the disease, which usa you day. And even if you they feel sick safe and you they in a state where you need medical attention, the authorities and say, well, call 117, okay? Call 117 and try for see how you can able for reach out, forget the medical expert then for talk to you and tell you exactly what's in the happening around Usayu Day. Now for the past 2 days, what you you experience so far, water. For the one that we on side, it's very difficult for get water, and I don't get enough water supply. All them comments and concerns they need for the coming. So when we get the people within charge kind of studio, we can able to ask them questions and get them from provide answers to the on our concerns and the way on the raise Tiana.
Yes, and of course earlier we don't hear from Media One, where don't tell we say they don't get much issues with regards security. And this clearly shows that indeed the security people really doing their allowed and everything in control. But use this opportunity, probably anything that happen at your communities and say you want for share with you want for let the appropriate authorities they know. You can do that to text message and say if you watch me on Facebook Live, you can even send you comments or your questions as well. I think a lot of things that happen even before the lockdown. We see the crowded, places, especially at market centers. But this now during the lockdown, today the second day of the lockdown. So they expect people to let them stay at home, stay safe. I mean, even if you get problem with water. Yesterday when at the first stage we see on TV, the people that will come out just for get access to water. We know say that now one big problem where plenty communities in the face. But this is not the good of these are for the good of we all, because we all really need for contain the spread of coronavirus. And we need for take the necessary precautionary steps. I mean, wash your hand. Now us, you get you water, wash your hand with clean water and soap. And if you get sanitizer, you can use them. And make sure, say, if you don't feel sick, sometimes you don't feel fever, stay run water. Any signs and symptoms, somebody they feel, say, COVID-19 related. Just call 117, not afraid. Now, that's why they continue to tell people, not panic, at least. Just call 117, you will get the immediate attention where you need.
All right, well, continue to stay with Aaron and Sludge as they bring you more information and all the things that you need to know where they happen around the 3 days lockdown. Mina John Conte.
And Mina Tiana Alpha.
Network, IRN, Platinum up King for Gud Mornin Salone and development. Brother, sister, mama, papa, unayeli. Brother, sister, mama, papa, unayeli. The Independent Radio Network, where we they call IRN. The baton we country salon for make we get level playground. Now I don't enough for make you know about your country. They give voice to you man them, they give voice to woman them, all political party them, right across the country. You go na the east, and you go na the west, you go na the north, and you go na the south, say yes to tolerance. We all get we rights. IRN say no to violence. No mix perfect right a blabber. But we all work together with one word. Cause now so we go up for make salon. Brother, sister, mama, papa, unayeli yo. Brother, sister, mama, papa, unayeli yo. The Independent Radio Network, IRN, don't team up king for Gud Mornin Salone and development. Brother, sister, mama, papa, una yo. Brother, sister, mama, papa, una yo. The Independent Radio Network, where we they call IRN, the baton we country salon, for make we get level playground. Now IRN don't enough, for make you know what you country. They give voice to you man them, they give voice to woman them, all political party them, right across the country. You go na the east, IRN, and you go na the west, IRN, you go na the north, IRN, and you go na the south, IRN.
This IRN's large updates when they come to you from radio station them all over the country. And we on time, John. Almost they come to an end.
Yeah.
I think we said don't spend we on time, we don't bring information to people them. And family just want for make you know say just after we left, we'll go bring to you
Another set of people and go there for pick up them questions and get responses to them. Aminata.
Yes, this one they say, we want to know if the curfew will they continue after the lockdown. Thiefman and armed robbers then they ambush with peace na Simatong devil all. 2 days ago they broke and thief beaucoup money na people and other thing them. And as we dey inside the lockdown, then still the money people them. We dey beg the Salone police for come to we aid and check we area we need peace. I really appreciate the update from Una. May God pull this bad sick come out na sweet Salone. We want to know if the cases them all where they come out now na because of the lockdown. Because if that's not true, then we go know say the lockdown self gets in own part where they play. If not, make them left will go about your own business. This they come out from Amarana Konakridi Lunge. This one then they say how many minutes for wear the face mask? This is a question where the person wants answers to. This other one they say Ayarenduya, the transformer na Wilkinson Road by Lumley don't shut up from yesterday. Do you want to tell EDSA for we because we did suffer for day na us with blackouts and not easier with a big gonna pass the message for we. I think all this we can take the next team go come and continue.
All right, thank you very much, Aminata Finda Masako. Well, Tiana.
Well, from the messages them, I think water problem, light problem, but and also the mask. Well, we get forget more masks. People are really come and talk on how for use the mask, how long it will take. But so far, I think the responses them, the questions, the comments they will get from people them, it really shows the people and they listen, and that is good because this na effect all for effect. Let we give support to the government, the EOC, for let we tap Corona. Well, plenty thank you to Una we don't listen and send on a message. We executive producer, I've been Joshua Nicole.
We producer them na Aminata Finda Masako, Kevin Lamin Lamdo, Mohamed Bashir Sansi, and Michael Sambola. Our Facebook Live team na Musa Franklin and Kavora. Studio engineer na DJ Ahmad. Well, on our tata we go back other time.
Namini Natalia Fino, Talia Fino. Talia Fino, they tell una couche, seke, who are the talking wrong studio, they tell una couche. Salamu alaikum, walibina, auna simisu, adefo waka waka, ni emi talkie drum, adefo waka waka, Talia fino, tutu waka waka, Talia fino,
fool them. Yeah. I get to me paddy. This me paddy awaking sick. Where then can tell and say na malaria, and if you are well quick, then forgive injection. It begin tremble and shake like saying a shake. Small needle, me paddy can say nindul. Small nindul. Now I can afraid so. So I remember the time Ebola come. Now he sick. Now I call him, I say, oh paddy tiko. Waiting they happen. This kind sick where they pay you so. Then don't tell we say we for call one self in law no pepe doctor. He said fish was a filo. Yeah, I no go bull for call that one self in there. Because we then go can't just know the can about close than they were if you are fool. Now I say, all tiko. So you don't forget nindul, te. Now you don't come out to nindul. Now na close, now you afraid we make you know for go now hospital. But the one when I in the camp, he no scan about sick you get. And he got for protect himself. So now make the dress that kind of way. And by now, nobody know for tell me say if you are fool because we don't see them. Te. But again, until we Tikonkotonians they will get gangayes. We go still fed all kind of excuse for avoid for go hospital or for call 117. Right now, I in the blow. Who side and they go? Famul them. I present to una episode 4184 of the Talking Drum Radio Soap Opera Atunda Ayenda.
Hey. Okay, yes. I'm glad you will respond urgently. You come inside.
Remember.
What are they are?
Remember.
Now you see the under so. Now the Sheikh Mahmoud.
Remember.
Sheikh, what did you cry for?
Remember.
What did you cry for?
Now the kind of man the way as they don't come so.
Sheikh, those kind of man in.
The people they are so what this is so. It look like now people they waking go now the moon.
What do you mean?
Now they don't come for cancer me so.
Check
for get me go up in the cloud.
Check not for them can
them me say I'm not resist for die.
Protect themselves. So if you get sick or you not get yourself, let them prevent. They say prevention is better than cure. You understand? So allow them, let them do the operation them, yeah?
So they make them for where they can see there so. When they face them, I know they're able to see.
They can go way there. If they don't way there, they can go protect themselves. You know, you want no more than they take now this country. Whether they get corona or not corona, they get for prevent themselves from this virus. Because it's deadly. And right now, the way they scatter, it's healthy, so it transfers to check, I want a patient too.
Why? You don't left me.
Check, they for me coolness, bro.
They don't care me go.
They can you go.
They don't care me go.
They you go, check.
I say so God, I don't go.
Check, you go.
I don't go.
Check, you go, let them go test you. Let them know what you get, and then go able to solve her quickly. Yeah?
Me man, they won't cancel. I swear to God. No so corona.
But you not listen there. You not listen to my brother this.
You listen to me.
But see I dey breathe now. For breathe say a problem. Then we can go let them go check them.
Maybe na me get me sick.
Now sick you get.
Na me get me sick.
Now sick you get. You not sick. You not doctor.
No so corona again.
Now wait see.
Na pampa sola again.
We check local.
Na pampa sola again. No so corona.
Hey.
Papa,
no can go. Go inside the motor car.
Now what they go so now? We they buy 1 dozen gari, and they buy like 2 dozen cocododos, and half bag rice.
Yeah.
Then I go buy sardine.
Yeah.
If I want cartoon safe, then I go long way. Then I go buy
for the 3 days for the one cartoon.
Yes, but go for the eat morning Saturday. But doesn't I eat a rest out for the pan? Okay. Then I go buy this thing. I go buy palmine. If I 1 gallon safe, I buy them. We put them down. You understand? Then we go for buy coal, charcoal. If I 1 bag charcoal, we buy them. We put them down. I mean, you go can we go?
Obeto, who say you go put money for buy all the things that we item I so?
Django, na pay your business so. Last is something. You deal with me or you not deal with me?
I deal with you. What I need for no,
Who say you go pull money for buy all the things you don't so Tapia?
Jango, right away you do so right, you don't get nothing in your pocket. So now be ask me, now nothing all day. And the things you go long time for long live your life during the lockdown, the access to pull money.
I not get nothing. But problem not fine for meet possible no get nothing. A better day for me poor one than tomorrow problem can meet me Tapia. Who say you pull money?
Jango, wait for look, I said they don't possible for Pepe. Look at Jango said Pepe said
so they
put up Pepe price along
Pepe na 5,000 Chikoko money.
I'll go buy now, what to go buy now? But what shall they tell you? So at least we'll get the one now. At least we'll I don't like that too.
No cost more Tapia. Who say you pull money? You unbalance me talk. Tapia. Who say you go pull money?
Hey, Jango, you get sir. Let this get now.
Not to get now, I know.
You for glad for me.
I go glad but Tapia. I need for no side pull this money out.
Listen me, Jango. All the problem I don't get. You know the problem I don't go through. And what's in I made right now. You for glad yourself because you know say better days. Them you know. You understand what I mean?
Not true.
No, you cannot continue buy more.
Not true you talk. Where the Bible? Look at the pass. Look at the pass.
This me my friend.
Look at the pass. Not forget for buy that boku milko.
Oh yes.
Buy boku.
Is it on there 15?
Hey.
What was the 500?
What's up here?
Yes.
I still concerned. Who say you pull money?
You know it's nothing. Lord no argue go before. Now lock nice smile for me.
What? Anyway, for 2-2, me woman come back here. For me go. I know it's fine food. Now no like tell you.
Hey, Justice, you like for talk this stuff all the time.
No,
I say
hey God. Well, the thing is, me unable to hide me feeling. Yeah, boo. You see now I vex, and they make you know say I vex. When you do to one no leg, and they make you know say you do to one no leg. Boy, you do to one leg, I for praise you. This castle I live, he fine. Yeah, boo, sabi cook.
You get luck.
Yeah, boo, sabi cook.
Now I can't say fly make. Because if I don't be kind, not get this kind of
they talk. I'm glad the way you come. You know, hey, watch. You watch me body.
I know.
My body don't begin go back.
Yes. Just this 2 days no more. I can't no more. Your body don't begin fine back.
Anyway, I don't like tell you. And this can make a jealous. I know I lost you.
I know, eh?
I know I lost you. They won't understand.
But Justice, you know say I know the thing but any other person. Are you one green in my mind?
That's way for me. So could they make me the big? That's way for me. Talk about. Come on. Talk
the
about.
love what I get for you. I'm not able for share out to other. Now you one green.
I didn't know I got time for you. I didn't know I got time for you. Hey, me one and only. Hey, you.
Yes, there.
Hey, talk come. Only with jealous.
I know because the way you keep talking about this me.
The one they will not get you kind. The one they will not get you kind. Now me. Hey, me. Now this will be the tell Buba. Where you able to understand. You understand? The Buba they come here. You no get wave, so you no go know what he mean for jealous. You no get wave.
But not so.
Yeah. Therefore, be me. That makes so tell you what remember. Like this school we go so. I'm not like tell you. That's be the court.
When I make a comeback.
Why you say this corona sick? They up like this. I say That's you know. And they forget to have a family the upline. Now you know what they don't say. You man they able to. So tell them I can remember almost Astagfirullah. If I lost you. You
just again. I don't even think about that. No. I don't even want to come. No. I don't even think about that. They say, me we get long way for go. We go for see grand picking there. I beg no remember that.
Well, that make we get for pray for lady sick adam.
That's true. Yeah.
The kind way they sick they spread na Concord. The kind way they spread right now. Na community transmission.
Exactly.
Look like Bontico. You know, ma just say I.
It just they go up.
This they show see. People in day where they come into contact with people who get the virus.
Yes.
Then they know they see them. Then they
see them. Exactly. When I'm
not. But you know one thing. You know one thing, Mark. And they blame the Congo government.
What do you make?
And they blame the Congo government. You know go believe say me. And they pass one day by Dalori Park.
Yes.
Ayeri, apprentice and the other. Bolichon, 100,000. Bolichon.
That's how I don't put restrictions so people are not for.
No.
What's it?
I'm not up there. Now going for inquiry. I said, no. I mean, they say restriction. And they say, no. Motor car they go once you get pass. How you dey get the pass? They say once you get money.
So how go able for help for let tap this sickness here?
Yeah. People they not serious.
And you know, believe say some people when you tell them say this sickness here, then they tell you say na lie, they not believe.
Exactly. Denial.
Hey.
Now this Fishers Afinoki always say, Tikonko will not serious.
Who not serious?
Who not serious?
Indeed, who not serious. Because this kind of thing where they happy so right now. Not to do for the play with at all. Not to do for the play with all. Because the kind where people and they die, what do you able people and they die, all that country them. Then look now at Tikonko now, look what they happy now. People still don't want for take and see
now into this strict lockdown, you know the work. I tell you, people just use this thing now for make money.
When I make in the Scattercan community.
I fumble them. The sorriest thing, as me padikin say. Now the case the old day, but this corona inside this Tikonko, not to quarantine place the normal they come out. Where they tell we say, like how justice and yebu then they talk so. Corona then we community them. And when one of the easing of the lockdown. This it don't share us so, it don't share us. And whilst the thing they share us, na so tapia in downtown spend no check. Yeah, where they itemize in commodities them. 1 dozen this, 2 dozen that, 1 cartoon dande. Hey, tapia, this advance where they advance you so, you catch yo. But do ya, as you they spend no check, no forget say, na you and Dragon get business. And member say, Dragon na bad baba. Look Mr. Dragon as they call him name. Where they cry say, the one that we come for can't take him, the fever order come out na moon, the one can go up na cloud. Well, enjoy you can drink you Pampers pap. You can say I want feel high and go up the sky. I think that well finally that the people that don't come for you so now for carry you go up the proper one. From them, if you now want for know what thing go happen to Dragon, if they go test them, say get corona. Or it go end up the sky. Now for continue for listening to Atunda Ayenda. Don't forget to tune every day, Monday to Friday, to Atunda Ayenda and turn all Unuahala to Jigijik Skayama. But if you get question or you get something you want to add to this program, you can send text message to 076 661 589. 076 661 589. The Independent Radio Network, IRN, Dotting up King for Gud Mornin Salone and development. Brother, sister, mama, papa, unayerio. Brother, sister, mama, papa, unayerio. The Independent Radio Network, where we they call IRN, the baton we country salon, for make we get level playground. Now IRN don't enough, for make you know about your country. They give voice to you, man them. They give voice to woman them. All political party them. Right across the country. You go to the east, and you go to the west, you go to the north, and you go to the south, IRN say yes to tolerance. We all get we rights. IRN say no to violence. No mix perfect like a blabber. But we all work together with one word. Cause now so we go help for make salon. Brother, sister, mama, papa, unayerio. Brother, sister, mama, papa, unayerio.
Good evening and welcome to this special program called Corona Talk, where they reach you from different radio stations all across the country. Now, the Sierra Leone Association of Journalists, SLAJ, and the Independent Radio Network, IRN, come together for bring this program to you as part of SLAJ Corona Response Initiative. Me now, you presenter Musa Baisise, and my co-presenter now. Fam will stay with you for the next 4 hours or so as we get the latest news and information around the country inside this day 2 of the lockdown. As we will get Master Sabi people them now the studio and self on the phone line for share with you them ideas on the COVID-19 corona situation.
Well, we hope forget na the studio. I will Thomas, when na the program manager na the Ministry of Health. Alright, sorry for that break there. We hope for get na the studio Harold Thomas, when are the program manager in health education na the Ministry of Health and Sanitation for give you the latest situation on the COVID-19 sick. And self we forget Kaililu Totanges, when are the chairman at the National Council for Civic Education on how in council the help for fight the COVID sick na the country. And self we go talk to Emmanuel Ja, the Service Marketing and Communications Manager na Maristow Sierra Leone on how COVID don't affect reproductive health na the country from the perspective of Maristow Sierra Leone.
We go engage on the phone line Professor Alhaji Njai, lecturer, Department of Biological Sciences, FBC, and lecturer, Microbiology, College of Medicine and Allied Health Sciences, Commerce, Research Fellow, University of Wisconsin-Madison, United States of America. Seth, we go talk to Reverend Joshua Abiose Duncan, Head of Mental Health Coalition, and Muhammad Haji Keller, Head of Psychosocial Pillar Emergency Operations Center, EOC.
Okay, once again, this is a special program na the coronavirus pandemic where they reach you from 65 radio stations them across the country. Now the Sierra Leone Association of Journalists, SLAJ, and the Independent Radio Network, IRN, come together for bring this program to you as part of the SLAJ Corona Response Initiative. With a broadcast from Radio Democracy 98.1 FM, and you will also get to it on www.radiodemocracy, where Osiwa they support and powered by AfriCell. And self, you can access the program through the Radio Democracy 98.1 Facebook page.
The Independent Radio Network, IRN, don't team up king for Gud Mornin Salone and development. Brother, sister, mama, papa, Radio Network, where we they call IRN, the baton we country salon, for make we get level playground. Now IRN don't enough, for make you know about your country. They give voice to you man them, they give voice to woman them, all political party them, right across the country. You go na the east, IRN, and you go na the west, IRN, you go na the north, IRN, and you go na the south, IRN. Say yes to tolerance, we all get we rights. IRN say no to violence, no mix perfect like a blabber. But we all work together with one word, cause now so we go help for make salon. Brother, sister, mama, papa, una yeri yo. Brother, sister, mama, papa, una yeri yo.
Family members, they listen to a special program where they reach you courtesy of the Sierra Leone Association of Journalists, SLAJ, and the Independent Radio Network, IRN, as way for cover and talk about this 3-day national lockdown. Today is day 2, and we still continue with this special program. Me and Musa by say I did at the studio with
Wani Gauja.
Alright, so quarantine a place where they can put people them for some time under observation. For no waiting make some people can in a quarantine center. We reporter will go for say me co-presenter being talked to the national quarantine manager na the emergency operations response for COVID-19, Dr. Francis Dove Edwin. He first ask him what to make person go na quarantine home and na this he get for say.
Well, it's quite easy. It must be say you don't become a contact. A contact means say one person at that host day tested positive for the virus. So as that person they test positive, so when all one another host or that particular environment now it become contact. So the first thing where they move in are surveillance and the investigation team. Then they categorize into 3 different categories. You get what they call primary contact. That means say if I didn't have my room, like my woman, my pikin, sometimes my cousin, if na host, all these people already near me immediately na primary contact. The secondary contact, for instance, now if na upstairs and downstairs, the people already done go become what is known as the secondary contact. And so by how you near the person, and so the contact business will be.
Okay, so the primary and secondary contact, secondary contact, they can tend for lay una quarantine them?
No, you know, you see, you have to understand something. It's not easy. Well, something that would make people not cause trouble, and because you tell us you have to go lock in a jail. So when a man in a jail, it did not cause trouble. But now with quarantine now, it's different. Automatically when the virus don't come to you, we have to quarantine you and separate you because for 14 to almost 20 days. Depends on how you test, come out and all the rest of it. But you are in quarantine between 14 to 16, 14 to 17, then days and day. So those days and day, you know, they move. Because the key factor where this response they follow, and what we do, it's called identify and isolate. Now that make you see say we get this right in a saloon, and you see say you know scatter wildly. It get for spread because it's an airborne and there's some theory and they move by droplets and all the rest of it. So you get for move, and you also get people there where the immunity system for some reason what they notice when we say they notice we're very strong in a saloon. So when they get it sick, but they're not able to demonstrate all the symptoms the way people in America they get, people in England, people in Italy. So they notice say there's a lot of death in those areas, but we get small amounts.
So the question is secondary contacts and self una the quarantine?
Yes. Because if una didn't have day, una all say yes, we got to rope you in. Once surveillance and the case investigator don't say this not the particular situation, then you will be quarantined. All right? You will be within a quarantine system.
Okay. So what's on our responsibility at this time?
Okay. With responsibility now we don't quarantine you and end-to-end, now service delivery. Now we get for now they come into place. So one of the first thing you get from the people and now for them eat. You know, all of a sudden food now they can become the major part. You know, because now we're responsible for you forget 3-course meal a day. You forget breakfast, you forget lunch, you forget dinner. But when I'm out man them, where they deal with almost 735 people, then are 122 locations. You can imagine the stress if we don't come to the EOC and to government. It's a lot. Even Papa self they deal with 10 picking our own self, with Mama. You know, so some people are today they cook okra, I know they eat okra. Or they give this kind of breakfast, I don't want them. So all of those things now we're responsible and our responsibility to provide them. But we got to manage all of that. We manage even to the diaper if picking inside the house. We manage now even to toothbrush and sapo. All of those things now governments and within the EOC structure now we get for managing. So it's a lot of things that we get for manage first when it comes to your food and your wait and call. Your safety also.
So okay, let me take a bit. Let me don't for talk about the food because there are a lot of concerns surrounding food. We don't get information say people in the come out at the quarantine center for go buy food outside, out road and they be.
Okay. Well, that's not for happen. I make I just talk about safety. Your safety and concern are we. So that's why immediately when they deploy you, or you don't become a quarantine home, we also send, we get quarantine home, we also send what we call security personnel for DD. And those security personnel not for allow, let anybody move. We get right now over 300 security deployments. Yeah, 483 to be very precise. Security that they deploy. We don't become sort of like personal security them to you. Because your house, your property, everything that we get for secure them. So security and then for maintain, say, breach, not for the. When you're inside quarantine, your family yourself not for can fend you. Nobody not for bring anything can to you. Anything will go within or inside that quarantine zone can't come outside. You don't understand? So if food they can't sell for you not possible, so tell you like one special thing there, we're not in at the list. They can't drop out for you on a disposable. So once they give you,
try for stop that act of people going outside now.
Oh yes, most definitely, because we don't tell us if anybody move out of any quarantine, we will automatically now extract you for go now because government don't begin to create what is called government quarantine sites now. So now that one day we don't work on now. So basically, if you're not a violator and you're not abiding to rules and regulation, and then also if you're not in a cluster with the bathroom and toilet, now all the share, then you will have to go into quarantine site. So really, we need the public for understand and for work with we now the EOC.
So I'm talking about, sorry for interrupt, talking about the security side. What's not the role of the security? Because we they see people in their quarantine home, waiting each for let them come outside. They come outside and they together. And this now for let them be separated, let them get social distancing as way for make the sickness go spread. But even then at the quarantine, they see they all they choke by themselves. So what's not the role of the security in terms of this?
That one, first of all, we major challenge. It's not even from the security aspect. When the person and they now the quarantine, they explain to them social distancing is important. A virus where they can't move with droplets and all this type of thing. You for distance yourself. Yes, we're not saying that you fumble, now something I can put on a chair there apart. Like me or you so now, we get distance.
So the security forces that they enforce that.
Well, the security, they tell them. Security and nobody know they go inside the zone. Me self, I mean, they go inside the zone. I can't. We they explain to them. We get what we call psychosocial. We also they under quarantine. Where they explain to them that one day. You know, after they explain to you, we can't watch you 24/7. We get what we call social mobilization. Now another pillar, where they go there, they talk to the people and say, we are the community. Say, the way they pass, if you see them one get us, so tell us, say, hey, you are, you know, on so many areas then, where they see, say, they violate. Even I've been here for good on career there under of court, for good on that markets they doing, except from this lockdown, so now we for move freely to certain areas there. Okay. Then there's a day for go. If you see markets where clamor on Saturday, markets clamor, everywhere clamor, nobody is adhering to this idea of social distancing. And the reason why social distancing come into play is because of the fact that we not get the cure for the thing. If we get cure, you can social distance, somebody gets out, just to give the treatment he done. But it is not there. So one of the way, as I tell you again, are for isolate. Isolation is part of the remedy, which is social distancing.
Okay, so how many days then we get for dinner the quarantine? Because we get concern from Oluwaf. Aside some certain people and they where they under quarantine now, they allege say they don't dinner that quarantine home there for over 1 month now. No authority no go to them for tell them what's not the outcome of some of the okay. And for pull some of them.
Specifically for Oluwaf, there is a possibility because on a case by case, unfortunately I'm not bringing the case up. As I tell you again, so I'm not going for no specifically with regard with Oluwaf. But however, Oluwaf, if a positive case comes out on side after the 14 days, between 14 to 16 days, they can swab them for test them. Once they test you now, if a positive case comes out, you will have to repeat the quarantine process again. It starts afresh. You understand? Okay then. So there's possibility for you for repeat time and repeat time. But a place like Oluwaf and all the places that we need the cooperation.
How?
Because during the second phase of quarantine, we propose to them, say, for go to the government quarantine. Because while you go into government quarantine now, everybody then at a hotel room in an individual room.
This one is not a government quarantine, indeed.
No, they call it self quarantine.
Self quarantine.
Yes, so you get two sectors then.
Okay.
We are trying to move away from self quarantine right now and go into what is called government quarantine for control and break the virus in chain.
So why una even start self quarantine where una know say it will be challenging for people them not for come outside?
Okay. Originally, everybody assumes that people will comply. So therefore, you give them then the only time you go tell us you can't continue. No worry, left una we go there no more not they happen, we not go to do this, that. So now self quarantine we. When I just supply with the one bag rest, this, that, bring all it, so we cook for ourselves. We do all things within a year. So that's what it started with self quarantine.
But they're not for them for dictate to now waiting for happen.
Well, human beings can get rights. I want you to bear in mind in that. They have rights. Not to crime they commit. They were only primary contacts with an infection. So they have rights. So we as medical people and everybody within here should respect their rights. Okay? Even any sign of the world safe.
But in
if somebody say
medical and serious issues like in this, you not a try for compromise because this not sick way.
We don't want to compromise. Trust me. Trust it's usually this so. If we over bond the word quarantine originated from Italy. I mean quarantine, that means that 40-40 they will separate people. Then there's a lady grab so you catch the mortal man. You talk and go so, you put this so, you put this so. But you have to be respectful of the people and rights and explain to them. That's why we have psychosocial where they talk to them. So right now they use this medium and this message, made themselves hearing, to make things easier on them so they spend less days in their quarantine. When they want to repeat the cycle and they can't turn and say, well, let we move for now, let themselves comply. So when we move for now in that second cycle day, and create, as I told you, the isolation. So that's now that same toilet where they use, that same bathroom, all the common areas where they meet up. They're not they meet up there again. All Monday in the individual room, everybody receives their breakfast in the individual room.
They do self-quarantine. Una can monitor them.
I cannot go monitor them inside their house when they use bathroom. It is not possible. You know they go inside quarantine zone. Me know they go inside quarantine zone.
So what they say? If no security guard no dey na the host for monitor say then the day na host 24/7 for observation.
No, they are there. Security as long security they no security. I can assure you say no security no they will allow anybody for come out and quarantine on go na street.
So security dey na the
security dey na every single quarantine homes where they right now on released. There is security deployed. I can tell you right now say Susan's Bay. They get 2 police, they get 2 military, they get total 4. Oluwaf, now Wellington. Not what you talk about. They get 2 security there, 2 police, so they get more than 4 people go there, 4 to 6. Every location where they talk, get it. So Oluwaf, they get security there, Susan's Bay, all of these hotspots, we call them hotspots. Thompson Bay, they get security, they get house lab, they get military people deployed there. So I can assure you that day, and the general public say, all these securities are deployed. When you become a quarantine home, the very first people who go there automatically are security.
So medical people can go check now.
Yes, of course. We get
get any symptoms so that they will test them.
Of course. Now we get what they call case management. Then we also, as quarantine, we get quarantine site people who they go around. We divide the whole place of Western area into 28 zones, urban and rural put together. Out of that 28 zones, we break them down into 4, 5, 4, 5. Each one of those zones, and they all get zone supervisors them. Where they go there regularly and interview them and use this form. Inside this checklist, it say, if the right people are for dinner, then dinner. If then they get water for drink, if then they process them, then whom then clean, they ask them because we know they go inside the room.
They feel
not to the quarantine person they feel. Now the supervisors and people who I just explained to you, and then they feel length in there.
So why don't they make them feel them so that they get their point of view for them?
They are discussing with them for film. That's what they have been. So when they discuss with them, now they tell them. It's not so they say the person they go fill the sheet. No, he cannot do it because he has to communicate first with the person. So when it's in up, they ask, they put they indicate, say, for instance, now Hill Valley, no, let's take a street now, for instance. I just take it. Well, actually, I don't have to disclose all side, but I just use say now 56 for people they under quarantine. Immediately, they don't can reach to them, and all this they happen. The first people who appear is the security. And they notify them, say, yeah, they can become a quarantine site. They are already aware. Because as they don't pull positive case to them, so they are already aware, say, possibly don't contact. So, and just wait now for the process. So security, the good force. Then we serve the CAM. Then we explain to them why you quarantine, all the reasons and then once the process they go on now, then they get daily checks from these supervisors then they go around all these daily checks and go carry that out.
Okay, so how do they do the testing process? Now everybody within a quarantine homes now the test
on the 14th day, if sort of for instance if death occur, lab will do immediate test first. If death occur, they will do immediate test and quarantine you. But if death not come or anything not come, you go still in a quarantine. But around the 13th, 14th, or 15th day, they will come around and test to now. Then when they test to now, that result is confidential. Then that result will be released to UNA through psychosocial and surveillance them. And then that's what they do, psychology, for calm the person down and explain to and say, now so and so don't happen, you don't understand. Now this and because sometimes you go get family of 5, now 2 being really the near this primary person. So now they catch up from them. So that 2 they will be near this person now. Then we go for explain to them. Say sister will be near, brother will be near. You don't say be positive, but now 5 will at this house. Now 2 don't positive first. So then they extract that person there. Now case management, and then they deal with that.
Okay.
So when case management take that person away, then 3 and they were there now. Will they come in and tell them say we go look for on a government quarantine. So you will be isolated. So that way we will be able to contain. Then on our house now, we send what we call the IPC team, Infection Protection Control. So they go in there and then they disinfect. But security is still in at the house. Because as I mentioned to you earlier on, your personal property and all of those from end to end is our responsibility. So they left the. So now that 2 persons they can go now in a hospital and case management. Are you with me? Wait on well. In they come back, he return to your house. So you're able for living in your house now normally. Then we they pull security. Then 3 then what I explain to you, we deal with we they wait another 14 days, they will test them. If nobody not positive they too will return back to their house and they take possession of it.
So now based on the test where una do, una can pull people in from homes.
Yes.
And then go to them now quarantine homes.
Yes.
Now government owned.
Government quarantine
So
sites.
recently, I don't know if you don't come across that video. We see some people already in a quarantine homes. They make allegations. Say some nurses they will be there among them. Now don't come out. Some authorities, them security personnel, them allow them for me them come out and left them there.
Well, I heard from nurses where and we say then discharge them. But now they say they not discharge them, they just went out on their own. And I don't think a medical professional will behave in that sort of way.
So what really happen?
You know, law not drive this response based on everybody social media because it's not regulated.
So how best una can monitor, una as the pillar can monitor then quarantine homes and they foresee everything they intact.
It's 28 zones. Now don't divide the place too. That 28 zone we bring a count down to 4 or 5 per 1 supervisors. Because of this surgery they do now, we have even increased the supervisors now to be 2 or 3. Because now these 3 days are already locked down, we're able to move faster and for assess most of the gaps that are there. So we don't release now about 2 or 3 more people. We don't join the team. We work within these 8 sections, they already tell you so, for handle everything all the way from rural. So now we get more reports faster because it's locked down. And as we're getting reports, and so we assess and then we go forward.
Okay. So let me talk about the psychosocial facilities for people where they in the quarantine. Talk more on this facility.
When you use psycho, it means psychology. That means that they come in and try to calm you and understand which now your anxiety, which now you fear, and then they explain them to you and for calm your anxieties and your fear. Where you get, for that you be able for know it now the transition. As I tell you earlier on, you and me, we not one day get with freedom taken away from we. Trust me, as human being, you don't free for 20 years, you don't free for 40 years. Then all of a sudden they lock you down. You know, you get a different reaction. So these are some of the things where these people who are specialized for deal with that kind of aspects, and then they go in and do that.
Okay. So tell me a little bit about the quarantine homestay where they upline, how they operate.
Okay. Now recently, we don't decide now, say for now decentralize. So as up to about a week now then get the district coordinators then. So in that training for the district coordinators, I was invited to do a presentation. And one of the things that I asked them to do, and prior to this lockdown, now for let them appoint managers that day, where me go able to work with from here. So because I cannot be in everywhere all the time. So during that decentralization process, we now, the EOCR, gets a desk, what we call district support desk, for help for support them at a far region based on waiting in the same country. And so they're able to support them and get things done.
Okay. So generally, as we close, how the situation like na quarantine homes the way una dey in charge of?
Well, we're not going to like for grade myself, because I don't think so. You don't want to see fisherman say the fish rotting. But I can assure you for saying my own fish, and this work what they do, we are on top of it. And this lockdown, they give we a lot more time now for move, and let go able for identify and isolate quite a lot of people, and new one for appeal, for let people already out here, we go read this. Yeah, we not cooperate with we. If we not cooperate with we, it even lessen some of these problems they want to get. So this repeated quarantine business not going to take place. Because you go on there isolate, you don't prove yourself now from your hotel room, say, me not gonna, me negative, now me they go so. But if we are all still in the same self area, and they resist from not being going into government quarantine, then the virus will still circulate. You know, you are trying to take them out of their comfort zone. Even if you offer them everything else, it must satisfied with a small room where they being yard, now that will stay with it. So it's a way, now this is not appeal. So do I beg them, when this term reach, we don't explain to you, cooperate with we. It will help you for break the cycle and the chain, and a lot of things then will begin come back to normal very quickly. But if the virus, they allow let it go ahead of we will they try for catch them, then it becomes a problem. Now cooperation, now we need the general public and us.
Okay, so during this lockdown, the 1 day and second day, 9 day and so now, when I don't get any people, when I don't see they're supposed for dinner.
Oh yes, wait for dinner. Yes, they don't move. I don't want for the call locations them, but people are cooperating. Some are not, but some are. I don't identify the location them because it's confidential business. But quite a lot of people in the cooperate. Okay. So far, I think the lockdown really changed their mindset, because now when they're looking at it, they see nobody, so they know say other citizens are complying with the request from government. So therefore, then say the greater awareness day. So it seems for the go a lot smoother, to be honest with you, with the lockdown coming into effect. Because if you there by career, then you there inside quarantine, you there all the months of money they go, everybody's moving. You don't say, hey, why not me want to go no more? No, me say there, let all there. But now when you wake up the next day in the morning, you think, say, hey, nobody is serious. People are complying, so you know you get some response.
So yes. In total, almost quarantine homestay we get all over.
All over the country, we will get 76 different locations. We get 735 people waiting inside quarantine. Now the province will get 46 locations. Yeah, Western area are 76. Okay. The province are 46.
So you make a total of
122.
And that's now Wani Gahuja been a talk to the National Quarantine Manager at the Emergency Operations Response for COVID-19, Dr. Francis Dove Edwin. If in case you just join we, this is a special program called Corona Talk, where they reach you from different radio stations across the country. Now, the Sierra Leone Association of Journalists / and the Independent Radio Network (IRN) come together for bring this program to you as part of the / Corona Response Initiative. Mina Musa Baisise
and Mina Wani Gauja. Well, on the line now, we get Joshua Abiose Duncan, way at the head of the Mental Health Coalition at Salone. As we all know, Master Sabi people them say psychosocial need and support na thing way important for people who tap na quarantine and treatment center. So we get Joshua Abiose Duncan, way at the head of Mental Health Coalition na Salone. Hello.
Yes, Wani and Fambul Demuna, good evening.
All right, good afternoon. Welcome to the program.
Yes, thanks for having me.
All right. Okay, we all know say during crisis we can get people away can be affected psychologically due to the crisis them where we can get. So I want to explain Giwi as psychological expert how that can affect people their mental health during crisis.
Of course, we go realize mental health not an isolated thing. Yeah, health according to WHO focus on 3 main areas. One part they focus na the physical, where a lot of they place premium on. But there is also what we call the mental aspect and the social aspect. And now with COVID-19, it not only affect the physical, it also affect the social norms. And so if you realize when 2 of these, they already in motion, the obvious outcome of the third is always visible. So you go find out, say, a lot of people, the fear, issues around fear of death. Yeah, people then become anxious, worried, waiting the happen, how I go able for survive. The level of stress, they go high. For people that we don't go through traumatic period, you go find out, say, like maybe the mudslide or they may not become victim of Ebola. You go find out, say, you're able for begin go through what we go call the flashback, the horror, the terror where they may not go through. And these are normal reactions. So let nobody not think, say, oh, we say the mental health is there for just a few people. Even around the society, if you check the number of fear at this moment is very high. So the mental health aspect is quite impacted because of COVID-19.
So with all waiting people and don't go to, what do you feel say now the importance of psychosocial facility during crisis time?
Yes, of course, like how we go take with them for plan for treat the physical. I think say now the same way for plan for treat the mind and the social aspect. You see what you do normally now for just blend the psychological and the social and then call them psychosocial. And if you also treat the physical, you left the social, it means to say if you left the psychological drowning, then the person not okay because we think say now where the mind sound, now the body sound. So the need for talking sessions, the need for talking therapy, now what they were able for help the individual them for able for cope with the stress. Remember, now 3 way people in the check for respond to stressful events, whether it's traumatic events or not. The first one, now for free, you panic, you never go before, you never come there. You just stagnate, you just be one place. Yeah. The second one, people then go look at them now for run away, for flee back, run away from the situation. And some people can run away from the situation by the number of pints of beer we then go take, by the number of, several things, factors for run away from them. You go agree with me, say, as long as you use for run away from problem, you go always wake up from it and back. And the third reaction are for fight. Each of the level here, you need external support for help you for move from the negative of those levels for move forward. So the one the way freeze, they need what to say the resilience building effort for make up the mind for face the crisis. If you make up your mind emotionally, you know what is happening? It gives you the strength physically for fight. So psychological support, now one way very, very important for help the ability of the individual for overcome the panic and the stress.
Okay, so with all waiting we people long go to now the country, taking into consideration the war, the Ebola, the mudslide way recently be happen. So una feel say people and mental health don't be considered in a salon?
I think say a little effort versus Ebola, but I also think say the gap still huge. The gap still huge. There are systems, yes. There are structures, yes. But how we be able to get the right people for provide the right care? Yeah, you not go call carpenter to go do surgery. You cannot. They go possibly take nail and hammer and waiting. You know, and ad hoc training, now one way they respond to immediate need, but even prolonged crisis situation, they present difficult mental health problem. So I think say we still need for put more attention in not just saying we dey provide care, but that we dey provide quality evidence-based care wey for help people in our society for say yes we trust the system and we don't already see system in place for move ahead. Let me bring the other one. There are those who actually not get the condition as a result of the crisis. It been done there, but this crisis issue trigger them. Always we dey focus around now. One them na quarantine homes, one them na treatment center. What about out in the communities? Those who are already getting relapse. How are we doing for them? You know, so for me, I think say there is huge more gaps to cover. And if we not cover them at this time with the right approach, the rippling effect Bambai could be very, very great.
What they expect now from the government at this time?
Say again, please.
Like social support for people living in quarantine homes and people in isolation centers.
Social support for people within a treatment center.
Yes.
You see, let me tell you one thing what I think. I realize a lot of we approach to support sometimes be on food and drink and some basic items. You can then a certain condition, the appetite set for it not be. You put the food before the person, it takes it's about bang a month. Okay? Or possibly the person in a treatment center, he there in strong panic, then you go talk to them. We approach for change small bit. So for me, I think say you forget the ability for able for ignite discussion when at the person self the channel you only the guide them. I realize that in salon and even in a wider setting, we rather want to talk to the person out of the situation rather than, we allow the person to identify waiting in problems, waiting in capacity for manage them problems, waiting at the alternative, waiting at the coping mechanism, and then we get professionals we go reinforce that one day. One for tell them, say, brave up, boy, you na man. Brave up, boy, how you dey make like you not believe in God. But brave up, boy, those ones is like you they cause the person for paint the cracks. For me, I think say there is huge more need for training, not to just limiting itself to food distribution and other items, or the way we would call people counselors for talk you out of your problem, but the ability for able for approach people with the right skill, let them identify their own problem, look at waiting at the solution created by them, and what steps they can use for able for make sure say that solution they work for them and it become relatively permanent. Then a resilient building.
So as a coalition, waiting on our own role way una dey play now at this time.
Yes, in a crisis situation, just last week we done 3 days training again for reinforce the professional skills of the mental health nurses. I want to appreciate the national coordinator, Kadia Savage. Now, one person we realize we can make use of the nurses, but also if we not them for building self-your resilience, then go burn out. So the coalition with funding from CBM and in partnership with the Ministry of Health and Sanitation and the University of McKinney, look at how we can strategically approach this. But the second thing we always go do Now, for make sure make professional skills available, and we're ready for if those training ongoing. So we send members them for effective service delivery. At the moment, we consider for see how we can work with SLUDI around disability and mental health issues. I go tell you one for free. Already with the partner with Social Work Sierra Leone for distribute food 10 days there. I'll tell you for free the number of package where them go give people with mental health challenges when one day within the street is very insignificant. So advocacy, like them they are where they raise awareness and do this advocacy. Now one way we always they make use of. And we will continue to see how we can make transformation as much as possible in every facet.
So una get any plans now for able for work with the government in the area of giving psychosocial support to people?
As was in Ebola, so are we still. Yeah, we only look forward for effective forum. Right now we work more with the NCD and Mental Health Directorate, but we go look very much more for see how we go able to work with Ministry of Social Welfare for possibly add more training to the psychosocial workers we then get, so that they go able to look at idioms of distress among people in the community and as well in the quarantine homes or possibly treatment center. Identify those idioms, provide sessions for them, and when cases are critical, make referrals to the mental health unit for post-care session. When that happens, we need potential mental health problem in the board. So we are more than willing, and our hands remain open, and we would continue to contact them to make sure that we are able to provide this kind of service.
Good relationship with them, because when they work with them back, una supposed to get good relationship with them. Now then they go make the una efforts not go in vain.
Psychologically, around the relationship can be defined from different ends, but at we yet for tighten the relationship we get. We've been working with them, but we still look forward, especially with regards to COVID-19, for tightening the relationship.
Thank you so much for where you join me in the program. Well, that's Nabi Joshua Abiose, Duncan, the head of the Mental Health Coalition. Now, Salone, they talk about the need for psychosocial support for people where they in quarantine homes and self people where they live in isolation centers.
In Akushe, me Salone people them. Me in a fantasy ways, folk singer, activist, and children's ambassador. Life precious me people them. Do ya not be careless with your life and the life of other people them. So today, I can tell you 5 things where I can do for keep me and my family safe from the new sick COVID-19 when the corona tumbu they cause them. 1. I can wash my hand with soap and water all time. If soap and water no day, I dey use hand sanitizer. I can rub on my hand fine. Middle my finger and even on my fingernail for kill all the tumbu and sometime we go on my hand. Where are the cough or sneeze? Are the cough na tissue? Where are the two way na dirty box? If I no get tissue, are the cough or sneeze na my elbow? Where I can wash with soap, but if na long sleeve away, I can change them fast. But that's safe not easy, so I can make sure say I get tissue all the same. Where are the greet people? Are they wave, bow or shake me head? We know they shake hand or hug because we know they near we safe. I know they touch me eye, nose, mouth with me hand. Where I no wash with soap and water or use hand sanitizer for make the corona tumbo no go enter my body. I know they go na place where people boku. I know they come out again safe. But if I get something for go do when necessary, like for go buy it or other thing them where we need na us. Me wonderful people them, well body na gently. So do them thing ya for keep you and your family safe. Because life precious so.
This message comes from BBC Media Action with funding support from UK Aid from the UK government through the IGA project.
If you just join with this now special program we call Corona Talk, where they reach you from different radio stations them across the country. Now, the Sierra Leone Association of Journalists, SLAJ, and the Independent Radio Network, IRN, come together for bring this program to you as part of the SLAJ Corona Response Initiative. Mina Musa by Sise.
And Mina Waniga Uja.
And don't forget to add the voice to the program. Send me a text message to the number 077-981-981. 077-981-981. Or send me also Iguna Radio Democracy 98.1 Facebook page and drop your comments there. Ask your questions, then wait necessary. And like we promised you earlier, we don't get now the studio now. Harold Thomas, Communication Lead, EOC, and Seth now the Program Manager, Health, Education, Ministry of Health and Sanitation. It is at the studio for give you the latest situation on the COVID-19 sickness in the country. Mr. Harold, good evening, welcome.
Thank you very much.
I see you look tired, but at the same time, people want information, so you just get for there.
Yeah, no problem.
All right, so we're going to make them quick, though, but like I said, people still want the information. So let's start with the very latest in terms of this COVID-19 situation at the country.
Well, today, the 4th of May 2020, we get a total of 178 people. So far, we confirm positive for COVID-19. And the total number of deaths, today, all the deaths already recorded so far are 9. And we get the active new cases now 12. And the active cases as isolation now are 132. We also get the cumulative recoveries, that's the one that we don't well, 37. And we get 1,385. We're currently in a quarantine. And we get the one that we don't discharge from quarantine, we get 1,721.
Okay, let me take the die case we happened today.
Yeah.
So give me information about the death.
Well, we get one death today. Unfortunately, one of our colleagues, we a health worker, the first health worker we actually don't die as a result of COVID-19. You know, now a health worker, we been very, very hardworking, and unfortunately, he don't succumb to, this COVID-19. You know, we hearts and minds go to the bereaved family and all the health workers in the country, because they die in the line of in duty, and with the condolences go to all families and friends.
So una don't able to get any information as to how he able to contact this disease before he die?
Well, this information actually, we actually get COVID, become COVID positive, probably because he contacts with somebody we already been on positive. Now that I will say, and now that's actually now one of the problems that we lead to in death, but it been gets other underlying health problems, and we've been in battle with also.
And being that now a medical person and he just get sick, we just understand so he get like for be confirmed like yesterday, and now he don't reported death. I mean, people will become worried as to like how we go about for do the contact tracing now for ensure say when possibly get all the one way maybe if you don't come in contact with before you can die. So
yeah, if person die, this is also the first time we don't even get people away. Them in die after the test results come out. This is not the first time. The surveillance, and that means the surveillance and do activate them protocols right now, and then they do the line listing and also the contact tracing, and then we're able to get all the contacts, the primary contacts them, and even the secondary contacts them. Then that's the end of the young work, and then we'll do them like how they do for other cases then.
Okay, so people don't they raise concern about the increased in rate so they get for people we don't they get the COVID sick na district level. So how this can happen where lockdown they na the districts them?
Well, this one actually not within these 3 days lockdown it happened, but we know say this person actually they both actually. And we can get some.
No, they talk about the inter-district lockdown.
Yes.
So how the spread the happen? where people they know they go offline and the one they offline no they come.
Well, you go see plenty of people now.
They minimize the movement from district to district, inter-district movement, but we not stop the movement at all because say essential service workers and other people and the way they move like the one the way they transport food up and down, or if you get essential service and important duty for do. But we go imagine say if we been just left and open, waiting me for happen. We not say it not go be 100%. We not go get some 100%, but we don't minimize to a good percentage the number of people that will travel.
So what's not the criteria for let them give somebody pass for go offline? If you not get for go with food stuff.
The first category now people way that they deal with food and food items. The one and they, as long as you don't load your truck, nobody not go stop you at the checkpoint. The only thing I go just check whether na food stuff you go with, and at least 2 people and with they accompany you like the driver's mate. If you not get any extra people in there, they not go stop you. You don't need pass at all.
I will explain this. Somebody will ask, whether in doubts as to, now that we get some measures, we get lockdown, inter-district partial curfew day, and so many other things, and now we don't get, an increase in the number of confirmed cases. Somebody will say, in other words, the measures that are not necessary. I will explain that. So
it not go be wise for say the measures are not necessary. The people that we sit down and then take this decision, they don't look at a lot of issues then. And if person be positive today, I mean to say that during these 3 days, it don't get contact. We know say COVID-19, the incubation period, that's from the time where you go exposed to the virus to the time where you get the first sign. It will be between 2 days and 14 days. So if person positive yesterday, today or tomorrow, not mean to say that today, during the lockdown, he gets in contact, he exposed. So that's not the science behind this one.
Okay, let's look at day 2 today. Day 2 slowly comes to an end. So far, what's going to happen?
Well, day 2 we still meet with the objective, and during this 3 days lockdown, we'll be making plain say because we get some evidence of community transmission. We will use these 3 days for let we go do some random tests, na the community the way we call hotspots area, about 5 areas then where we go talk to people and then go voluntarily come out for where they're not in our quarantine, but we go just randomly take samples them. Let the results come out, then we go able for get good evidence for say we get community transmission, and that's what they do these 3 days, in addition to other things that they do, like for do with contact tracing, for do with messages, and let people, they will stop people from moving. So, but after the 3 days, we go able for know because we don't get 5 areas we will call hotspot areas where they do random, testing, so that where people agree for do the testing, we just test them. They're not linked to any quarantine.
So some of them 5 random areas then?
Well, we get certain areas then, all na the western area like Thompson Bay, Susan's Bay, Kuntolo and other areas then we na hotspot area, which I mean na areas that we will get high cases. For today, so far we get we don't get for western area urban 102 cases and don't come urban. The rural we don't get 22. Port Loko na 7. Bombali we get 6. Tonkolili we get 3. Bo we get 1. Bont we get 10. And Kenema we get 6. So if you look at all them figures there, we make up, this total of 178. You go see say the sideway we get plenty active cases them. Now western area we get 102. Followed by western area urban and western area rural we get 22. So that area then we want to know whether, apart from the cases that we link, whether it did not the community we will not know. And how you go know? Pass you do what we call random testing and we go able to know whether.
So how na get for go about doing the random testing?
Well, we dey go to the community them, we dey talk to people them, when they agree, then volunteer for them, we take them test, so that we will know whether it's in the community, whether in not.
So after the same way when they test for if it's somebody positive of the COVID-19.
Exactly.
So una get enough test them for.
That's the question exactly about come to.
If we not been get enough tests, we not go venture. We don't assess. We don't know say for that activity day, all the tests and then hotspot area, then we get enough tests for carry out the test, and then they not go deplete. We test kits and we'll get for the one that we then a quarantine home, and the one that we they show sign, and even the one that we they don't treat them when they don't well, we want to know whether they don't do for discharge. We then not go stop. They know the kits. We get enough for do that one day.
So now something we una go get for continue. We not just the tap now then 5 side they will say you don't call so una get for continue and safe now other areas them.
Now well this now the hotspot area, 5 hotspot area and a western area with the drum. Because now sample, when we say sample, we don't mean to say we go all side. We don't choose them side in there. And inside there, not to all side of the community. We just say pick no more. Any side so that we go know. So that we go know which thing they go on.
Mr. Thomas, what seem don't be so far the good parts of this fete and safe the bad parts?
Well, the good part is any case we're positive. Or most of the cases we're positive. We they pull and do. Now make people and they say, hey, the case and they go up. But you they see say once person positive, enough for left now the community if we come out so that we go able for treat them and we go able for get in contact them. And if you compare the way we own cases and they go, compared to other places in the world, we didn't say we can say the cases are high. But if you look at statistically, like now 1 in a million. If you look at all them cases, you know, where they go. So you see, we not get 1 in like every 100,000 of the population. You see, we get like a 1 compared to the other country, the European American country. They 1 in 1 to every now 70. So now 80 to every 100,000 of the population. So compare them statistically, even though the population small. If you look at the percentage, you will not say we rate at which it increase safe or who the get case is far lower than other countries. Then. So this one and a good when cases and day na the community, we for find them out 10 cases and day. We're not going to say we want low number so that we know the test or we know if people are positive for satisfy people and know. When the numbers there they go, let the numbers then the 2 numbers then come out. The day when we go there 1 day, 2 day, 3 day, 1 week, we get 0. Let we say don't interpret them at the back say well this thing don't the good on. But as long as it day, as long as people in then quarantine places we they expect because after the quarantine 14 days we they test. And also you test 100, 200 people in for 1 day. So if you get like a 10, 12, and nothing say na boku then boku. Some countries then they get 100, 1,000 for day, then they get hundreds for day. But we they test so that we go know. And fortunately for we in the country, most of them people are they test. Some of them, they know they show sign. They not get they're not sick too much. You know. So that one and they we able for manage them well. Even the one that were sick too much. If then go in time, we go find out say we go able for help them. And the way the sick they go, na Salone, it's different from other side them. First time people then before we start this thing, people and they say, oh, how much ventilator on I get? But I tell you, some of the cases and where they get, even the severe cases, not all cases we even need ventilator.
So we not use none of the ventilators there.
No, we not they say we not use none, but the cases some they're not even they're not the presenting sign or the condition with them for even use ventilator. So and other people and then they come with other conditions where we call them comorbidity. Like you go get corona, if you get 1 or 2 different kind problems way been they affect you. Sometimes if not to corona self, that sick day back even for don't serious by you. So these are some of the things we they face.
So what are the impacts where this 1 and 2 day lockdown don't be to una work?
the impact is we don't succeed for slow down the spread of this sick. Because I say slow down the spread, the coronavirus in itself is not a move at all. If coronavirus then it is there even if you deal with person. Now people and they move on. So if people are not move, the virus not go move. That's not one. And secondly, what they talk, we don't see say because we get this lockdown, we able to forget people and for Sidom na us, for Sidom outside and day. If you want to do contact tracing, what they do line listing, is very, very much better for we. I not say easy for you, but it better because people are not they move. Otherwise, you go carry then say no, this person don't go market or this person don't go here, but we go able for meet them. So this now and the other thing what they do do this random checking na community for a certain community and transmission. Again, because of this lockdown, within these 3 days, we'll go able to forget what you want, and we'll go able to come up with the results and announce to people and say, yes, now true, we don't say out of this community, now so people them in the community, we get them or we not get them.
So, una don't get people in a way na suspected case where una need for go with na quarantine based on una surveillance so una don't do so far?
No, well, anybody where if you not suspected case, we not they go to with the test. When it tests positive, then if it's positive, we will carry gonna what we call isolation center. But if you there na a quarantine place, whether you sick or you're not sick, at 14 days we do the test. If the test prove positive, you will go to isolation. And if one day way they're close to you, then people and then self will go quarantine. And I make what they say, when you in a quarantine home, not say because we all done in a quarantine and a wall for begin right pala, we go begin the jail there and we self. Because if one person come out in that quarantine they is positive, if una all dey na your own place, una no dey mix, una no dey near una self, na that person dey no more than the care. That time una wey don reach 14 days, una dey go back na una house if una negative. But if una all be dey mix, dey do things in common, even that one person dey positive, una self una 14 days don una dey begin back. And the process go start, it go several times over. And it go become frustrating for una. Say, this quarantine, I don't do now, I don't go back, it can cause problem. But if you self, you there with yourself, you know the near your company, you there, you wear your mask, you know the touch your company, you know the near them.
So the surveillance team they go around and pick people where they see say sick, where they need attention, or get the symptoms of COVID?
Yes, of course, if you get symptoms of COVID, definitely.
So now don't they get any reports then they from this first and second day?
We go able for pick you up and we do the test. Or even if not to corona you get, if you're sick during this lockdown, if you report sick, the ambulance will come can't take you. Because before corona day come na this country or the world, other sickness me don't they. So if you sick like today, somebody when a belly woman, the person able for go to hospital, even if you not get past, if you sure say you this person he get belly, he get problem, then can able for allow you for go access the health facility.
Okay, so we get a very good number of people that now in our quarantine centers or holding centers or what have you. Let's talk about the welfare. How do they do what's some of the facilities then? Because before now we don't hear some stories with regards to people then they get some sufficient food, some amount of insecurity. What's it happen there with regards to welfare?
Well, anybody within our quarantine place, one, you forget basic things. Inside they sleep, you forget food, you forget access to water and other things. So, and we notice...
and they only get them?
Well, what are they? Let's just give you a background of how this quarantine they work. If you don't manage quarantine, most of the people they decide when I manage quarantine, not to government get them place and but now government shown because for now government don't take them places and it can be guest house, it can be hotel. When a government they pay every day, now government is responsible for the food, government and partners them. So then one in the day. But what thing can happen if we get new side where sometimes quarantine in the day, don't we need for quarantine? You know, for that moment there, we'll get some like holding facility first when they put you something at some kind other building, some kind of school and waiting. Tell them they go negotiate. And you go find out say, now people in private people and get the hotel. If me get me hotel, government come meet me and say, do I want this hotel, we want pay you. Even if you not they pay me, I say I know they gain. We'll not go force you know so. And we need for not make them people and they not mix in the community. We can go put them on one side first. Well, sometimes they not inconvenient. Say we they negotiate for get good place for them people and they and put them there. So that one day we can happen before that things can settle. Sometimes and they things not can work well. Because sometimes and they if we start back that day, that first day, sometimes your food not go can quick or you not go get what you need. But we can always say, we not say it's not easy, but you go, you know, this not a normal term. At least that small inconvenience where you get, you know, then they you they do them for the good of others. Because if you say you know they do that, they put other people at risk. So we they talk to the people that we can get, you know, some of them small problems. But anytime when they happen, we the goodie. The people that were responsible and the goodie, then sort things out.
All right, plenty thank you. Continue for stay with the studio. In name now Harold Thomas, communication lead EOC, and self now the program manager, health education, Ministry of Health and Sanitation, and they talk about the latest happening in the fight against COVID-19 at the country. If you just join me, this is a special Corona Talk program where they reach you from different radio stations them across the country. Now, the Sierra Leone Association of Journalists / and the Independent Radio Network IRN come together for bring this program to you as part of / the Corona Response Initiative. You can join me in the program. Send me text messages to the number 077-981-981, 077-981-981.
Mi people una kabo, mi na Kindo Amani, comedian na salon. One sick don can we country it dey right now where they call COVID-19. Where they come out by the corona tumbu and I want make we all the look we safe like how we dey look we famble them na us. In case some of we feel some of them sign there. Una listen no, me lovely people them. Una listen fine. One na dry cough. When me say when you cough dry one, the bolo no dey come out. And you dey cough pass mark one, pass the normal time where you balance cough. The other one na high fever, where you dey get pass mark one body. Sometimes they touch your chest, touch your back. If you feel the temperature, they go past IBD. You dey feel cold, you dey tremble, or even the tire pass mark one. Pass how you normal tiredness day. Some people them can even get wound inside their throat, what they call sore throat. You nose they run past mark snort water. You nose they block. You aid the heart. You dey feel pain or you dey run belly. Me sister, me brother, if you feel some of them thing there, just sit down and you all suffer. Call 117. Then go answer to you quick one. And tell you waiting at the next thing what you for do. Not go nowhere. Not allow person safe for come to you. Just sit down and you host and call the emergency line 117. Do ya? Make we all tin up tranga one like 43. Make we not allow like this 6 scatter in our country. Make we stay safe so we go save life for we tomorrow bye.
This message they come to you from BBC Media Action and UK aid from the UK government to the IGA project Gidi Kopo.
Family members say this is a special program we call Corona Talk, where they reach you from different radio stations them across the country. The Sierra Leone Association of Journalists and the Independent Radio Network IRN that then come together for bring this program to you. As part of this large Corona Response Initiative, you can be part of the program. Send a text message to the number 077-981-981. Just now, we beget the communication lead na EOC and serve the program manager na Health Education, Ministry of Health and Sanitation, Harold Thomas, where be the give updates about the recent happening way surrounding the coronavirus. Well, he want for left at the studio and we go counter and back and round up the program. Before you left we Harold Thomas, tell me a little bit about security na the isolation center.
Well, every isolation center, and we will say isolation, we mean the side where they treat the people that we get COVID-19, and also we even get the quarantine homes. We get people that win our security. We did it. We most of the time RSLAF people them that are the soldier man them, and also the SLP when are the police them. And then they provide security in them place and they. But when we say security, you know mean to say if you're a soldier or police, you did inside the house now or you did inside the treatment center. You did that side where not to the red zone, meaning not to the side where you go where you say go get exposed. But you did it for prevent people for make them not go inside there when are unauthorized people and also prevent people we're not supposed for come out and do make them come out. Now that's the security they do.
So una don't put extra measures in the place for make the incidents will be happen or happen again for let people and they run away come on our isolation centers.
Yes, we get people and we responsible for security. We then SSF they don't tighten the way the security they and inside and they don't try all over the country every day now, even a net something. The one day when the senior people and they go around for make sure say everything go on fine so that we will provide security, because security, as I say, and for let people and we unauthorized people and we not supposed for go inside and they not good, and people that we supposed for the inside back mid and day, and there we not get any problem where something will happen with the one themselves we did it as patients or even the quarantine home, the people that we did it, then self they need security, they need for people, they need for protect them, and the one that way they work there, the nurse then the doctor themselves and the patient as well themselves they need for for get security so that when they themselves will get collapse within Naya, we not will get problem Naya.
So how the isolation center different from the general hospital so people can go for treatment?
Well, isolation center for COVID-19 now place where they don't set aside say this now COVID-19 place for treat people in.
But you then at the 34 hospital.
Well, why I say isolation center, I make they call any hospital the name because different isolation center they not 34 no more but other side and they back when they treat people and they way and not think say even necessary for calling places and they but any side where government puts say for treat COVID-19 place na isolation center. And even normal hospital like what they talk them Connaught Hospital, Cottage Hospital, Bow Government Hospital, then they not they treat COVID-19 cases them, but then get what we call temporary isolation center where they go get 1 or 2 beds where not they near outside in the treat in case, because anybody can walk in at the hospital, but if they walk in at the hospital, you the clinician or the physician, you look this person's pain, you say this person I want suspect say he gets COVID. You're not going to make it go under because then they do triage where you go through all, or they're not going to drive you say, hey, go. You're not COVID patients. Then go carry you go, then go put you under. Where in all of the people then where they treat you, where they're at the hospital, they're not go there at risk, or other patients they're not go there at risk. So then can even the person go there conveniently, even say then taking test. If he positive, then transfer and go to the actual place. Or if you're negative, then put her now with other patients then where you not going to pose any risk to the staff and other patients.
Okay, so the people are waiting now at the isolation center, they're waiting at the present situation now, like the patients them.
Well, a good number of them people and they in stable condition. I say a good number as I talk so right now. But patients sometimes the condition can change at any time. But as far as the time with the report, a good number of them then generally in a stable condition.
Okay.
All right, I think one some messages don't be done. They come where people don't listen to the number 077 981 981. Just before Mr. Howell go referee because he seem very tired, but he said just going to bring the information to people. So this first one, yeah, we possibly go try for respond to. Therefore, say need day for make government to give 14 days lockdown so that we go able do contact tracing and treat fine one. And this one come up from SK Bawa in Kenema.
So this why they say IRN, I want to know from the authorities concerned that if person die from COVID-19, if the virus self go die immediately or go stay alive for some time inside the body? If so, now for how long it is stay inside the body? This is come out from Suleiman Arukel.
I want to know how many cases Salone don't register and almost people then die. And I also want for tell thank you to people then na Salone na Safroko chiefdom for them work hard cooperation during the lockdown. This they come out from Ali Badara na Lonsar.
This why I say, sir, I want to know about Bont district from Tibe na Matu John.
Okay, not only one way for fight this coronavirus. Any disrupt way we get this message not too clear, but somebody will send this message from I not even put in it. So let's take it. So I know they say if fine for respect the law, stay home, stay safe, always wash your hand, and save yourself and save Mama Salone. This one come up from Davis. Somebody in Davis Streets na Kenema.
This why they say, sir, I want to know almost confirmed case them any recoveries we don't get as of today.
Can I use pigeon and soda soap, pigeon and soda soap to form hand wash situation or solution rather to wash my hands from somebody not writing name?
Okay, Mr. Halton, you want to answer?
Okay, I will begin from the last one. Soda
then
soap,
we
yes.
will come back to the
Soda soap, yes. You can use soda soap, you can use black soap, you can use Africana, sand soap, any kind of soap for wash your hand. Once na soap, you can use them. And somebody also be they talk about how long if person die of coronavirus, how long the virus it take. You know, corona. Enough fever, Ebola, and quite different disease, Corona and Ebola, because just a virus. So according to the SOP we will get with standard operational procedure for person we get COVID, you know, when he die, you know, if na COVID he gets, you know, the health authorities then go supervise that burial, but then can even, you know, put that person there, na coffin. You can watch them, but you not for go too close to them. Because like Ebola, the virus is very different from coronavirus. But the people in way they do the burial, then go do the burial in a safe way, and when they're done, then take them for make them, you know, at least then go wear gloves and wash their hand and everything. But the Ministry of Health people then go guide people in how them for bury coronavirus patients them. And also the person we talk about 14 days lockdown. Yes, we decide say we not go do 14 days lockdown for now. How the situation they go, sometime we will come to that. But then 3 days there now it very very strict and it's sharp and it can make good difference. And not all these 3 days no more. We know say we also get interdistrict restrictions for travel, and we also get curfew. We still dey on even with the 3 days lockdown day. Then it's 9 o'clock to 6 o'clock. We still dey observe curfew, and after this, until further notice, we still go dey, you know, all the measures and they put together go help for make we slow down the spread of coronavirus.
Alright, a quick message away something you also necessary for make a response. So somebody they say, please and then new case there now it just they happen as a result of the lockdown or they be done they record them prior to the lockdown. Somebody we name Ame Ike of Konakri na Lunge ask that question.
And this other one they say, what type of specimen do you normally take for the COVID-19 test?
Okay, now then cases here with the come. Not to say now because of the lockdown, make the cases and they come. Because then cases there are already now people that we've been already infected. But when some of them now when we reach it 14 days, now with the test, and when they came positive, then cases and we can put them outside for put them and we we also monitor the contacts. The other
you
one.
said what type of specimen?
Okay, the specimen. You know, the laboratory people then get different type of specimen where they take. Then get swab. wait till like that cotton wool board. When they put inside the person nose, now they rub, then pull them, then put them inside one container. Where now they go test. It get big name. So I will call the name. Done some again and can take and then put her inside in throat. Done some 10 and there, then get also then can use blood, where they can call PCR. We insert back in a big scientific word, but then can use blood also. And because Salone, we don't so advanced now, we're not a laboratory, lab assistant there or lab technician we get with all due respect to them. We get laboratory scientists there now. And up from PhD level to master's level competence. So one thing they self-way Salone, not being get the viral transport medium, where you take the specimen. One side they put them, make it all right before they go test them. It been done. Now then self able for make buffer viral transport medium for some time before they know the actual with manual come. They call them get the formula, they make them well because they want in don't even and they do the PCR where insert back now blood and they use for do the test, they're able for do that very well. We get over 8 or more PhD people within a lab. We get plenty master's level competence. And I could not call them laboratory and technician or laboratory scientists them. So they're able to do a lot of things them. And mind you, we will not begin tests before other countries themselves begin test.
So now also one more una can use. But then 3 category where you don't talk about.
Well, it depends. We get different kits when they come in. But mostly we can use the swab kit one them, we can use them back. Then the other one when they use blood back, insert self with the user. And we don't cut down on the turnaround time. When I say turnaround time, 12 hours. By the time the thing they go, then they're able for run that testing.
You get the results the same day.
Yes. Sometimes first time they take 5 days, 6 days, but now we don't cut down. And what they do now, because we're not even in first time where they can do some then for control, for let them show. Then they ship and go that country. Now say plane and they go again. And that make we always they do control same. Where you do on one lab, they do on the second, you do on the third lab. The results where you come out if not negative, all come out negative, say yes. Positive, all come out positive, say yes. So we not they take non-chance. We they do we they test different side for let wait will say person positive, positive. If you let Usa you go, we say in negative. So we do all that one in this country.
What can happen? Okay, say they need to test somebody at one point in negative, at some other point then it become positive, or maybe somehow positive and also it become negative. What can happen with then things and they can?
No, we not test if negative then it become positive. Then get what we call indeterminate. Indeterminate, sorry, become a big word. That they can mean to say sometimes it can be between negative and positive. So that ended back, now make we get rerun with the do and back, it take all that 12 hours, then we do and back. Sometimes now so it can come out. It can be in between.
So possibility they say una can do test 2 times per person.
Yeah, in fact most of the tests, at least we do and 2 times. When you do them in negative, they do confirmatory. We not they just do one result no more, we say you're positive. If you're positive, they send another side for let them confirm. The person the side what they send, then they don't know the result too. They don't know if it's positive or negative. We send them where we make them compare the 2 results back.
Okay.
First time where we not been too sure, when we just begin to we do like 4 different sides. But now at least we do on 2 sides for make sure say we know what thing we do. They will not say person positive tomorrow in negative. So now that make them they do and so.
For Gud Mornin Salone and development. Brother, sister, mama, papa, unayerio. Brother, sister, mama, papa, unayerio. The Independent Radio Network, where we they call IRN. The baton we country Salone. For make we get level playground. Now I ain't done enough. For make you know about your country. They give voice to youth man them. They give voice to woman them. All political party them. Right across the country. You go na the east, and you go na the west, you go na the north, and you go na the south,
All right, you're still listening to this special Corona Talk program where they reach you courtesy of the Sierra Leone Association of Journalists and the Independent Radio Network, IRN. Well, we'll try to wrap up now with Mr. Thomas as they try for making me. But just before you go, just quickly, somebody asked if coronavirus can be transmitted by money from hand to hand. And this will come up from Karimna Moyamba. Just quick, and you wrap up now.
Coronavirus, any article with it, it's possible for the good. That's not the reason that we make you say, once you are all time, use sanitizer. So, because we not know any objects or any surface it can do it. And the other important thing I want to tell people, even though they wash we hand, when they use sanitizer, let us not just bank on that one, let we they clean with surfaces them, then do not handle the way they touch, then counter them, then table them, any side, the floor, the wall them, we for always the cleaner. If we not get antiseptic, use soap and water for clean them. Because you go down wash your hand good one, you touch table, or you go turn the mouth handle, or motoka knob, you turn them, then you rub your hand, you nose, you mouth, then you get them. Or even the money self would say himself na side when an article. So, but we not put say specifically money, but it's possible. So that make we for always wash we hand.
All right. I'm going to tell you plenty thank you. Name na Harold Thomas, in at the head, in at the communication lead, EOC, and self na the program manager, Health Education, Ministry of Health and Sanitation. It will tell you about the latest in the fight against COVID-19. Plenty thank you to you. Hope I'll get you back tomorrow before we wrap up.
King for Gud Mornin Salone and development. Brother, sister, mama, papa, Radio Network, where we they call IRN. The baton we country salon, for make we get level playground. Now IRN don't enough, for make you know what you country. They give voice to you, man them. They give voice to woman them. All political party them, right across the country. You go to the east, IRN, and you go to the west, IRN.
Well, Fambul, as you all know, this is a special program where na Corona Talk, where they reach you from different radio stations them across the country. Now, the Sierra Leone Association of Journalists Large and the Independent Radio Network IRN come together for bringing this program to you as part of this large Corona Response Initiative. You can be part of the program through the text message 077-981-981. As they carry on with the program, we don't get to the studio Kalilu Totangis, where the chairman for the National Council for Civic Education. Good afternoon, good evening, and welcome to the program.
Good evening. Thanks for having me. Good evening.
Okay, so before they can go into what you come for, start what tell we first, but what in our work they do for fight against the COVID-19.
Well, we are part of a greater team where they do this fight because not so one man fight this is now all man fight from the beginning of this thing. When one of the first institutions that we put out posters then about 5,000 posters that we share all over the country, and also we don't go at the two border districts then, Nakambia and Pujon. We don't go help to mobilize the communities then. We don't work with the district. The district EOC, and we don't meet. We summon all of the 6 paramount children, for instance, that come here within at the border areas. Them, we talk to them, the Okada riders, the traders. Them, everybody no more way we feel say a need for them on board. We bring them come together. We advise them what's in their role. Government going to do one thing or the other, but the citizens themselves get a role for play. So we get to talk to them about the rules of the citizens. Then, thereafter. We don't engage with the EOC because some things since they didn't have written here, not all things where they happen upline, then go no. But we get people then we will work with partners and the upline with the advisory as to what's going to happen. So based on their advisory partners and the theory, and based on what we say the EOC for do, especially when it comes to the social mobilization, we are very key on this fight here. We don't work with the Ministry of Information. We don't help them. We don't draw up the strategic plan for social mobilization for this fight here.
We don't turn it over to the EOC. We expect, say, then go use them for men and go do this fight, because you know go just go on a fight like this, you go blindly. If you go blindly, you not go know what thing for do, you not go able for even measure whether they do the right thing or they do the right thing. So we don't do a strategic plan together with IGR, together with PASSET, they help we for do a strategic plan. We'll get a measurement framework where we believe say EOC go use for able for know which side they go right and which side they go wrong. In addition, we don't put with expertise on the support say we go help for train people there on things that they need for do. In addition, we don't go with partners them now UNICEF. We don't get somebody with the common at Tony Blair Foundation. Then they work on the document, the SOP, where the Indian go use the protocol they need for use for able for guide how then social mobilization workers them they go able for do their job, how they go able for use a glove, how they go able for use a mask, how they go able for use PPE, what they go do and ABCD. So we really believe say the EOC for be ready for take on as many partners then as possible in the social mobilization framework, so that we all go come in together and help them, so that we go able for train the people that they use for social mobilization, so that they're able to protect themselves. First, the people that when they do the social mobilization work, they're able to protect themselves, and they're able to protect the people that they work with, so that we make sure so we limit the number of infections then where they happen on any given day.
Okay, we can't talk about una strategic plans them way una don't put together in order for help the EOC for achieve some of them plans them. Well, you talk so una can go na some places them una they get some information where una feel say the EOC knocking know about. So waiting at anything in the waiting at the information in the way the EOC no know where they supposed for know where are the issues them where they affect people.
Well, in Baku initially, if not just a week or so, the EOC they don't appoint the district coordinators then. Before they appoint district coordinators, then we don't go out at the field already. We don't go all consultations then with the district EOCs that we've been doing, where they've been already faced with the challenge of this COVID, we've been on the come in this country. And they get civil society groups then. They get NGOs then within their communities then. We don't go already, we don't engage them. We don't hang head with them. Men tell we what's the challenges then we then get. So when we come up, for instance, together with PASSET, we go now Cambia about 2 weeks ago. We're gonna Cambia, we get a whole consultations with them. We even hold the radio program and open the phone line. People then begin call we, then tell we the things and the challenges and the things that we then feel say the government need for do. So we'll come back, we'll write a report, a comprehensive report of what the people then say and what we say find out with we. We'll write and we'll send them to that and they don't appoint the interim coordinator. We'll advise them of some of the things that we will see. One of them, they are the MPs, then can this be entered and go and the border areas then. The same things they will advise the interim coordinator and the EOS, and the same thing the MPs then kind of this on a radio station, so they sit down they explain the porous nature of the borders them, the role where the Okada guys and they play for bring people then where they come. Even the paramount chief, Magwema chief them, the things that they don't put in place for make sure say people that they escape from quarantine from Guinea, where they come, and they make sure say they turn back. We're already gonna corner some of the advice that we don't give to people that say if somebody's changer, it come now in a community, when I get a responsibility for tell the chiefs and for tell the authorities, they made them know.
So what's now the challenges them where the key one them we not able for put into that report?
Oh, the challenges then, but for instance, we don't see then there's the way one renowned Salone and journalist, you go na Kenema. You see the situation of the quarantine place. No excuse not there for that. Say people don't go lay down on school bench or don't put grass mattress. If people then they find out in that kind of situation and they go meet up and they quarantine, then go run away. And so they're not need for run away. The government don't put a amount of money where they don't put aside for this fight here. We don't also say friendly nations and friendly organizations and they give government money for help this fight here. So that is why it is very important that the people that were in charge of this fight here but take them very seriously. If you're not the leader of this group, you're not just sit down and listen, say people then can say, oh, everything they go well. find a way for make you go ensure say make you really find out say the things and they go well. Yesterday I had talked to the coordinator in Akenema district. Some of the things that were revealed are very, very, very bad. You know, that people then go in a classroom, we say mosquito go bed then, they go down na bench. If the leader of this country find us in a certain thing, they're not go glad at all. Because that's why it gives somebody responsibility. We expect say people for carry on the responsibility with all diligence. And we were caught between the people and the government. We still got a responsibility for bringing them to come out to the people that were in charge. So when we see them and we get the first responsibility now for write them a report, you know, officially and send them to them. And with the above say, then go act on the report then they. But when they not act on the report, then they will get the responsibility for bringing her out so that people then go know say, yes, we they find out what thing that happened to the people that will concern, and we they tell the people they're supposed to do the work. If they not do the work, we'll get the responsibility for bringing her out. For instance, that's what they happen at Kenema. Now something which should be resolved as quickly as possible so that people they not go begin balance and hide from quarantine. We believe say anybody will show the signs and symptoms where the medical people then say if they're in quarantine, they're not going to put in a 5-star hotel, but then they put on some side where it go feel comfortable, stay in quarantine, them down, so that it not go run away. It go begin to shape the sick, give other people then. Now some of the things they now they concerning to we, and as something that will go bring out to the authorities then, so they don't go take action.
So as part of the work we una don't try as best as possible for reach out to the unreachable, if I can put it in that way, the people in the way they are hard to reach areas them. Una don't try for going at them places then they.
Well, that is the reason why we believe say we for sure up we for strengthen this issue of social mobilization. You know, one man not go for the all side. That is why we get organizations, then they will get small organizations, they will call community-based organizations.
But at least when I don't visit one hard to reach place.
Oh yes, we don't visit not only one hard to reach place, we don't visit several hard to reach places then. For instance, over 90 border crossings in the Cambia district. If you go na Pujon district, for instance, you get 3 chiefdoms them, na Sorogwema, na Makpeli, until you come on the river area where the people that cross go na the area. So get people that way don't go na all of them places and they don't see the situations, and then they work now with the EOCs and identity them for make sure they don't go advise them how to recruit young people that were very willing. We don't give them time for me to go work with them for make sure say then go help them for make sure people don't go cross come inside. But so, the crossing from yonder to here, not the problem now. Now the crossing from inside so where they say we must do district restrictions. People don't go must spend way for bypass all of the regulations that they say they will do. So now that I know they happen.
So
now.
with you with una walk away una don't they do because you just don't make mention so una can go na hard to reach areas then. They hard to reach areas. What see una fair not is it that people know about COVID-19 then get enough information about the sick?
No, they not get information not ever enough.
They no say COVID there.
Yeah, people they know say new sick don't come. Now they compare to Ebola. You know, Ebola have been bad thing, but one of the good things that will come out of that, they know say a virus don't come, sick day, where then they compare to Ebola. You know, so it make people then they forget, but they don't know the extent of the sick out in the past. And people then they try to explain it, but that process they not ever enough. Now that makes things like what they do so very, very important. And so all of the radio stations, the way they will continue to do that, but we also hope say people then a picture, now they're able to take for read. But the posters that work in them communities then they not reach to them far-flung areas than yet. We need to make sure say we'll get more posters then go to them communities then. In addition, we need to activate them community mobilizers because they are very important. Some people then the one way they believe, if you go to some village then, if the chief not tell them, if the nurse not tell them, anything we tell them not to do. So therefore, them one way they respect. When they word they pass to them, we got forget them people then they on board. We got forget the community leaders they on board. We got forget the nurses then. We got forget the community healthcare workers then. We got forget the other people the way people that respect them word. We got forget them on board. May they help you take this information, carry and go to the villages there. When we do that, we got to help yourself because them people they the word they pass and their communities in there.
Okay, Mr. Asutangi, let's take you to another angle. Actually, you know, for some time now, government don't say for put face mask. like how we put them so for going to public places now compulsory, but clearly enough, even before this 3-day lockdown, they see people and they access the public transportation means them and other places, then still not they put on mask. What's in the national, the National Council for Civic Education they do for that day?
Well, we right now, as I talk to you, so we the chef of put today in the process of putting together some communication. We na jingle, na video jingle, na audio jingle. We're in the process of putting together, like how we're going to put other house together, so that will help that communication of what's in the.
But so not realize people that know they put on the mask.
Yeah, enough. we don't see them severally, and the rules and the way government don't pass. But whether there are penalties to that, we don't know. But we believe, say, for educate people, then for men to go see the benefit of wearing the face mask.
And it fall within our mandates.
It fall within with mandates. Clearly fall within with mandates. That's why we are working on that. Before the lockdown, they done so. We hope so. We go for putting things in there out, so that we go for educate people. Then for men to go know, say there is an advantage of wearing the face mask. Yes, people then can say, oh, it's very discomforting. It's discomforting for we all, but the benefits then outweigh the discomfort. If you wear face mask, you not only protect yourself, the other person within there, you go protect them. If you cough, if you get the virus, you know go for transfer. But if instead wear them, instead go able for help himself, so that you not go able for get her, and instead not go for transfer to people there are a lot of advantages then, but people they don't know what are the advantages then, and that will need for educate them. But maybe they not only go talk about the discomfort. Yes, the discomfort clearly they will honor me, they'll do this shadow, or they pass freely, or they do what you want to do. But difficult situation where it come, you get for deal with it in the difficult way. Now that make they appeal to people then, not to punishment. Now protection for yourself, now protection for your family, now protection for your family, and protection for the whole of the community for wear face mask. Very important.
Okay, so with una work them where una done they do, especially in our upline, because fit on people and get access. Well, some people and get access to radio, television, so information there on how for prevent themselves. People and where they upline, then they observe any amount of social distancing, like for wash their hands and do other things, then for prevent themselves from the virus.
You know, yeah, some amount of that they go on, but unfortunately, they go on as much as we want them, because there are limitations then. You know, people then go say, hey, they not get soap. People then say they not get sanitizers. These are realities. But issue of water is not too much of a problem. So the question is, people then they take seriously, not say they're going to wash their hand in all of the places then. But me no say some of the places where they don't go, the health center then, the marketplace then, we send more people then they meet all the cheap in house, then thing and day. But for some houses then get them, but for say the majority get them, I'm not gonna like you.
So people, based on una findings, Semona don't do. People applying, they afraid for go hospital or then still they go hospital.
All sides in this country, and it's normal. All sides of the world, including inside our own country, hospital attendance it don't drop drastically. People then they afraid for go. Basically, this fake news we don't come now part of the thing, you know. People then they because side they know they can no patient, no COVID patient. But people they don't afraid all sign and they know they even group for going to hospital. So then another thing I know we got for concentrate on. This is fake news. People then they talk about where they make people then they afraid for use hospital. So Bella woman said we're supposed to go do a regular check. We're supposed to go even do in delivery. They all the afraid now for go to hospital. So then a big challenge we need to focus on and continue for guide people, to educate people then as to how to do then and for make them understand say not all COVID, not all hospital they get COVID cases there. But if you even get hospital the way they go now, like a 30 so the COVID department is quite different from the regular hospital. So why people not go to hospital still where they get malaria? Because malaria na where people then get all of the time. Typhoid na where people then get all of the time. People then they go in up for belly woman business. Why they not go to hospital? Because the 34 hospital, the COVID side is quite different from outside everything else happen. So now that kind of education needed for continue for go on so that people then will continue to use the hospital for the normal sick the way people then can sick.
Una get any observation as to how people do not treatment centers, even though we don't get just some from the possibly maybe where we will say directly involved Mr. Harold Thomas just now, but from the National Council for Civic Education, una get any idea as to what they go on at the quarantine centers or holding centers?
No, any information we'll get that from the same source way like how don't give so then they go all.
So we don't know the reach inside and they for monitor.
No, we not do that yet. If we able for show up the social mob area, we also will be part of and maybe that will give you more access than we get right now.
All right, so they tune out today. What's in general don't be una findings in a nutshell?
This time around, I really say for what I all million worker today, I see a high level of compliance from the people of Sierra Leone. Then said all they sit up, they know they understand what's in the go on with this COVID thing. Yes, there were challenges yesterday about water and everything, but those challenges that has always been there, especially now when people they isolated and they hold them. So then challenges in there. But generally, on the part of the people of Sierra Leone, I not see there has been any breach. And some of the issues that have been against with the security forces, we've been misunderstand what's in that lockdown. They say people they sit down
during the first lockdown.
Yeah. So that they all don't minimize. So I think we don't learn from Chade, and I also will continue to learn and get the situation better.
Okay, so make I take you now to una strategic plans the way una don't put together as way for help the EOC for able for do them work proper one for tap the spread of the COVID-19. Waiting the inside this report.
Basically, and about strategic communication. Now the whole thing about this thing now behavior. Since we not get medicine yet, we believe some particular behavior change get for day in people them so that it will help for stem the flow or the spread of the disease. Some of them today, for instance, what they say wasan. Now a behavior will make people then take up, then a good behavior will make them go take up. The other one is social distancing. You know, today they will kind of begin hug with self, begin sit down near. We want that behavior, they make it stop. So all of that and the advice we don't put in the strategic document we don't give to EOC. But how that go happen? How it will happen is when the EOC chairman or whoever it is, not so they can go from community to community for go educate people there. People then are them communities and they where the people then believe, where they trust, where they respect, where they want the past. So therefore we don't put down a list of people them where for they in the national EOC social mobilization, including the paramount chiefs them, including civil society them, including even the security forces them, including the medical workers then. Everybody where we believe get something for us. We don't advise the EOC when I put them people here all together so that they're going to be part of an effort for mobilize the whole country. May all man believe this thing are not about government no more. This thing are not about nurse no more. This thing are not about doctor no more. This thing are all man responsibility. So we don't advise and when I bring everybody on board, may everybody play in your role for galvanize the society so that all man as Sierra Leoneans then go see and get a role for play for make sure we drive COVID in our country. On the nutshell, that day the strategic document we don't give them.
So what do they expect from the EOC at this time with regards to plans them when I don't put in place?
Well, already then don't appoint district coordinators then. We expect then go work with them district coordinators and they so that they go replicate the social mobilization committees that then various districts then. Already inside all of the districts then they will get like it's going to Cambia for instance. You get the ONS, you get Gold, you get the Okada riders, you get the market women, you get the chiefs then. You understand? You get the security forces then. All them and then they work together. If they all work together, then go able to make sure they all be part of this thing. So when they tell person do you me market woman and I'm gonna market tomorrow? The Market Women Association then get able to take that message then carry and go to the community, to the members then. So that then go own that message. You don't go tell like I said, the government no don't put a law upon them. Then go know, then go able to explain to the members and say the reason why we're not going to market tomorrow now ABC the reason it is to your advantage, it is to your family advantage.
Una at any time they work with the chiefs then because during the Ebola we all know the kind of role which chiefs them play, in different localities. Una don't they reach out to them at all?
Yeah, the chiefs them very important. I tell you, the first meeting we hold in Cambia. We take the 6 border the chief na Dixon, the chief na Mambolo, the chief na Samu, all of the chiefs then outside the riverine areas, outside the bush then they come. All the chiefs then they will go for sit them down. Now then go for tell you what's the challenges they wouldn't get. What in that piece will for do. And all of them they will put inside a report who can get to the EOC, way for guide them how for deal with that situation. Now they may even go for suggest they want a curfew. Initially Cambia was and then get a curfew. The idea not to government once you don't say we put curfew on Cambia. The idea come up from the people then say we need curfew now so that we'll make sure the amount of people the way they come and they come will go able for stem and down. Even where EOC say they want to kind of bring goods and services goods there from Guinea. They say yes, not true. But if you say one driver and three apprentices, that means there are 4 people there. So if 50 motokaa, 200 people they would admit from Guinea. They say that may not going to be a good idea. Then bring their own suggestions then as to how to limit that number because they don't want to admit many people them inside the country. So if we bring the people them, the local people them on board, the activities they want to do for stem this COVID, I think that will be the best thing with this thing we do. So the central government are going to take all the decisions there. The people then will sit down at the community then, they know the situations, they were different from the other situations, and if we work with them, it go better for you all.
When also they think of the messenger and the message in the sense, for example, the person they go talk to the people. Then maybe if you go there now as the national chairman for civic and for civic education, it will be different from if some other person maybe whether people in another particular area they go like for listen to more than you. And I can also think of them people and apart from just chiefs because we got some people that way people that really keep one for you from whenever they hear something from them, then good sometimes will be for belief.
Absolutely, Danny, and we don't find that out. Now that is part of the background research we do when the advice will give. Some people then they even pan social mobilization anywhere, even from theory, they say the message, you understand, and the messenger are the same in situations like this. So if you get the best message, say you get somebody go where they know one for you, where they not even trust, that message you know the pass.
Exactly.
But if you get somebody go where they trust, where they are the community, where they hold in bomb, what you know my telling, then they take hook, line, and sinker.
So then
kind people and they would encourage the EOC, mobilize them kind people in their communities and they so that we'll go able to listen to them. For instance, farm will talk. Farm will talk now some communities in this country. If farm will talk something, na final. Because then used to them, they believe what and they say. So that kind of people they will bring them on board this fighter, not to win them more for the Pantapan. Even in that community, they will talk about so. The Okada riders then what thing the chairman then tell them but and the final word and do you policeman like in IG say go tell you anything they not go listen to you. So therefore they encourage the EOC men and work with the community organizations then where the people them trust where they believe in so that then go help we for carry the message go to the communities then.
Okay, some of una findings them way una do na the border areas them. Waiting at some of them. Is it that people and still they come out other side and come inside?
Well, initially there was that challenge, but that challenge it don't minimize small. Even they go both ways. Some people they come on here, business people they're very anxious. They come on here, they don't go buy business and then bring now because they feel this is an opportunity for men to make more profit. That challenge they've been there. But and that's part of the reason is because we're not able for get security there is for cover all them porous border there. The main border crossing in Balamuya and Genema will be don't close them. But there are several other crossings that we they all over, even onto carrying a district, So them places they now be a challenge. But now there has been efforts, the military, the police, and the tax force then from their communities and they're able for lock some of the areas and so that gets don't minimize small. The challenge what they get, what they see say this district don't get, this district don't get, and all of the people what they say they don't get at then district and they now future and they come out then they go at then district then. What thing happen? We go say there should be no district, no inter-district travel. Yes, the commodities they go, but we don't see one video come out in there. If the truck go, like I say now food items they can go. By the time the truck the map, you see more time in the condom. What thing happen? Nobody able to see. Just check inside that truck. They tell where come up with until you go reach Nabo. So all of them tell so. So the security it can be lax something in there. People then they take them and they make seriously. People then they try for cut corners where they say law. Then they try for bypass the law by any kind of way. So man and they because of their stature inside society, they don't follow the law where they put the law. All of that, and I don't make this child to go to places where you're not supposed to go. Look at the case where we've been coming on go na Matrujon, from Matrujon, you go na Ile. Right now, we know say, Bond don't get several cases of COVID. Ile don't get several cases of COVID. We said, and they come out, that one game person where it been get privilege for going to them places. Now, don't do all of that, So therefore, we for make sure say, when at the law forbid the law. There should be no exemption. Personally, because he say me a big man of government or me a big man of this, you go begin make sure say he excuse them. If you do that, they make sure say if you get that COVID, they go give people then the other people then take it and give the other people then. So therefore, the security forces then get a responsibility. If they say this person nobody enough for pass now, If you not get pass, if the person not get pass, may not pass.
Okay. All right, so one for make it blow small. We'll come back to you and try for wrap up. Pambu, if you just join, you listen to a special program what we call Corona Talk, where they reach you from different radio stations across the country. This is the Sierra Leone Association of Journalists / and the Independent Radio Network IRN come together for bring you this program. As part of / the Corona Response Initiative, you can join me now the program. Send me a text message to 077-981-981, 077-981-981. Mina Musa by Sise.
Yeah, Mina Waniga Oja.
We'll take a quick break. One, you love small, not so.
Get your network, IRN. Don't enough king for Gud Mornin Salone and development. Brother, sister, mama, papa, unayelio. Brother, sister, mama, papa, unayelio. The Independent Radio Network, where we they call IRN. The baton we country salon for make we get level playground. Now IRN don't enough for make you know about your country. They give voice to youth man them, they give voice to woman them, all political party them, right across the country. You go na the east, IRN, and you go na the west, IRN, you go na the north, IRN, and you go na the south, IRN. Say yes to tolerance, we all get we rights. IRN say no to violence, no mix perfect neither blabber. But we all work together with one word, cause now so we go up for make salon. Brother, sister, mama, papa, unayelio. Brother, sister, mama, papa, unayelio. Economy and well-body business, quality education, decentralization, with agriculture and infrastructure, energy and power, with social welfare, for human rights, anything but development.
Famble members say this is a special program when a Corona Talk where they reach you from different radio stations across the country. Now the Sierra Leone Association of Journalists / and the Independent Radio Network IRN come together for bringing this program to you as part of this large Corona Response Initiative. You can join me and send your text message to the number 077-981-981. As we carry on with the program, we still get the chairman for the National Council for Civic Education, where na Kalilu Tutangis, where be they tell we about some of them findings, where them be they do, where then they go na up country them for sake of the coronavirus we they now with we. So now as since they round up now for left we na the studios, just tell we about some of waiting una find out in terms of security, in terms of people that way they left free turn and go upline. Wait till una find out.
It need a lot of improvement. because if the further you go up country, you see the security them, then where it mix with the ordinary people them, with the tax forces, then where they go up to the interior, they become more vigilant. Then they ask more questions. Then they even probe and search whether you're a government man, you're not a government man. Then they search for know if you get the pass or whether you they carry anything. So then one can say, but if you where they kind of fit on so. I tell you don't cross no more 38 where they can. I don't know that because of the volume of the traffic, they know they check better where they come. So down there a real challenge. I hope say the security bosses then they look into that they know they check better at all where they come towards Freetown. But where they go further than them place and they're more concerned, they're more serious, they can tend for check. One way I go, we would even talk to the local people then they suggest say for include the tax forces there. That means they for include the local people then for work with the security because then say they're not very sure about the commitment of some of the security people there. For some reason, now so then think and the bosses then get for the security forces, the bosses then get for find out why many people they not get much confidence in the way some of them security men they operate. Because even in the initial stages of this crisis, we see in some places and they where people then are quarantine. We see the security forces they way for enforce the quarantine. They not do as much as we expect them to do. We they say somebody don't escape quarantine. You know how somebody go escape quarantine? We want to security forces for make sure so when they enforce, make sure say that person they don't come out today. All of them things they make people then they doubt whether they're really serious about the work they do or not. So they really need to prove themselves. And then bosses they really need for prove themselves say themselves when they're in charge of what they do. Now some side and they will not get and correct it. And I hope say they will do better and more all try for get and correct because we really need for get and correct.
So in terms of the border crossing point, I'll bring you back we get the main border crossing point, the Balamuya and the others. But apart from that, they then get other bypass where some bike riders then can use because they're not they then check them too much. Now the main crossing point, they use other side for kind side. From an observation, security guards them don't they na them place them there for Monday for make people them know the kind side where they're not supposed to enter.
Yes, the efforts they not really improve on that one day. But even when you talk to the embassies, then they talk about supplies because they say if you take Sojaman, you pull out come out in base society, outside the work. You go say yes, then they give that man the one bag rice. But that one bag rice then they give and for outside for air and family. If you take a car and go on other deployments and bush on some side, now you're supposed to provide ration for them. So some of the challenges and some of the complaints that they give now that they not they give them the ration they're supposed to get so that they're able for stay and then place them there. And now they don't actually say they're not improve on that. We hope so they will do better even because we need them people then for men to go constantly there. Now they're remote, some of them are very remote places there where they day. And also we hope so with the social mobilization, we'll be able to get the community young man them, trusted young people then where the chiefs them go show we, so that one and they then go join hand with the security forces there, so that together they go able to man them borders and then their communities there, so that we'll make sure say we will limit movement between we two countries because yes we say we don't know about the increase, but the number within Guinea is very high, the number within Liberia is very high. So my all man they will say in the day. Moko all fet to you now and make sure say we'll get one day very soon we'll all get to zero as neighbors and as brothers and sisters.
Yes, we get some text messages them where we go on for it inside the program. This where I say so they say please waiting at the total number of people them in quarantine homes, number of deaths and total recoveries. This now from Commander Nalungi.
Coronavirus, they destroyed Salone and Salone in development. So we all need for put or join hand together for fetch this sick. It come out from Young Pine.
This one also they say who's this sick don't register the highest number of COVID-19 case them. Well, we not get any studio guests we go able for answer them question and they if you want to get more information we go advise say you go now the Ministry of Information and Facebook page and you go get the information in there.
Sir, how people then they pay for pass? Explain to us how, and also tendency this Okay, there's a tendency this gets for also the tendency this gets for Hamburg or destroy the fight against Corona. Somebody named John na Waterloo they send a message.
This one also they say thank you, Mr. Tutanges, for this program. Waiting on some of the proper planning them where you want to make the EOC do, because proper planning the prevents Boku problem. This one also they come out from Tijan Ali Kamara na my 91.
Good evening, Aaron. Civic education na the country not done they help the sick. The fight against Corona really need for standouts. Now we need more compliance. This will come out from Bawa again. Bawa Dina Kenema is send a message there.
This other one they say I want to understand if the EOC they subtract the total number of recoveries from confirmed positive cases them.
Do you have the big government for open the road for we the driver them as na so we the fen we living as na yaso we the fen we living na that's the person right and they come up from Blessed Text or somebody in Blessed Text and Hillcourt Road.
This other one they say IRN we need for brace we say for sensitize the public and the majority of the citizens them where they afraid for call 117 or go to hospital due to the pandemic from Aliuna Temu town.
I want to know if Corona can be transmitted from person to person through sexual intercourse or from cup where one person drink pan, and this will come up from Ali na Waterloo.
This why they say government need for involve teachers and lecturers na the fight against Corona in terms of sensitization.
Well, I think that's the message that we'll get. I just don't know which one Mr. Tutange will respond to. Okay, yes, you can go over.
This one they say plenty thank you for the good work way una they do. I hope say una will continue this program. This text are not saying a name. This one they say Mr. Tutange don't make explicit observation where I think say if we think about them good one it will help for make the sick no scatter na the country. This one they say the world don't condemn China them testing, we still they use the method for do testing. This one they say the security forces especially police for left for they take bribe na checkpoint them as this na serious issue where they spread the COVID-19 all over the country. Mr. Kalilu, why una not engage students them across the country for doing a community and regional sensitization as most people them can do?
Okay, last quiz this one. This one is say, Aaron, I want to know the primary signs of COVID-19 and how long it take for make a carrier begin exhibit the symptoms. That come from Muhammad A.B. Kanu na Hamilton community.
Okay, so we go allow Mr.
Well, Boku, we'll tell the text that then plenty thank you that they should say Boku people then get a lot of interest in this discussion when they get. And I want to tell say thank you for the very hard job when they do as journalists. Then. You know, just like I say, Wani, then some of them question and then they about me pay grade. What in me go say, I not accuse the security forces of taking bribes. And I not even say anybody they pay for the pass. What in me say is, I don't observe say some of the security measures then, even the way that they check people, the way they come in, especially they come into Freetown, a very lax, you know, as thorough as we expect say for day. We expect say therefore be very vigilant going forward. And what I also observe, I say from the beginning of this fight, we see in places where video come out, where some of them will be the man quarantine owns them, they're not been thorough. Without even though you're in places the way people that don't escape from quarantine. That one they should say people don't know they take their job seriously. People for take their job seriously if they do that. As for whether we go take students and for do the thing, well, that ain't not so we for do that. We as civic education, we go ahead and do we own sensitization. But what we say go work more. Now where the EOC go take the strategic document we don't put to them for do social mobilization. Because down there we don't put the roadmap and we don't put signpost them what they call a monitoring and evaluation framework. We're going for make we test whether they get it right or not they get it right. So we go We go take what we will call, we will take the feedback, we will put into feedback loop, waiting common from people then, where they say, okay, this one not the work for we, we're able to come back and change them. That's what a strategic document does. But for the go more, like I say, you hate no day, you go to the mini side, where you go bump your head and you come back and say, oh, that no work. That time they don't pass. This is a scientific approach for use strategy for make sure say we mobilize the people then and make sure say everybody could be part of this. We need social scientists then. We need people then where they join, because people then they talk about flattening the curve. What do you know about flattening the curve? Where people other side then they talk about flattening the curve, then they use scientific methods then they use data, then they use better information. All done then because they don't bring social scientists, they don't bring chemists, they don't bring boko scientists there on the table, around the table. Now that's social mobilization they do. So if I take 1, 2, 3 people they know and put them in a room because they send them go and send them come. This is not what this is about. This is a thorough process where if we get a strategic approach, we're going to put all disciplines there around the table, make all man participate. Then now when the scientists go tell you say, based on the data we'll get, ABCD will for correct time, we will go ahead and correct them and make them better. So now that's what we look forward to. Yes, we will continue to educate the people them by mass media, but when it comes to social mob, we need everybody on board. We need journalists then, we need data scientists then, we need social scientists then, we need communicators then, we need the ordinary man on the ground, the traditional leaders then, the Okada riders then, the market people then. We need a variety of people then for all come around the table, more make this one a national effort so that we will help ourselves, we'll help government for help we, so that we'll make sure say we deal with this COVID once and for all out of the country.
So finally, as you left we for go, how una they do for push make government or the EOC act upon them una report here so we una don't pull?
Well, we don't send a letter, we don't send a long letter to the interim chairman, coordinator, and no reply to it. We don't go ahead back. We don't do the strategic document. I say we don't work together with IGR. We don't work together with PASET. We don't do a strategic plan. We don't only do that. We don't do an activity plan. We don't send all things here. We will say by the time we don't come out this lockdown, we go look at them and respond to it. And we don't suggest a long list of institutions then where we say them for the part of this social mobilization now this country here. Because even for the Ebola time, most of the organizations then they've been dead. So we expect say they go take us serious, they go know say this is a national effort, they go call all the institutions, they will all for work together for make sure say we mobilize the country so that all country will team up behind them for help them for make sure say we deal with this matter once and for all.
So from the list of people that way you say let them work with now medical people, nurses and doctors.
No, and the nurses and doctors the association they, but also we talk about Paramount Tuesday, Council of Paramount Tuesday.
No, I just want to ask a question on the medical angle based on our findings them, because we don't get reports wherein medical people been done the stop for go na hospital for go treat people waiting on our observation with medical people with regards to the COVID-19.
Well, we don't make any observation on that one because that's at the clinical level. Because we talk about people there now, we go bring because you know what thing they do at the clinical level, what thing government they do, what thing they do, it's all very important. But the average Chilean foresee this as the young fight. Until we see everybody, the teachers then, everybody see this one as a young fight. They all put hands on deck for do whatever because all they say for what's hand. Now Salomon business, not a government what's hand for you.
So you una the sense collaboration not they enough?
That is the point. That is the point. We want make everybody get hands on deck and be a part of this, so that everybody, when something go wrong.
Why the lack of collaboration? What do you think, Senator?
Well, I don't know that. I don't know really why the lack of collaboration. But if you go around, if you talk to people that will be part of this, you will find out that they're not a part of this for now. So why they're not be part of that, we don't know. That is why they encourage the EOC for me to make everybody a part of this, so that everybody will sit around the table and be part of the decision, so that all will make individual effort and collective effort for make sure say will help our country get rid of it.
So before you left, we go finally. What's the impact?
Yeah, on the final one is because we really want to go
finally,
now.
The final
the impact on I don't create in the effect against.
We not able to test that for ourselves. But the partners that we don't work with, if you go talk to the people they need na Cambia, they will tell you say, okay, them and they, because of the collaboration with them between them, and so that happen. We're not able for praise yourself. We don't take out videos, and when I the first people that will put video out where they talk about the symptoms then and what thing for do. We don't know what's going to be the impact of that. People then go talk. This being sent back, we don't take another video out, and we don't continue to take videos there out and do other jingles there for educate people then. But that alone, nobody never work in silo. You never work by yourself. We work collectively as Hellenians and as Hellenian organizations then for make sure that we do this. So now our advocacy point is where they do social mobilization, make it include anybody and everybody we're supposed to play a role for make sure say we'll get rid of COVID in our country.
All right, that's Nabi Kalilu Tutanges, where now the chairman for the National Council for Civic Education. If they talk about how in council not the help for fight the coronavirus sick now the country. Well, remember say this na special program where na Corona Talk where they reach you from different radio stations them across the country. And the Sierra Leone Association of Journalists Large and the Independent Radio Network IRN come together for bringing this program to you as part of this large Corona Response Initiative. You self can join me, send a text message to the number 077-981-981. And me, now you presenter Wani Gauja and me co-presenter na
Musa Baisise. Well, as we carry on with the program, we don't get Emmanuel Ja na the studio. Him na the Service Marketing and Communications Manager for Maristopes, Sierra Leone. We can look inside well body business for woman and girl picking them we don't reach for born picking. Inside this corona fete, woman them can find them difficult for access health services. Mr. Emmanuel, good evening, welcome to the program.
Thank you very much, Chief Cisse.
All right, just in a brief, I know Maristopes not a kind of new name, but better still, it will be better we start with just a brief background of Maristopes, or better still what you want to really do about just in a nutshell, and then we go into the discussions proper.
Thank you very much again. Fambul, una good evening. Maristopes na social business organization where they work on well-body business.
You will for broke down this small social business organization.
Okay.
I really want to let me and cool understand.
Maristopes na this kind organization we wholly and solely they work on woman, girl picking and self-managed well-body business. And so we don't do in our salon for the past 34 years now. We they work on family planning, sexual reproductive health, laboratory services, antenatal and postnatal care, general medical services.
Well, allow some for go.
General medical services. I don't tap it for now. Over the years, yeah. We mission na picking by choice and not by chance. And we want to see a world who say every picking will be born. We all want forget that
picking by choice and not by chance. Just throw light on Nandi.
Well, picking by choice, now like when you don't sit down, here you partner, una don't plan. Say we want for born. We feel say now we need picking, want for welcome picking. It can be a casual partner, it can be say una don't married, any partner whatsoever. Una can plan say now, we think say we don't already forget picking now, for raise baby them. So that's not deliberate planning. The fact that you partner don't sit down and I don't plan and say, una for welcome picking them. Now that we call picking by choice. So una don't decide forget this picking also by choice. And not to like way you don't know, you not plan at all, you're not even ready for born picking. Then all of a sudden you get belly by chance. So that make we say we mission na picking by choice and not by chance. And over the last 34 years, now this we don't they work on with salon woman and girl picking them for help them make the decision. The time where they want for born, let them born by choice and not by chance.
Okay, as you there also for can talk about the reproductive health of woman and girl picking them during this crisis period. I want to take you back on how woman and girl picking them don't they suffer in terms of any crisis we can happen at the country.
Woman they don't they suffer always. We take them way back during the war, so take Ebola, so take the mudslides 2017, so take now to coronavirus. Woman picking them always vulnerable in all of them. Then disasters they are. So how? First of all, take a look at with salon community. Most of the breadwinners now women them. If you look around, most of the homes now women they take care of them picking them. So anytime a woman and her people are very, very much emotional. Anytime we get plaba na salon, either be it a man maker or a natural disaster, because of the biological makeup, then so emotional, then can afraid for venture out. Then can afraid we could cast the so that's a make. Then they will put food on the table for the pikin. How the pikin is so vulnerable? The pikin are not able to go school at all. That cold water where the pikin can go sell sometime after school, it's not able possible. Why? Because the woman, first of all, not able to defend themselves. You know, now people are almost always defenseless in terms of like for fed physically, they're not able to pick themselves, so defenseless. So most times, they can be either direct or indirect victims of all of them tears so I don't talk. And also, during war, they can even experience gender-based violence and sexual violence, and they rape them, then they force picking them into labor, where like they're not mature for do all anything, and mostly now we demand them surprisingly can perpetrate anything in this. So take for example Ebola term, where Ebola come. By the time Ebola they done 2014, 2015 to 2016, you don't get plenty girl picking away, don't experience belly teenage pregnancy. By the time school they open, then they will go school again. Even though government don't enact say now, belly girl picking for the go school, they don't get belly for the go school. But me and you to know say we culture. Because the shame go to party and go provoke you. Even the teacher them, you go to sleep in a class, the effect of pregnancy go to affect you, you're not able to pay attention. So this now some of the things which can affect woman and girl picking anytime we encounter problem.
So in terms of accessing medical facility, how that can affect woman and girl picking, especially belly woman them?
It affect them also like how they say lockdown so now. It's very, very difficult. If you not get past, you know they come out. Yeah? You're not able to come out at all. And so it affects them in terms of emergencies. This lockdown no means so many people belay, they don't due some go down 9 months for labor. So at times we can in our office we ask ourselves, what if this person going to labor now in case na serious case so like you're not able to take that chance for even deliver now, you not get held somebody around for deliver and not. So you find out say it will affect that belly woman. You find out say it will affect the unborn child within her belly, and then also it will affect even kumbra. Then when you na kumbra, you na suckling mother, you need always for the pay attention to you. Begin can go na health center to my stops because they do antenatal care as well, postnatal care. Then where you don't born. Antenatal care, we don't decide for taking with a scan, you belly so to make sure say the pikin they do well, yourself they do well, and later you deliver safely. But inside crisis, then TR will not able to deliver then services then. But however, my stops we don't work with government for still squeezing for make sure say, regardless of all the bottlenecks, we for still deliver service. We for be true to we woman and girl picking and self man they hold on the serve for the past 34 years.
Okay, so one of the reasons we make we get here so today now for talk about the reproductive health services for woman and girl picking during this COVID period. Before we can talk about the reproductive health services, explain to family what's in our reproductive health services.
Reproductive health services na well body business make a break and down as chief say reproductive health services na well body business we get for do with that side where God puts power for born picking. It be human now, you be woman now. So how for make that side like for we demand them, you know, na pennies, we get testicles and we get sperm and all for the woman woman and get vagina, you know, then get fallopian tube, then get ovary. Now that side, then part in the way I don't call so. A day power with body as man, a day power woman and body, and then side and they go put power okay puts together for born picking. And that makes them say that reproductive, then for you know for produce. So then the well body package you will get, but that side they how for make sure say then always well. Then reproductive science side and we go don't give it for born picking. It always for well. Then services then they because if they're not well, we need able born picking at all. So now that's now the reproductive health services or the well body for the part who they use for born picking.
So women them get access to them right now during this COVID-19.
Yes. The first lockdown inside March to April, we've been we been create services, the reproductive health services. We make it available to women, even though it be very much difficult. We first of all struggle for get pass, because pass for we vehicles them for the move around. We've been also like struggle for get plenty other things in place, but because we always want for be true to the salon woman and girl picking them for make sure that their reproductive health services, we always meet them. So anytime they need them, we make sure say we open with centers, even though people are not being get pass for access with centers. Because when they say lockdown, national lockdown, you get forget pass for move from one point to the other. We think of that, but we still say okay, few people will still will get pass. Or if emergency case happen now one area, the security then way they out, where they ensure this lockdown, then serve them go guess or yet. If somebody go into labor or any other thing, they go must get so yet say, now we go my so even though the person not get pass. So we bank on them chances then we open with centers. But we not been get too much the impact of the COVID-19, we not been get much because people are not being get pass. But few people be still able to make up, and we service them very well. We make sure say we give them quality sexual reproductive health services. Then we activate, we always get with 3535 line, hotline, we a free line on AfriCell, Orange, QCell, and Seratel. So before that lockdown they safe, and this why also we make sure so we popularize them so people can call, because some health issues, some reproductive health issues or family planning issues or general medical issues, malaria, typhoid, because we can do all that now. At times you just need some medical advice. You can call with Master Sabi Well Body Command and 3535 on them 4 line in the work also free. They can advise you. Sometimes you just need for sleep, drink boku water. You don't really need for going to clinic and all that. So we activate them. We make sure say always we put the staff in alert. Then they receive them call in this. So when they receive severe cases, if then they get calls on an emergency case, we safely intervene. We the send we motorcar and get pass.
So because I be want to ask if una can go meet the people them. Because if they're not able to come, una can go meet them and render services to them.
Exactly. Now that will be do last lockdown, and even this lockdown. The only difference now, we decide out of 9 clinics so we decide for just operate 1 clinic now. We na Ahmed Drive number 10A and B Ahmed Drive na Aberdeen Road. That first lockdown we be operate all 9 clinics so they all about the country. But this time around we just keep this one open.
Why?
The reason now that the other clinics not been get any patients at all, we not been get clients during that first lockdown, and it always costly on we parts because so open clinic for 1 hour they operate, particularly areas so I not get lights, like get Kabbalah, we get clinic they bow the lights not too steady, Kenima lights not steady. So most times the clinics they run on generator. We therefore keep them up. We they look forward for their clients and coming with 3535 number always available, but we not get at all that 3 days. We not been get people. So what we decide for do we package information in line with government. We package COVID-19 sensitization information and also some sexual reproductive health information. Send in our radio 2 jingles. We started to go to radio for participating in radio discussion programs and still sensitize people. And even though they not be able to access we clinics. So based on that, we decide now for operate.
So you be they talk just now, but how una can go and meet them and render services.
Mm-hmm.
So how una can do that?
So first of all, we like I tell you, with 3535 line, we always popularize them through social media, Facebook, WhatsApp, all the other social media. We popularize through radio jingles, through T-shirts. So people, we inform people in case of any emergency, you can call 3535. 3535, they ask you about your address and waiting at you. But if not minor issue, then they give you medical advice. We like you go wait something after lockdown now you come. We know will really harm your life. But if an emergency situation, then they refer out that call to the center, to the clinic staff. We get with drivers, the motorcar and standby always. So the clinic staff them, they alert the driver something and they collate. Now like 5 people don't call. Then they list the 5 people with their address and even their phone number because one forget them easily. So once they don't collate something like up to 10, Then the motor car go begin move now for go pick una up and cow them at the center. We then can a clinic, we they observe all the COVID-19 prevention rules, social distancing. We then go then they check the temperature and they wash their hand, make sure say we put them far from each other so in case of anything. Then also we staff them, we don't train them in COVID-19 response in such a way that in case then detect anybody where they show some symptoms of COVID-19, we don't prepare isolation rooms at our clinics. That moment we not get for drag you na do. We not get for stigmatize you. We they still respond to you. We put you in the isolation room. We don't they work with EOC, the 117 we call them. We don't get to understand. Say cases of suspected COVID-19. We they refer them to the because the government on side and we not to COVID-19 experts. So we just refer them the indignity and everything. The one anyway we know they suspect. We will treat them, give them family planning, as now that's my source always there for. We give them sexual reproductive health treatments, cervical cancer screening, laboratory tests, and all the others, and make sure say then go back. We will left them back safe.
So the day 1 and day 2 lockdown we get so when I don't get any report of woman and picking them or belly woman them we not able to get access to medical facility.
We don't get people from yesterday. We they don't contact we. Today we don't get people. We don't go now. We center na Ahmed Drive na Aberdeen Road. Yes. In fact, my colleague when they tell me say we get sometimes I say we get some severe case of bleeding. You know, where I think the person I don't know even a miscarriage or in all anything in the end they respond to a quick one. Now we clinic na Ahmed Drive na Aberdeen Road.
Okay, just quickly, Mr. Ja, una they foresee or like una they think like any possibility go they say will get an increase in rate in terms of pregnancies, especially for teenagers in the country?
Exactly. That's sadly enough therefore be one of the negative effects of COVID-19. And so waiting we don't do, we they expect that one day. We they expect that. So waiting we don't do. We recently try for partner with Ministry of Gender and Children's Affairs because they organize a school teaching program for picking them because in picking and sit down on house and then they go school and all that and where picking not get waiting they distract them. You need they study for exams, you need they study for tests. Don't clean they go school. No, by the time they can't retire. Then picking and the girl picking and the attention they go straight to my business, to mommy and daddy business. And so that's the lead to teenage pregnancy, that the lead to cases of sexually transmitted infections and all. So because we expect that within this COVID-19 period, we the partner now with Ministry of Gender and Children's Affairs in the school teaching program, we they design our jingles for them, for the woman and the girl picking them. Jingle on sexual reproductive health, jingle for help prevent teenage pregnancy, jingle where they educate them on menstrual hygiene and plenty other one there. So at the end of COVID-19, we will get the high number of teenage pregnancy or even high number of unwanted pregnancy. People were not to teenagers, now adults, but they're not ready yet to forget speaking. So, then once they're not ready to forget speaking, they no get that unwanted pregnancy. So, we did all over the media, through jingles, through radio discussion programs. We did work with teams, we outreach teams and upline at the different districts. Then they engage people on all that.
All right, continue for still to name now Emmanuel Ja in the Service Marketing and Communications Manager for Mary Stopes, Sierra Leone. Will they go about Lungera Wani Gauja?
All right, Fambul, we just get some information from Lunge, but the fight against COVID-19. For normal, we get on the line now from Lunge Dauda Chelnojalo, where they work for Galaxy Radio. Hello, good evening.
Yeah, good evening, and thanks for getting me online.
All right. So start for Terry first, but the situation in Lunge.
Well, Lunge, since yesterday, we look cool and calm, and people so far, according to the security apparatus, the local commander, and together other, of course, the RSLA, so far they say total compliance day. So far, for the people in Akafulum children and that of Lokama Sama, Utai, the area of coverage day. But though the police them say they monitor some intelligence we don't get, say, well, a group of market people, they want to go on the strike protest na Lunge, starting from Tagin onto the Lunge Tong. 3 communities where they highlight according to the local news commander, when as President Franklin Bauer. He said, but say through engagement and also the paramount chief of Kavulum Children, Honorable PC Basheba Shabagbe III, then we get for engage, call all the section children and other community elders them, and also names them. So far we come up, we then say they get that intelligence, say they want strike, regarding say they stop them for where they're not able to make them, then goose them for making them go to a free tongue. It says so because of that.
So waiting actually, you they get me? Waiting
get you loud and clear.
Protest for.
Well, according to the local news commander, so far intelligence with them together, they say they understand them together, say they feel aggrieved because they say they don't get them good stem with a perishable good stem, with them for them good at all. And say from Thursday, they not agree for make boats, for making them go then here, and also even the ferries where they go, not to everybody in the alarm for make it go. So because of this, then say most of them perishable goods are on point. It says so then they can't impose a lockdown when they just short notice to them. I say so then things say we not go down listen. Say now that means they won't go on the street. He say, but then they get for come and stop them, and that one not happen at all. He say now that make if you find out now Lunge, the past lockdown, you know, if you checkpoint them. But this lockdown, all the strategic place them, like the Freetown Airport Junction, then it's just one day, now the also now the Tadin, then it's just another one day, and Rotifung, when one of the populated area, then it's just one day. So but the people look cool and calm. They say not get any threat, they never hold anybody. Say he come on at it at all. They say, but the intelligence where they get in, I mean, type of work on them.
So how the police be address the situation there?
Well, the police I mean they forget community engagement. They engage stakeholders them, including the paramount chief on other stakeholders them for able to say how they go able to type or talk to the people them. And also type of the names, some of the names that will come up. According to them, they not disclose the names them. They say, but then get names that will come up among some attack bases, among other areas them where they see we start using together. And say so then we get for come and engage all the names and they for able engage. Say but it's not so in something where they if done, even if lockdown done, it say this is an intelligent we get for work on. So far for many people are not coming at it at all. If they feel like if they need for put then complete to the right channel.
I'll go back now the quarantine center now Lunge. They will seem forget some good news. Take we through.
Well, now the quarantine, as I say, Lunge, now the treatment, now the isolation treatment center where they get now Lunge, now the Lunge government hospital. According to the doctor, of course, Dr. Alusain Yila, it says so far they get 18 confirmed cases. Among them, only 10 people who don't recover. They say, of course, the previous day, they say let me get before the lockdown, then we get for discharge 1, and also yesterday when at the 3rd, then we discharge 5, and among the 5, then get 2 picking also let me get for discharge. And today, in which we have been present, when then we get for discharge, 4 where they also they recover. Well, among them, they get 3 women and 1 young man where they get for discharge. Well, in an interview, according to them, except of course the also satisfaction to the health personnel in Alunge, they say so far the treatment to them and things is satisfactory to them because after way they don't make that statement after they get for give them some items including sanitizer, for other food items and where they get for everybody get forget the package. Well, they get for loading at the van for making converter because they all day now free talk. They say somewhere around Freetown, where in the neighborhood disclose identity at all. But according to the CHO, will be the inside the treatment center. CHO careful. I say so many challenges there, and together with Nurse Awana to M Kamara, where in an interview, they tell me they say so far. I say authority them say still get for do something regarding what we talk about sanitization. It says say we then crowd the people in the treatment center. It say most of the people them for make them get the acceptance. They even say they get the sick despite not be show no signs and symptoms. It say but it say them then test them positive. It say but because of that they not be able to agree for accept at all. It says so it takes them some time before ever they able to talk to them for me and pin them down for me they accept it. Yes. Then get it sick and they get for accept this. And if only they accept them, all within they tell them they able to do an treatment center, then things they able to come back, they work about go back to their family. It says so with that, now able for many people able to recover back for making join back their family today. And then they express their happiness as they get for join their family today. So far now this didn't get for common now the Lunge government hospital outside them get for them a total of 10 people that will recover. And now the treatment center I text to you only 8 and on left today and all this stable according to the medical superintendent winner Dr. Alusan Yila. together with the team. You see,
So people are at the quarantine homes them, then they adhere to the preventive measures the way then well body people and tell them for do like social distancing.
Well, among the Lunga don't get much quarantine. You say not only one home would get quarantine. Now one person more they say get quarantine. You see, most of them cases all come out from Freetown, other areas they wouldn't come out. Not to say in a case them within around the community at all. According to the medical superintendent, Dr. Alusainila. So far, now that's the for response to me. But he say more education need to be done for make people no say this day for make in this country for make people come on here.
So with regards the day 1 and day 2 lockdown, people then they comply.
People they comply, but the only surprise thing last night we happened. We come this morning, this afternoon we come to the surprise of everybody. After we see a group of the Electricity Distribution Authority, we na EDSA. Lunge as I said in my early report yesterday, say Lunge they in total darkness not get electricity at all. So, but people are still surprised this morning when they wake up and say, well, the transformer and said, I don't know if you checked them, where they go pull the breakers them. One of the children headquarters town in Amayara. As I said to you, they don't feature 2 of them breakers them. Of course, even therefore confirmed to the engineer head of EDSA, engineer winner, engineer Salu. He said this is a disappointment to Ram. According to Ram, he said he expected since and lockdown and coffee day, things say them can't to be happen again. He said on another attempt also happened at Ruema, of course, that the highway to the Chagrin. He said himself, but the community people be very vigilant for able to change them people any. Well, according to the local people, so far when we get for engagement of the authority, he said so far they said the people then they afraid for come out because and things are coughing there, even they reach some sound, they're not gonna come out because they think say no more the security apparatus, therefore they in charge. So far with coffee day and lockdown. So then I surprised the initiative way make so many people in Alungi say no go down with them. Except the water business somewhere because most people in Alungi rely on boreholes. Why they say from one people only go for get water. But Lunge look quiet.
We'll say we get kind of mixed news now. Lunge, the good one, and that's way not too good. We will say.
Yeah, some good news say because people they comply, but the bad news is that people don't get the electricity, and of course, even some OSM complained this morning at the Lunge police station. Say of course some people they go for them jump for go 50 people for go take them. So they didn't say supply because Lunge now once I am they come for in food now people at home stem, but now some people don't pass long term now. At time of this where coffee day and lockdown day, they're not expecting kind of come for happen at all. So it becomes so surprise so many people.
The police they in charge of that situation they now then they do what they're supposed for do.
Well, the police say then they're in charge and then they say do their work. The only police what is concerned is engagement because they're the military. But the only thing police always a kind of logistic and also staffing. They're not going to do all side and allow the community. But this time around the community they're not going to take responsibility because they don't get demanded for me and come on if anything do because not coffee.
Thank you, Lauda. Well, in a Dauda channel, Jalop the reports for we from Lunge in the work for Radio Galaxy na Lunge Day. The program you listen to now special program we call Corona Talk where they reach you from different radio stations them across the country. Now the Sierra Leone Association of Journalists / and the Independent Radio Network IRN, they bring this program come to you as part of / Corona Response Initiative. You can join this program at the voice. The number now 077-981-981 077-981-981. Mina Musa by Sise.
And Mina Wanigauja. As we be the talk earlier on, we be get Emmanuel Ja, now we missed. We are the Service Marketing and Communications Manager for Maristo Sierra Leone. We can tell we but well body business during this COVID-19 and self how COVID-19 don't they affect the work. So now we can talk about how COVID-19 don't they affect the work.
Okay. Thank you again, Madam Gauja. So, COVID-19 don't severely affect the work. Plenty side and all about the country. First, we service delivery approach. Now, through what we call 3 channels. The number 1 channel and the center channel. That's now the 9 clinics that will get all about the country. And then the second channel and the outreach channel. That we get 14 mobile outreach teams where they give service to we woman and girl picking them and then villages them because we 9 clinics all about the country, then static. Then the mobile clinics, then they move from village to village for make sure say we give Salone people them, Salone woman and girl picking them sexual reproductive health services, family planning, general medical health services, even at the last village. And then the third channel, now the public sector strengthening channel. Then at the channel, that's where we work with government hospital and then villages. We get about 117 government hospitals right now with the support. We don't train 2 staff them each per one of the hospital and they now the rural communities. Then staff and they work now with government well body workman and then clinic and we they monitor them for service people in then rural communities. So then 3 channels we are called so we now through which we they serve Salone woman and girl picking them all them get affected because of this COVID-19. How? Now we mobile clinics, the 14 mobile clinics where they go now them villages them for go serve people with family planning and sexual reproductive health services. Now they don't encounter beaucoup challenges where they go to them villages and for serve people and they run away from with teams them now.
Why?
Yes, then the talk say we want go for go infect them with coronavirus because we na health organization. You know, then they run away. Even when we try for sensitizing our radio jingles and radio discussions.
What do you make you think say they get that kind of thinking they say like when they can do them more bad than good?
Well, you know, we feel say information on COVID-19 sensitization not something really good done well it for let people understand how waiting at this COVID-19, how they catch people and all that. And because we na health service provider, so and this na well body business, so then we just feel say they why so Lord we not trust them. So tell you they don't cancel, they don't go bring that virus there for can make. And also, we staff themselves, you know, they work in our communities. We staff themselves can get that fear small, particularly what don't they experience over the last 1-2 weeks, where we get now community transmission, not to that transmission where people travel out there, they then put in a quarantine and later we then test them. They can't show say they get the virus, but we don't get now transmission outside quarantine places. So we staff themselves can get that fear small, but in natural. But the one thing where we staff them, they're always ready for serve Salone woman and girl picking them with the best sexual reproductive services and also general medical services right across the country. So that are some of the challenges we don't get, but we know say at the end of the day we Maristopes, the media, the government, we all get for defeat COVID-19 and we will go back to normal. Also we go service Salone woman and girl picking with all we good work as we don't do for the last.
So when I don't tap first for the give family planning.
We still give family planning now. We center. We operate inside this total lockdown. Now Ahmed Drive, now Aberdeen Road. Family planning services still available for the one that we will go there. Sexual reproductive health services still available. General medical health services still available. Malaria, typhoid, laboratory tests, all that still available now with Aberdeen Road Clinic. Ahmed Drive.
All right, plenty. Thank you for where you help create this program. So today, in name na Emmanuel Ja, in the service marketing and communications manager for Maristopes Sierra Leone. Plenty. Thank you. Now we go for a short break and we'll come back and continue the program.
When I say which man with you, now for look under you foot. Where I don't suck up for you, don't clean you, ask why me I get. If us not sell you, treat not go buy you. No put you up and trust, but mortal man he go fail you. Mortal man no guarantee. Mortal man no guarantee. Mortal man they lie. Mortal man they fail you. Mortal man go talk when you not talk. Mortal man no guarantee. We no guarantee at all lot. We no guarantee one. Mortal man. Mortal man sabi well for make him better. Mortal man go kill him complete for better. They go make you suffer. They go make you stress. They go sit down a corner love you where you get money. Hey, mortal man, we just take for money. No put it up and trust for mortal man, he go fail. Mortal man no guarantee. Mortal man no guarantee. Mortal man they lie. Mortal man they fail you. Mortal man go talk when you not talk. Mortal man no guarantee. We no guarantee, we get them from Bule overseas with you above. Catch you feather. Good land. Mortal man.
Your favorite rapper.
Masterel on the beat.
Hey yo, we cruise, now we the mark inside. Red flag, the team will stay on top. We not afraid them, God no say, now they afraid we. Swear to Allah, they're afraid we. The fans said we fans the hell we. From the east to the west and the hell we. Cruise, now we the mark inside. Red flag, the team will stay on top. We not afraid them, God no say, now they afraid we. Swear to Allah, they're afraid we. The fans said we fans the hell we. From the east to the west and the hell we. I hit fair, cause I hit for repeat myself. So sick, doctor, no even able man myself. I'm too hot, in the zone like them hell. From Texas to MD, you know the boy. Well, I'm on my camouflage. Not cross the borderline. I can buy an Rolex if you need more time. See how the sun one APC? You show me hard, someone don't push me. 27 months at the feds kiss. The red flag belts I use for beats kiss. Not like you don't like you owe me. Tortoise niggas are too slow for me. Let's see this why you too like LA. You don't put no say I'm a small brother. Now my walk was squeezed for the trigger. Roll up in to welcome the Ruger.
I go by the name of RC Code Fire. JMG Soldier. Eastern Arizona president in the building. Banga tune. Gunshot fight. Leonos, under the beat. Pull up the in these sights of God, every man is equal. Whether you be spiritual or you be so casual. Don't look no one you coming because things not normal. God can bless anyone. So, don't judge me, don't judge me, don't judge me. Say when you don't know me, don't know me, don't know me. Don't judge me. Say when you don't know me. So, don't judge me, don't judge me, don't judge me. Say when you don't know me, don't know me, don't know me. Don't judge me. Say when you don't know me. Judge not, that he may not be judged. Don't judge me, anything you see I do, just leave me. You don't know me, but anything I do, you they hate on me. Forget about me, do your thing, make you balance me. Now they think for me, same God will make you, now he make me. Now they think for me, the same God will make you, now he make me. So don't judge me, so, don't judge me, don't judge me, don't judge me. Say when you don't know me, don't know me, don't know me. Don't judge me. Say when you don't know me. So, don't judge me.
Young Lee on the beats.
Oh na. See na act mannequin. Yeah, man. Something they happen in this net. Between me and you to this net. Baby girl, you know me interest. So let the guardian angel witness. Where they bless you with me sweetness. Oh yeah. Turn your light down low. Turn your light down low. Baby, turn your light down low. So baby, come on, keep it on the low. Yeah. Anything for you, anything for you. I go do anything for you, anything for you, my baby. Tell me what you need to feel. Look inside there, tell me what you need to see. Tell me what you need to feel. Look Radio Network, IRN. Don't team up king for Gud Mornin Salone and development. Brother, sister, mama, papa,
well, Fumble, who's still there, and make we stand by you now music from big salon musician them. We come together under one project we then call Project One Mic. Well, the three big musicians them behind these projects now Emmanuel Rogers, aka Article Foyo, president for Eastern Artist Union. We also get Alhaji Amadou Ba, aka King Boss L. Chila, not sure in anybody entitled now. They put some exactly. So, you know, the CEO of Red Flag Music, and Seth, we get Abdul Razak Kanu, aka Akman, CEO of Akman Music. Get the music, we'll come back and talk to you.
One of our beautiful mothers in Sierra Leone and East End Artist Union in support of the fight against coronavirus by the government of Sierra Leone. Coronavirus is real. The world is getting body. Coronavirus is spreading fastly. No vaccine and the virus is very deadly. It's a serious time, see people are dying.
Right, so if you still join, we listen to the program. We have a special program with Sludge and Aaron. They come with together in association of Sludge in association of Aaron. We are the Independent Radio Network. We are the initiative for Sludge response for the COVID-19 winner Corona. Remember, say you get a chance for the voice on this program. If you didn't host any side you there, send me a text message to 077-981-981, 077-981-981. Or better still, go na Radio Democracy Facebook page and drop your comments there. Like we say, we get them big allegiance there. Me na Musa Bryce say,
and me na Waniga Uja. As we say earlier on, we get Boss LJ, we na the CEO for Red Flag Music. We then serve there so for can help we for talk about them Project One Mic. Well, I want to take Boss LA first. What's in this project debut?
Well, first of all, I want to say good evening, Free Times Sierra Leone as a whole. The One Mic, basically, it's based on we as celebrities. This is just a little section of, if I can say, as we as musicians. One Mic, a campaign way full of each and every stars, crowd pullers, celebrities, like, for example, footballers, musicians, movie stars. This goes on and on and on. And this is it's a campaign of us as, celebrities helping the government of Sierra Leone to fight COVID-19 and being part of, as far as the people in at the front line, where they risk their life and make sure say advocate on sensitizing the citizens of this country about taking precautions and very seriously. And let them understand how much this corona don't affect we as musicians, the country economy, the country as a whole, each and every trader, you name it, the kids where they go to school, the doctors, the bank owners, for me, we take this thing very serious because at this point, if we look at the cases, the more we get, we want to try hard for make sure so we cases not go beyond as it is right now. So we decided for come as one, this whole project for make sure say we're able to play a role inside this whole corona time, this pandemic, help the government. The government they send message to the people, but we want to be the messengers to the people and for make them get the message very clearly and let them understand because so many people, not all man get radio in their house, not all man get television, not all man they even understand when you talk. But I best believe if we begin use names and faces of this country, we get followers and sensitizing each and every fan out there or Sierra Leonean them, people will be able to understand, they will be able to cut down on the numbers that they get, and we will make it easy too for the government and also for we all for understand how much this thing is very serious. So
basically what bring about this initiative?
This initiative pretty much is about helping the government, stepping up, not just about we go into stadiums and studios and doing shows, selling CDs, and entertaining people. This is a sad time. I believe say it could be very unfair to we fans them and Sierra Leoneans as a whole for make we see them they make like say not so they can die for we time like this so for able for talk, stand up for make them understand because there's a man out there will love Akman so much. All the time you understand and you can see Akman they talk about how much this is real, how much people take precautions are very seriously. That one man they will love, we will love Akman go able to understand say yes, the possible like don't can talk to me for take him very seriously. So I make we come as a one me for your Akman and we get other celebrities in two way they on board. We just happen to say we are the three frontliners that we can so today for start this project and help the government for make sure say yes we're able to fight this battle as a whole country.
So now through music number una they use for able for pass on messages so una get.
Well, we're not just to use music. We use an outreach. We use a way of going outside and day, going at the neighborhoods, them go at the suburbs, them going at the slums, go up the hills, the mountains, them go down outside the Ogden, the boats, then they go outside Motokada and all they go outside Okada and all they go outside and Motalman they go for make sure say people the way they able to understand say yes this time a star come, this time messenger come, this time man we come outside radio no they reach. This time man we outside television or they reach. This time man we outside newspaper or they reach. So in this all, it's about outreach. We going out there to the people and at the neighborhood them, just sensitizing them, let them know, take your precautions and very seriously, social distancing, cover your nose, of course, wash your hand all the time. If we not do them for the government, let we do them as a citizen, then we're ready for the part of people that we help for save lives.
So now who specific side them so we una don't go in terms of going to places and sensitize people them on COVID-19?
Well, the COVID-19 team from the EOC, Cockrell been given the opportunity to start the job yesterday, which I believe will be done start from all the way from the Ogo farm, Usa say people are very congested. We don't start the campaign from there. And today, as you shall see, we call all the way game at Duazak. We're there at Duazak area right now. And we're ready for continue to go inside Kainlao, to go at the border of Sierra Leone to Guinea to Liberia, just to make sure say each and every Sierra Leonean able for see and understand. Like I said early, not to all man get radio, not to all man get television, not to all man they able to read newspaper. But if we they go to them, and then neighborhoods there, so we're not to just the main streets them, advocates, tell them what's in this thing they about, tell them what's in for do, tell them what's in for do, enter inside the neighborhoods there, so waka, door to door, field to field, outside people in the gather, make them know say not to play so together anymore until we come back to our normal life. So pretty much we na the megaphone then where they go inside the neighborhoods there, so and if God agree, he give you the time, we can able go to inside like in the corner.
All right, so my name na Alhaji Amadou Ba, aka King Boss LJ, and they are together with two other brothers. Them they talk about Project One Mic, we na the own way for help fight the COVID-19 way they na the country. Now, I'll go to you another Alhaji way they represent the one Project One Mic, and to you Emmanuel Roger, aka article for your press for the Eastern Artists Union. So, how many celebrities? Where King Boss LB talk about celebrities coming together for form this Project One Mic thing. How many celebrities are we talking about, and how will come for like select them celebrities there?
One thing, this not to thing we understand, and until we take upon ourselves as stars them, you understand, for see how best we they come in, because you remember say from the very first day we the president released a statement say people know for the get again above 100, automatically the very first sector we get affected, now the entertainment sector. So we don't look at and say, now we own duty this now. We not just need for left everything to government. Because now the people who they suffer pass all right now. As a journalist, you're working at the end of the month, you will most expect your salary. You understand? Think of the shows that we play April. In a time, then we don't book we for some shows them. Money no be don't coincide. So total April winner and the worst of the whole thing. Now one of the entertainment month, you know, so we get two entertainment months now the whole year. We get April, we get December, and now one of the entertainment month then this coronavirus can destroy for we. You know what I mean? So for that reason, we decide for come upon ourselves as entertainers and see how best we work towards the government. Because una my they are talk to people, talk to people. You understand? People go to listen. But if you hear say LJ don't can they talk to people, oh, me a fan of LJ, you go listen and go adhere to it. LJ they say same to Akman, same to Foyo. So because of that reason, make we decide for coming and talk to everyone. And this not to just with three, not to involve a whole lot of musicians there in the country. So it's not actually easy for we. So upon that reason, let me could decide for calm, for let's just fight this thing together.
So how best you don't able for reach out to the fans them where you get
from the very first lockdown, personally as a president, you know, say at the rule a whole union at the East way, like govern all the artists that we the Eastern. You know, personally we don't see our best we they work on do some sensitization stuff. You know, we don't do a song, don't check out to major radio stations them at the Eastern parts, you understand? So personally we don't do them and we still do them. You know, we don't move in different communities them, talk to people them. We know that some people in cry, some people say no get face mask, some people say no get Veronica buckets, all anything, and they decide for bring the news back to the government and say this community people need them in there. You understand? And so we they do man, we they try for see our best, we go combat this whole thing. Let we all just move with life normal.
How people can respond to una way una they go to them for sensitize them?
It's not actually easy because you know say we are popular faces. You understand? Imagine you say with everybody they will rush up to begin preach to them for maintain social distance. Later me say Corona day, Corona is real, Corona they kill. Let we just do all within the well body people and say we for do by wash we hand them. Many say we issue Veronica bucket, not tire for wash your hand. They always use your hand sanitizer. They do every other thing. And if you get any symptom like you feel feverish, you know, you get difficult breathing, you cough, for your safety, take your phone and call. Say I know they feel too good. Then they can attend to you. If you're not waiting, automatically you need waiting. So this thing we really need to take them very serious because they really they unblock the whole country.
So una way they go down to community level for meet them people here. So what are some of the findings them where una fair not from waiting they go on na them community then they?
Actually because most like the communities that don't go we know the property not day enough people them for the use for get like the precaution done. Like them water for washing. You understand? Then people then they cry for them and they then face mask. People will not get some of them thing and they you understand. The people then back don't fed up because once we meet the ask in any community, I say if salon go be normal, if you say them for lock you now like I do now you so now. But because this thing don't disturb every other thing, we all need for fight together and waiting. And who back they use the same chance now, starts them for link up to the EOS they work with. You understand? Tell you say this community they need this whole thing. You know, with that one day I believe so we try for best to combat this whole disease.
All right, in name na Emmanuel Rogers, aka Article 4, the president for the Eastern Artists Union. They're all there, and you talk about the project One Mic. Now the young way down there for fight against the COVID-19. Well, we also get Abdul Razak Kanu, aka Akman. We can call him Mr. Woro. Mr. Woro, welcome back. And let's look at the language. Yeah, let's look at the language you know they use for personal message, and then the messages them exactly not can pass.
Okay, so basically, like today, as my brothers them say, we happen for reaching a certain communities them, like the Kurube community, the Duaza community, we face them two communities in today, and we continue for talk to them, for do within the medical people them say. You know, the master sabi people them say. Obviously, the message is on the go out say, of course, if you wash your hand frequently, if you use hand sanitizer, you know, the social distancing and the face mask, you know, so for the apply and let we not forget again how we for the enter inside transport. You know, we not for over crowd again. So because the thing so challenging is that some people, you know, they even overload then transport them. They even overload and transport. But as long as everybody want go, you will remain silent inside it. So we tell them, say, not accept that one day. Taxi, na 2 bien, one before. If the driver want take extra person, now you right, absolute right for tell them, say, no add other person inside now. Keke, na 2 bien. If you want take one, no accept them. Tell them. So we don't go on. Now the different communities them they pass on them messages in there. I'll tell you, my brother, people in there will not even know that one day. You know?
Or any side when they go, almost they meet the message, just they go there as people them way not people and they follow, so that's not they go reaffirm their faith also.
Yeah, of course, yes, people them already aware of waiting they happen. But in those slums, those community places, you know, even though then they're aware of waiting they happen, you know, then still they do the wrong thing. You know, it quite challenging. Like you go feign yourself and then kind side and then you go see usai, you know, people in crowd.
Who's kind of way una use of personal messages? Is it that kind serious message una get some amount of entertaining way just so that I mean how una can pass on?
Well, of course, definitely. Once we God bless you with, as long as we appear in a certain place there, especially in communities and then slums communities and there, we find that then people in they dance to music them. You know, then they go with shows them. So always they want for CV. You know, so as long as we appear in the communities and there, then the higa, you know, that anxiety they in them for CV. So first of all,
yes.
As we reach the first thing first, where we the preach first before we go there. We want for talk to una, but please let we maintain social distancing.
I know say like anytime I appear like how I think article mentioned.
Exactly.
You know, the fans get
so now the first thing they will preach to them. There, let we maintain the first before we ever can talk to una.
Okay.
You know, so we'll try for see how we maintain that one day, and then we pass on we messages them to them. You know, so that we don't do all along, and we keep on going. As my brother say, side and day, we read, you know, the rich, we television, not the rich. So man, still, you know, get challenge of for light business and all them stuff then day. So where we reach the, usai Okada need the rich, usai taxi need the rich, where we reach the, of course, the message, will they push them. You know, so now that's what they do all along.
Abdul Razak Kanuna name, aka Akman, and that comes to you, Alhaji Amadou Ba, aka King Boss LG. So, now we look at this we want to pass the message like how I mean this Akman don't explain so, but also we look at I mean the side when they go the kind of people in the welcome una whether una they go to chief them or maybe even if they notice them first say with the council so area so time or you just boss pan them how una can do.
Well, basically, to be honest with you, as far as number one, the Ramadan, and also we have in a lockdown, and we have Corona, also where it take place, so it's too stressful. So we have everything at the same time. So mostly walking, reach certain neighborhoods, you find out say all man just sit down, this gone, they look far. So either you get somebody who at the fast, or you get somebody who at the lockdown, or you get somebody who at the Corona. But everybody just looks sad. So we find them as a blessing because when we pull up in any neighborhoods, we give them joy in the first place. We light up the whole area. We make them feel like, wow, okay, at this time we on for the night. I just see a legit. I just
send for them small thing.
Right. Well, yeah. The best thing right now we will send for Motaman, and the thing for able to make sure say get well body. You know, even if we get how many millions. Or for no pass that message for making
also get the one that can say me hungry, I know it is for listening. In fact, I don't get appetite for listening because I'm hungry and kind of stuff. When I face that, they don't experience.
Well, we don't face them yet.
Okay, well that's very
good. To be honest with you, it's like everybody who they go to, them they don't get the message, but they want to say the messengers them. So having us going over there, outreach to them, like they see we saw, they see, they would explain to them. And they give them the reality, say, yes, this is not legit, this lockdown. If I've been there, I host, they watch TV like with your family. But he left all, he kind of also to eat, don't yap at this poto all. So this is something we're very, very serious. So it's a blessing having all people who come out and put that smile on their face, but at the same time, again, the most powerful thing about the job is to let them understand the message about how them for save their own life force, how them for take precautions. I mean, anytime we reach, we'll not say we're not going to stop that moment, that 1 2 minutes, maybe not can't away. But as we begin to talk with them, make sure say we push them far away, let them understand what's that mean of social distancing first, that we educate them about the corona, make them understand what's them for do precautions, the wash your hand, cover your face, your nose and everything. And also, if you feel any, because in life you have to give somebody the confidence. Some people, they feel some type of way at home, but not even understand how to go about them. So somebody will say, hey, my body the heart, go take one Panadol. No. If you feel you ate the heart, your body the heart, you get problem why you breathe, you get sore throats, you cough, you feel weak, you bone in the heart. There's a number we can call when a 117. No shame, no shame. It's for your own self, you and the entire neighborhood, your family. Call 117. It can be saying normally that you get or normal one body gets, then give you medicine. You free your mind, you come back in the house. If you know to the back, there is doctors. When you get corona, no means say you they die. Corona not seeing where the cure. It's all about the mind and how you able for communicate them to the people them. Exactly. So if you know say you feel any kind of way where you in a house, no shame, no afraid. What you do and self, you become the best person at the country. Sure. Because at the end of the day, you don't come out and show say, me a man way. If I feel this way, self, when I can't hold me, when I check me, if I get her, if I not get her, when I left me, if I get her, when I hold me, when I take it to me. You understand? So 117 are the number for anybody where they feel feverish, they get problem with where they breathe, they feel it joint them. You understand? Call this number and we can pick you up quietly. They will not go see you, they will not go understand. And the one key to I want to emphasize on, nobody not for shame for call 117. All man for feeling proud. If you know say you feel any symptoms there, so you get them, call them. They can pick you up in your house, then go and take you, then save you and your whole family life. You understand? Social distancing are the key to this. This is the airborne disease. So we got to make sure say we stay away from ourselves. I know say you like your girlfriend. I know say you like your boyfriend. I know say you like your auntie, your party, your neighbor them. Let we stay away from all that. It's a lockdown. Lockdown and for make sure say we able to understand and get control of what's in the going on the country. So we as celebrities we not go tire for cancer owner. And we serve the big owner. As with the cancer owner, we talk to owner self go to help you for the listing, they understand and apply to owner self. So we say we don't come out, we not go there back again. We will continue for make sure say we help the government for the cut down the numbers that they get every day and make sure say the government self every resources where they put by anything about this whole coronavirus, they go to the point where they see a very good result. Mind you, I did a radio station today for the dinner house. I come for the dinner house. All man for the dinner house. If we know with the interview we show, we will decide for them for the millions of people that are out there. Please, coronavirus, it's real. It kill. Western world people are able to control it. We should be very, very happy and lucky with number day to this radio show. How number of for parcel of we take all precautions and very, very right. Apply to ourselves and help ourselves as brothers and sisters. Mind the way His Excellency say, this is not a battle for just in cabinets. This is a battle for entire Sierra Leone. This it don't come and come. If we not take it serious, we all go fall at the drain.
All right, na Alhaji Amadou Ba, in popular name na King Boss LHA. And just quickly, we'll go on for take the song really for the Project One mic. But just quickly, Prezo, for your, I mean, this Project One mic, and just celebrities within Freetown, and even when our projects and just around Freetown, or any plans for up country?
No, we actually get plan to take this whole thing, not the whole country. You understand? Because we get fans them all over the country. So because of that reason, we not just go limit unto Freetown. But you know what I mean? But you know, say Freetown is the capital and anything we get for starter. But on a project we get plan for take them throughout the whole country, make sure say people understand. You know what I mean? Go to major radio station at the different districts, we tell people them the dangers of this coronavirus, how we don't boil every other thing, how we don't put everybody behind. Anytime we all just come together, swan and try to fight.
So I wanna plan for go about especially where una they go na the upline part them. Una get any strategic plans where una don't put in place where not native people them una get for go meet.
Yeah, we don't arrange all anything.
So waiting at the plans.
And one thing, as we call this one project, one mic. You know what I mean? Okay, assuming we go na Makeni, the very first people we contact na the Makeni artist union because we are artists and at them base. So with them easily the job they easy for we. You understand? We go na bottom with the contact with the Bo artist union. We say we don't come out from Freetown at this time the project. So I know waka. Then they know how to communicate to the people more than we.
Exactly.
You understand? We go to the Poloko and the same thing. We go to Cambia, whatever place we go, the people more they communicate. It's like a journalist. Any side you go fair you come in journalism. Waiting. So we go as artists, we bring the talk to and say, okay, now this we up to, now this we up to. We all on account board, no answer best number they go follow we pass on the information. You know what I mean? So that cable communicating different languages we can do them for the betterment of we all. But all let's I know say this particular coronavirus has nothing to do with politics. It's not political. It has nothing to do with religion. It has nothing to do with tribe. It has nothing to do with any other thing. Let we all just come together. We fight together, Swan, for combat this disease.
All right, technician, if you're ready, in him now, Emmanuel Rogers, aka Article 4, you're the president for the Eastern Artists Union. And there, they talk about Project One Mic. Technician, if you're ready, look at the song for this project. Project One.
One of our beautiful mothers in Sierra Leone and East End Artists Union in support of the fight against coronavirus by the government of Sierra Leone. Coronavirus is real. All these getting body. Coronavirus is spreading fastly. No vaccine and the virus is very deadly. It's a serious time, see people are dying. Nations are getting madly.
Let's come together and fight this battle. We got to do all we have to for the sake of our lives. And we all must alone.
The world is getting body. Coronavirus is spreading fastly. No vaccine and the virus is very deadly. It's a serious time, see people are dying. Nations are getting badly.
I don't know what the world is turning to. Things are getting back to us every day. So you got to be conscious. Coronavirus is around us right now.
Listen, take this message and carry on to all the people. Corona deadly, any danger for the people. And if we get some for men, it no go simple. Let we caution, not to for only put what an akit.
Say it's a precaution. That go save this nation. Oh, why? What you on? Put the mask on your face. I beg no shake me hand. No can give me credit. I scooby doo be Jelly mama, mama. Coronavirus too deadly. In medicine, no, they no pharmacy. So we get what take them to seriously.
The world is getting body. Coronavirus is spreading fastly. No vaccine and the virus is very deadly. It's a serious time, see people are dying. Nations are getting badly.
Let's come together and fight this battle. We got to do all we have to for the sake of our lives. And we all must alone. You see, every day and every night, so many news they unfold. So many things about this deadly virus don't keep we on hold. Oh, aye. So anything I tell you for do, brother, don't you deny.
Yeah, play by the rules, you know.
It's with this virus they kill you, sister, don't you deny.
See that? COVID-19 they kill, so we better take them serious. This virus put we up on chaos, so be conscious. The posters see America, UK, and the world so vulnerable, not stable. Make them Chinese declare, say they're not able.
Say we no want no corona, now we land. We no want no corona, now we land. We no want corona go affect we education, we economy, and we population.
Say be conscious, me brothers and sisters. This still called corona, me tell you very dangerous. Always wash you one with soap and water. Use this sanitizer for you healthy one. Hey. Fellow civilians, this is our favorite rapper, King Boss, LJ. What His Excellency President Bioga for state so y'all precaution, no state of emergency. That's we go past we all in Mornin Salone. We will just follow the rules. By to within the country want to make we do for we own health. We want safekeeping, safety. Yo, once again, what I begin. LJ, Coronavirus getting body. Coronavirus is spreading fastly. No vaccine and the virus is very deadly. It's a serious time, see people are dying. Nations are getting badly.
Let's come together and fight this battle. We got to do all we have to for the sake of our lives. And we all
don't underrate, Corona is dangerous.
So dangerous,
and it's a difficult time. The world is in trouble. Yeah, therefore take your precaution from health and sanitation. And I wash you hand with soap. No go so crowded. Avoid the things and when government say you know for you.
So tell the family, tell you neighbor, go on and not despair. Now for they take precautions, not make like you not care. Say aliens, let's be focused, conscious about this virus. What this world is getting to, dear God, save us.
Alright, welcome back. It's still into this special program we call Corona Talk, where they reach you from different radio stations them across the country. Don't forget to say this now, the Sierra Leone Association of Journalists / and the Independent Radio Network (IRN) come together for bring this program to you as part of the / Corona Response Initiative. And we're still in the studios, Mina Musa by Sise.
To get them, then go respond to them.
Well, this first one I say hello IRN / na good initiative them where the artists their account so kudos to them from Ariel na Taylor Street na Wellington.
This one they say if na 14 days they make the virus done, make government declare we want to go back to work and we normalize them.
I'm so glad for hearing the voice of we artists them. Mad love and respect to una all. It come up from a text and Safroko Chiefdom.
This one also they say waiting we celebrity them observe during the lockdown.
As renowned artists, musician them, we like the initiative we una take for sensitize but una fans them for allow una for do social distancing. Social distancing regulation, they come up from Tijan Ali Kamara na mile 91.
So we celebrate them. We want to know if people them they comply with the preventive measures them where well body workman them can tell them for do.
If we want to win this fight, we need for first accept say this sick real from James B. Well, you know text society in text from.
This other one they say whose mechanism government don't put in place for food facility and provision for sustained cities in them. This they come up from Young Pineapple.
Plenty thank you to we salon artists them. Una don't show say una patriotic even though this sick yeah and bug una business. Una still the battle government for the fight against COVID-19. Now, so Salone for P, they come up from RFM fan.
This one they say plenty thank you to the salon musician them for them personal sensitization where then don't they do.
LHA Ackman article for you una make her feel good as una they work for the interest of the country. God go make we succeed from Musa na both city.
This is why they say IRN and Sludge, we definitely appreciate the effort where una they make for both faith this corona sick na the country. So we as citizens need for pledge with loyalty and love by way how we not go cover anything or put on parting them we go embark the faith against the sick. This is coming from Desmond Jabati na both city.
One love LJ Ackman article for you. God bless from somebody no puts in name. Well, these are the messages then we'll take for now and we'll see how best we'll go back to then we'll get there and then they represent the one project mic, one mic project, is it? I wanna call them?
Project One Mic.
Project One Mic, okay, yes. Me scripts escaped me, but it's Project One Mic and so I don't get a couple of messages, but most of them complimenting the messages and but it's as if people and they appreciate it already. So what's gonna be a response?
Well, first of all, one for say thank you to all the viewers, the listeners, And thank you guys too for all the positive text messages them for being part of this whole program. And I believe that today not will be the last zone. I will see we will continue for the updates on how much we have the try for play a role on this whole pandemic. Yeah, as we all mentioned earlier on, the most important thing about this whole movement, it's about letting you guys understand about this corona and how to take on our precautions and very seriously, and how for let for be ignorant as far as we not for believe say this happen, it happen, yeah, it happened. So yeah, one for me continue for the telling a plenty thank you, especially the areas that we will visit today. One for emphasize on social distancing, very important in this case. Also, like I said earlier, if you feel any type of way where you know say you no feel, make sure you call 117. Feel free. Then people are so they purposely for you for come at your own door, for come at your door and help you out, man. So if I can tap here for now, I want for
somebody ask what you wanna observe during the lockdown, we wanna go out.
Well, the what you observe during this lockdown, it's crazy because one, you get the Ramadan going on, we can make things very boring, and you get a lockdown too.
Well,